active WHO right now to help win this fight and demonstrate to our citizens that we are working to prevent such catastrophes in the future. The United States sends our best wishes and open offer of cooperation to each of you in our shared efforts to defeat this pandemic and protect the health of each nation around the world.
Thank you very much. We will now invite Nigeria to be followed by Honduras. Nigeria, you have the floor, please. Nigeria, Honorable Minister, are you with us? Okay. Could we kindly move to Honduras to be followed by Zambia? Honduras, you have the floor, please.
En mi condición de secretaria de la Salud de la República de Honduras, mi país se complace en participar en la 73ª Asamblea Mundial de la Salud, una asamblea fuera de serie sin duda alguna que se ha llevado a cabo en tiempos en los que la solidaridad y la cooperación entre los países son más necesarios e indispensables que nunca. Hoy nos enfrentamos a desafíos sin precedentes. El reto más grande es disminuir el impacto en la salud y en la vida de las personas y a la vez disminuir los daños colaterales sobre nuestra economía y en los sectores más vulnerables. A medida que la pandemia se propaga por los países, es imperativo estrechar los lazos de cooperación y solidaridad, incluyendo los países que han desarrollado acciones exitosas, como China-Taiwán, que se ha convertido en un modelo para muchos Estados miembros. No dudamos que al incluirlos como socios, la OMS y los Estados miembros nos beneficiamos enormemente de su experiencia. Honduras reconoce el liderazgo excepcional de la Organización Mundial de la Salud en la respuesta y contención de COVID-19, ya que han estado trabajando mano a mano con nosotros en el abordaje de esta tremenda crisis sanitaria. Todos los países debemos aprovechar nuestras experiencias para construir respuestas globales basadas en capacidades y fortalezas de cada uno, pero en solidaridad y unión para avanzar y vencer todos juntos esta pandemia. Quisiera aprovechar esta oportunidad para rendir un homenaje a los trabajadores de la salud que en Honduras y en todos los países dedican su vida al cuidado de la salud de la población. Ellos merecen que centremos nuestros esfuerzos en continuar facilitando las condiciones para que estén protegidos mientras desarrollan su trabajo. Para ello es necesario la solidaridad de todos los países y de la industria en general. Muchas gracias.
Thank you very much. May we now invite the Minister of Health for Zambia to be followed by Cuba. Zambia, you have the floor.
Mr. President, honorable ministers, distinguished ladies and gentlemen, Zambia, the stewardship of the Republican President, His Excellency Dr. Edgar Chagolungu, has been her health system to reposition universal health coverage anchored on primary care. In this transformation agenda, public health security is a high priority for us and led to the birth of the Zambia National Public Health Institute, which is the technical arm that oversees the surveillance, epidemic preparedness, and response. In response to the COVID-19 outbreak, Zambia activated the Public Health Emergency Center and set up the incident management system. A COVID-19 response plan based on the whole government, whole society collaborative approach has been crafted that seeks the delicate balance between allowing key areas of the economy to run while abating a public health crisis. The response focuses on surveillance, case detection, health management, diagnosis, infection prevention and control, human capital enhancement, and risk communication and engagement. At this effect, Zambia has recorded 761 cases of COVID-19, with 7 related deaths and 192 recoveries. Zambia calls for perpetuated solidarity and unity of purpose. Let the world increase resources to enhance expansion of laboratory testing platforms, full procurement for PPEs, and invest in research for vaccines. Zambia appreciates the role God organization has played and the leadership of Dr. Tedros in pitching universal coverage and health emergencies at the apex of the global health agenda. We further thank all the health workers globally that have battled COVID-19 at the front line and pay our respect to all those who paid the ultimate price. Finally, Zambia reaffirms its call for health system strengthening, for universal health coverage, and enhanced efforts to fight HIV/AIDS, TB, malaria, NCD, maternal deaths, and child deaths. Together, we can defeat COVID-19, push the UHC agenda, and make the world a safer place to live in. I thank you.
Thank you, Honorable Minister. We will now invite Cuba to be followed by Brazil, Peru, and Panama. Cuba, you have the floor, please.
Muchas gracias, señora Presidenta, estimado director Tedros, distinguidos ministros y ministras de salud, delegados. La COVID-19 es un reto global que no distingue fronteras, ideologías o niveles de desarrollo. Ha puesto a prueba los sistemas sanitarios de todo el mundo, así como nuestra capacidad de respuesta ante eventos epidémicos. Cuando en Cuba se diagnosticaron los primeros casos, el pasado 11 de marzo, ya se aplicaban medidas del Plan Nacional elaborado en consonancia con los protocolos y buenas prácticas de la Organización Mundial de la Salud. Su seguimiento diario ha permitido reforzar la vigilancia epidemiológica, garantizar el diagnóstico temprano y el tratamiento oportuno de la enfermedad en esta, la mayor de las Antillas. Su implementación se apoya en un sistema de salud gratuito y resiliente, con un indicador de 9 médicos por cada 1.000 habitantes que permite un 100% de cobertura de la población. También en una industria médico-farmacéutica y biotecnológica con productos novedosos para el tratamiento de la enfermedad, como el interferón alfa-2B, los anticuerpos monoclonales, el péptido 6GB258 y el sulfacén. Gracias a ello, se ha logrado que el país esté actualmente en un escenario favorable en el enfrentamiento a esta pandemia. Sin descuidar en ningún momento la responsabilidad de proteger a nuestro pueblo, no hemos abandonado la vocación solidaria de la Revolución Cubana. Más de 2.300 colaboradores, organizados en 26 brigadas del contingente Henry Reed, contribuyen hoy en la lucha contra esta enfermedad en 24 países. A ellos se suman los más de 28.000 profesionales de la salud que ya se encontraban en 59 naciones. Este gesto solidario no han podido impedirlo ni el genocida bloqueo impuesto por el gobierno de los Estados Unidos contra Cuba, cruelmente recrudecido, ni los intentos de la administración de ese país para desacreditar y obstaculizar la cooperación médica internacional cubana. Señor presidente, ningún país por sí solo puede enfrentar esta pandemia. Se requiere de una respuesta mundial sobre la base de la unidad, la solidaridad y la cooperación multilateral renovada. Cuba reitera a la OMS y a sus Estados miembros la disposición de cooperar y compartir nuestras modestas experiencias. Muchas gracias.
Thank you very much. May I now invite Brazil to be followed by Peru.
Okay. Director General, honorable ministers, ladies and gentlemen, good afternoon. First of all, I'd like to express my deepest solidarity to all families in the world, especially in Brazil, for their losses due to COVID-19. The coronavirus pandemic brought a challenging reality for the entire world. Brazil has organized its response within two macro structures. The Crisis Committee, coordinated by the Presidency, and the Emergency Operational Committee coordinated by the Ministry of Health. The mission of the first one is monitoring and coordinating inter-ministry measures. And the mission of the second one is defining health strategies and actions related to this public health emergency. As we know, Brazil has a continental dimensions and important regional difference that require appropriate strategies to respond to each of them. Through dialogue with the three levels of governance, having focus on the north and northeast regions of the country that has some particular challenges. The federal government daily assess the risk situation, supports states and cities with the necessary resources to mitigate the effects of the pandemic. In addition, the Ministry of Health has been adjusting its protocols based on evidence and on the needs of most affected places. I would like to express my deep respect and thanks to all health professionals and people involved in the frontline response. Finally, I'd like to reinforce Brazil's commitment to support and to participate in international initiatives, such as the Solidarity Trial, which reinforces international cooperation and seeks to guarantee universal access to diagnosis, treatment, and vaccines, allowing us to save lives and safely return to normal, leaving no one behind. Thank you.
Thank you very much, Minister. May we now invite Peru to be followed by Panama and Costa Rica. Peru, you have the floor.
Muchas gracias. El Perú expresa sus condolencias a quienes han perdido seres queridos en la pandemia y el mayor reconocimiento a la valerosa entrega del personal de salud, mayoritariamente mujeres, en el mundo. Enfrentamos una crisis global que requiere de una respuesta global. Por ello, el Perú reitera su firme compromiso con el multilateralismo y con sus instituciones. Reconocemos el gran esfuerzo de la Organización Mundial de la Salud y creemos necesario reforzar su mandato para enfrentar a las pandemias y coadyuvar en el fortalecimiento de los sistemas sanitarios y las capacidades de preparación y respuesta a nivel nacional, regional y global. La gravedad de esta tragedia mundial nos obliga a considerar los tratamientos, tecnologías médicas y una eventual vacuna contra el COVID-19 como bienes públicos globales que deben ser accesibles a todos de manera oportuna. Rechazamos tajantemente las prácticas que vulneran las reglas del comercio internacional, como son las expropiaciones de productos médicos. A nivel nacional, además de haber declarado la emergencia sanitaria, hemos implementado acciones para reforzar la prevención, control, vigilancia y respuesta, que suponen un esfuerzo económico sin precedentes que representa más del 12% del PBI en el país, priorizando reducción de brechas de acceso al servicio de salud, implementación de medidas de contención sanitaria, otorgamiento de beneficios monetarios directos a las poblaciones más vulnerables y medidas para reactivar la actividad económica. Los desafíos para lograr la cobertura sanitaria universal y alcanzar los objetivos de desarrollo sostenible se incrementan y la cooperación internacional sigue siendo necesaria para complementar los esfuerzos nacionales, incluidos aquellos de los países de renta media alta como el Perú, teniendo presente la promesa de no dejar a nadie atrás. Muchas gracias.
Thank you, Honorable Minister. We would invite Panama and then followed by Costa Rica. Panama, you have the floor. Panama? Okay, we would invite Costa Rica to take the floor. Costa Rica, you have the floor.
Una de las decisiones más acertadas que han tomado los diferentes países en términos de salud fue, en el marco del sistema de Naciones Unidas, conformar una organización mundial que busca proteger y mejorar la salud de los pueblos. La Organización Mundial de la Salud ha sido ese organismo que en las últimas décadas ha sabido liderar a nivel político y técnico a todos los países en la toma de las mejores decisiones posibles para ese fin. En medio de la coyuntura tan difícil, lo que representa la pandemia del COVID-19, se hace necesario que demos un paso más y que logremos concentrar toda la tecnología, todos los conocimientos, todos los insumos posibles en un repositorio universal de patentes para que todos los países podamos hacer uso de todos esos conocimientos. Esta pandemia va a durar muchos meses más y este mecanismo que permite una actitud altruista para que todos podamos salir adelante en medio del COVID-19 se hace sumamente necesario, y no solamente por un tema de salud, sino incluso por un tema humanitario. Nosotros esperamos y confiamos en que la OMS seguirá fungiendo en ese liderazgo tan importante para todos los países como ese faro en salud que va dando todas esas políticas y lineamientos para salir adelante en ese tema tan importante.
Thank you very much, Costa Rica. We will now invite Ecuador to be followed by Sri Lanka, Israel, and Barbados. Ecuador, you have the floor. To have Ecuador. We would invite Sri Lanka, followed by Israel. Sri Lanka, you have the floor. Sri Lanka, you have the floor, please. Okay, we would invite Israel to take the floor. Israel, you have the floor.
Members, Excellencies, Israel would like to express its sincere appreciation for the tireless effort of all frontline workers, including medical teams, and to the WHO supporting and coordinating the response to COVID-19. We would like to emphasize the imperative role of multilateral and global cooperation in responding to this pandemic, and the importance of access to information as well as provision of meaningful contribution by all stakeholders in addressing this global challenge. Israel was one of the first countries to take steps to prevent the spread of the virus. After the first case was confirmed, Israel issued travel warnings and restrictions and introduced self-isolation requirements. These early steps proved effective and ensured that the health system would not be overburdened. It also allowed for the launch of exit strategy on May 3rd, including gradual reopening of the educational system and the economy. Recognizing that COVID-19 does not distinguish between people and its public orders, Israel has strengthened its cooperation with the Palestinian Authority in order to mitigate the virus effect and provide the necessary means, guidance, and medical supplies. This fruitful collaboration was reaffirmed and commended by the UN Secretary General as a positive example of fighting the virus together. Excellency, we reflect our commitment to strengthening the cooperation to effectively address the current global challenge. We are confident that global collaboration, the sharing of knowledge, and necessary means in the spirit of protecting human life and leaving no one behind is the right path to overcome this crisis successfully. Thank you.
Thank you very much. I would invite Georgia to be followed by Barbados and then Turkey. Georgia, you have the floor, please.
Sehr geehrte Frau Präsidentin, sehr geehrte Nachrichten, ich möchte mich die Möglichkeit nutzen und mich vor allem für diese große Mühe im Kampf gegen Covid-19 und diese Solidarität bedanken. Ab Januar hat die georgische Regierung strenge Maßnahmen gegen die Verbreitung von Covid-19 durch die Nutzung der Maßnahmen soziale Distanzierung, Mobilisierung medizinischer Behörden und Gründung der Programme für Fieber und auf dem Niveau des primären Gesundheitsschutzes eingeleitet. Eine der Hauptfaktoren unserer Erfolgs bestand in raschen Reaktionen und Präventionsmaßnahmen, wobei die zielgemäße Testung, Isolierung sowie Behandlung aller möglichen Fälle im Fokus stand. Die technologischen Mittel ermöglichten uns die Fortführung des Lernprozesses an den Schulen und Hochschulen. Wir unterstützen auch Online-Arbeitsplattformen. Wir gründeten besondere Applikationen Stop Covid zum Schutz der Gesundheit unserer Bürgerinnen und Bürger. 20% unseren Territoriums. Daher hatte die zentrale georgische Regierung leider keine vollständige Information über die Epidemiesituation der besetzten Region, Abchasien und Trinvali. Die Information seitens der Okkupationsregimes entspricht nicht der Realität. Die zentrale Regierung
we don't have interpretation for the language you're using.
Auf dem besetzten Territorium durch die Unterstützung von UNO und weiteren internationalen Partnern zu unterstützen. Einheitliche und koordinierte Handlung der Regierung sowie die entsprechenden Behörden ermöglichten uns, die Infektion einzudämmen und Virusfälle zu minimieren. Die Pandemie zeigte uns noch einmal, wie wichtig die primäre medizinische Hilfe, Entwicklung regulierenden Rahmen der Infektionskontrolle sowie unseren Programmen für die Verwaltung der Immunisierung und chronischer Krankheiten ist, um die Anzahl chronischer Krankheiten zu minimieren.
Thank you, Honorable Minister. We would give the floor to Barbados, and I understand Sri Lanka is back online, so we'll give the floor to Sri Lanka after Barbados. Barbados, you have the floor, please. We don't appear to have Barbados. Could we kindly ask the Minister of Sri Lanka to deliver his statement? Honorable Minister, you have the floor.
At the outset, on behalf of the government of Sri Lanka, let me appreciate the leadership of Dr. Tedros, Director General of WHO, for excellent guidance provided during this challenging time of COVID-19. Excellencies and distinguished delegates, Sri Lanka is one of the few countries in the world with free healthcare and education, both of which have been national priorities of decades. Sri Lanka has established primary healthcare infrastructure. With this infrastructure, we were able to reach many milestones such as universal immunization, exclusive breastfeeding, elimination of pollution, to mention among many. Sri Lanka scores higher than the East Asia regional average in healthcare, having a high life expectancy and a lower maternal and death rate. Sri Lanka is having one of the lowest earliest healthcare system and has its own indigenous medicine system. Let me mention the progress we have made in healthcare delivery since the last WHA on selected programs due to time limitation. Our intervention to address non-communicable diseases are continued. The prevention detection program for NCD is being further strengthened by adding more healthy lifestyles. Currently, we are practicing the traffic light system for sugar, salt, and fat for confectionery. I am honored to talk about malaria in Sri Lanka since the World Health Organization certified Sri Lanka as malaria-free. We are continuing to maintain the status of preventing the introduction of malaria. Before concluding, I would like to emphasize about the present pandemic of COVID-19 while giving attention to controlling COVID-19. We are determined to provide our continuing care for another disease, ensuring smooth conduct of healthcare services in Sri Lanka. Let me conclude by saying Sri Lanka is committed to share our experience, always from best practices to save lives, and finally to control the pandemic together with the global public. Thank you.
Thank you very much, Honorable Minister. May we now welcome the Honorable Minister of Turkey. Please, you have the floor. Honorable Minister from Turkey. Okay. We would go to Honorable Minister from Ghana, to be followed by Bangladesh. Ghana, you have the floor. Honorable Minister from Ghana, you have the floor. Right. We would move to Bangladesh, followed by Chile. Honorable Minister from Bangladesh, you have the floor, please. We don't appear to have Bangladesh online. Could we now move to Chile, to be followed by Malaysia? Chile, you have the floor, please.
Estimado señor presidente, doctor general, doctor Tedros, ministros, embajadores, delegados. El mundo atraviesa por momentos difíciles, qué duda cabe. En este sentido, la pandemia del COVID-19 nos empuja a la acción más que a las palabras. Los efectos económicos, sociales y particularmente sobre los sistemas de salud se materializan dolorosamente en todos los países, afectando desproporcionadamente a los adultos mayores. Este cuadro, en nombre de Chile, quisiéramos reconocer y agradecer el esfuerzo de los trabajadores de la salud, de los cuidadores y así como también la labor de apoyo y orientación que la OMS ha brindado en momentos en que la solidaridad y la colaboración internacional son claves. También quisiéramos agradecer a la Unión Europea por el esfuerzo de construir conjuntamente un documento de resolución que identifica desafíos y propone soluciones a las dificultades provocadas por la pandemia del COVID-19. Asimismo, apoyar igualmente a Costa Rica por su llamado a la acción para garantizar un acceso equitativo a tecnologías sanitarias, el intercambio de conocimientos, propiedad intelectual y datos necesarios para la detección, prevención, tratamiento y respuesta del COVID-19. Junto con hacer llegar sus condolencias a las familias por las lamentables muertes de sus seres queridos, Chile quisiera aprovechar esta oportunidad para renovar su compromiso con el multilateralismo y la cooperación entre países. Vemos la necesidad urgente de reforzar la arquitectura global del multilateralismo y en particular la de la salud global. Esta situación de extrema gravedad a la vez abre una oportunidad única para reforzar la gobernanza y repensar cómo queremos que nuestros pueblos vean el sistema multilateral, más ágil, efectivo, robusto y transparente en la toma de decisiones globales. El esfuerzo y consenso multilateral que se plasma concretamente en la Agenda de Naciones Unidas para el Desarrollo Sostenible debe continuar siendo una hoja de ruta global. Es por ello que debemos sumar nuestros esfuerzos para preservar y fortalecer el sistema multilateral durante esta crisis y para beneficio de las generaciones futuras. Muchas gracias, señor presidente.
Thank you very much, Minister. I understand Turkey is now ready to make their statement. Turkey, you have the floor, please.
Honorable Chair, esteemed Director General, distinguished delegates. We have been going through different times in which we are facing the harsh reality of many issues that we have talked about in theory. We have echoed concepts such as universal health coverage and preparedness to health emergencies at World Health Assemblies. The COVID-19 pandemic has put both our national health systems and global health management to a difficult test with regard to these concepts. Regardless of development level, this test has brought to light which country has better infrastructure and how its health system was designed. As policymakers, we should be able to properly analyze the results of this picture and take sound steps. Only then we will be able to contribute to a safer future both nationally and globally. Turkey has been one of the countries which detected cases the most rapidly and took an important step by starting treatment at an early stage centrally. Thus, it is among the best performing countries in terms of mortality rate and burden on the healthcare system. Thanks to the measures taken, Turkey was able to delay the arrival of the virus for 3 months and use this time to prepare its hospitals and healthcare system for the outbreak. Occupancy rate in our hospitals is still below 40% and below 60% in our intensive care units. Turkey is one of the few countries providing all services to its citizens free of charge under universal health coverage. We are always ready to exchange knowledge and experiences. While we mourn for the ones we have lost, I believe that we should not waste this historical opportunity COVID-19 is offering us with conflicts and disagreements. With this in mind, I would like to emphasize that Turkey will be a part of the global solidarity and the global quest to find solutions. I would like to thank you and wish you all a fruitful assembly.
Thank you very much, Honorable Minister. We understand Bangladesh is online. Honorable Minister, you have the floor.
Our commitment to stand together in the spirit of global solidarity to defeat COVID-19. Let me express our condolences and sympathy to all the families of the victims of COVID-19. We thank Dr. Tedros and his team for their continued tireless efforts during this global crisis. Mr. President, our government is responding to the pandemic under able leadership of Honorable Prime Minister Sheikh Hasina. We have adopted a whole of the government approach in Bangladesh. We developed a national preparedness and response plan for COVID-19 in line with WHO SPRP. Mr. President, I have 5 points to make today. First, we need new thinking on human well-being, tackling inequality, supporting the poor, and getting our economies back on track. Second, the due assistance should be rendered to low and middle-income countries to fight the pandemic. Third, equitable and affordable access to medicines and vaccines must be ensured once those are available. Fourth, we need to develop innovative and digital health solution to prepare for the future. Finally, we must not forget our commitment to achieve SDGs, including universal health coverage, and to ensure improved nutrition for all. Mr. President, 2020 is a special year to our nation as it marks the birth centenary of our father of the nation, Bangabandhu Sheikh Mujibur Rahman. Eradicating COVID-19 could be the best gift to our nation and to the world on this historic occasion. Thank you very much.
Thank you, Honorable Minister. I also understand that the Minister of Health for Ghana is now online. We would welcome him and then give the floor to Malaysia. Honorable Minister, you have the floor, please.
As President of the 73rd World Health Assembly, the first ever meeting of the Assembly to be held virtually. I also wish to commend the Director General, Dr. Tedros, for his detailed and instructive address on how the WHO is coordinating global response to the COVID-19 pandemic. Ghana's national response is an all-of-government approach based on our universal health coverage roadmap with a well-defined, integrated governance structure chaired by His Excellency, the President, Nana Addo Dankwa Akufo-Addo. Underpinning the COVID-19 response plan are 6-point strategic objectives: limit and stop importation of cases by mandatory quarantine and border control measures, detect and contain cases by identification, testing, and isolation of cases, which will allow for effective containment, slow down community spread by putting social distancing measures in place to slow down spread of virus, care of the sick by preparation to provide health care and appropriate health interventions at all levels, minimize disruption to the social and economic life of Ghanaians, especially the vulnerable, and domestic capacity and self-reliance, increase the domestic capacity of all sectors, deal with existing and future shocks in line with the government's policy of Ghana Beyond Aid. Since Ghana recorded its index case on March 12, a total of 5,638 cases have been confirmed, with 1,460 recoveries and 28 deaths as of May 17, 2020. The enhanced testing strategy, currently about 165,000 tests, has proven to be effective. Ghanaian scientists are working to determine the strains circulating in Ghana to inform treatment options. On global response to the pandemic, Ghana affirms the importance of multilateral cooperation and global solidarity. We call for scale-up of research and development for medicines, therapeutics, and vaccines to address supply constraints. We also affirm the central role of WHO in leading and coordinating global response to the pandemic. I thank you very much.
Thank you very much, Honorable Minister. May I now invite the Minister of Health for Malaysia, followed by Saudi Arabia and Jordan. Malaysia, you have the floor, please.
Greeting from Malaysia. Firstly, we wish to express our appreciation to WHO for the assistance and response to the COVID-19 pandemic. We acknowledge the fast action in mobilizing funds and linking member states with dialogue sessions and development partners, in addition to the regular exchange of information virtually amongst member states coordinated by WHO. We are all aware that this COVID-19 pandemic has impacted so many socio-economic sectors across the spectrum. Livelihood of people have been struck hard by this disease. Malaysia agrees that people in vulnerable situations are at risk the highest. The government of Malaysia has prioritized sufficient financing to contain this pandemic and to protect our people. This has been done by mobilizing funds, namely the economic stimulus package, targeted toward these vulnerable households as they have been hit the hardest during this COVID-19 pandemic. We have learned that community engagement assures us that success of our national control measures against COVID-19. The government of Malaysia had implemented a movement control order in mid-March, and this has been scheduled to go on till 9 of June 2020. In embracing the spirit of leaving no one behind in the universal health coverage, we have conducted targeted health screening approach for our migrant population, regardless of citizenship status residing in Malaysia. The government of Malaysia recognized that during this period of social distancing and avoidance of mass gathering, digital connectivity is of paramount importance. We have ensured that our people are well updated daily through strategic risk communication by relaying latest COVID-19 update. As we adjust ourselves to the new normal and social distancing, it is timely to strengthen the regional cooperation that we have as we need to plan ahead for the post-pandemic era. As traders and businesses look forward to reopening their business, we request utmost cooperation from our communities, and this can only be done by educating them with facts and evidence. Malaysia is happy to cooperate in research and development of medicine and vaccine to enhance our capabilities in both prevention and treatment of COVID-19. Malaysia is part of WHO Solidarity Trial and look forward to a promising outcome. Ultimately, we are all fighting against the same enemy, and with unity and good regional cooperation, we will win this. At the end of this holy month, it is finally here to grace us with happiness and prosperities. Hence, Malaysia would like to take this opportunity to wish all our Muslim colleagues and friends Eid Mubarak. Thank you very much.
Thank you, Honorable Minister. I will now invite the Minister from Saudi Arabia to be followed by Jordan and China. Minister, you have the floor, please.
رئيس منظمة الصحة العالمية، الحضور الكرام، نجتمع هذا اليوم في ظروف استثنائية لم نشهد لها مثيلا، وضعتنا جميعا أمام اختبار شديد تظهر فيه أهمية التعاون والعمل الجماعي. إن تجاوز هذه الأزمة يتطلب استجابة عالمية عاجلة واستثنائية، حيث أن مسؤوليتنا الأولى هي ضمان حماية شعوبنا من الأمراض واتخاذ أقصى التدابير الممكنة للقضاء عليها. وعلينا كمجتمع دولي أن نتخذ إجراءات جريئة وفورية للحد من فقدان الأرواح وتسريع الجهود المبذولة لاحتواء الأثر الكارثي الذي يخلفه الفيروس على الإنسانية. لقد اتخذنا في المملكة العربية السعودية على الصعيد الوطني وعلى أعلى مستوى في قيادة الدولة ومنذ مستوى مبكر جدا خلال أزمة كوفيد-19 إجراءات وقرارات وخطوات احترازية غاية في الأهمية، وكان لهذا التحرك المبكر الأثر الواضح في تأخير دخول المرض إلى المملكة، مما قلل كثيرا من الآثار المترتبة على الجائحة، ونتج عن ذلك الانخفاض الملحوظ في معدل الوفيات الناتجة عن كوفيد-19 والقدرة العالية للنظام الصحي على الاحتواء داخل المنشآت الصحية. كما اتخذت المملكة العربية السعودية خطوات فعالة ومبكرة في مجال التعاون مع المجتمع الدولي للتصدي لجائحة كوفيد-19، وقد ارتكزت كل الخطوات على الالتزام التام باللوائح الصحية الدولية، استجابة لنداء القادة في مجموعة ال20 خلال القمة الافتراضية للقادة في 26 مارس بسد الفجوة التمويلية الحالية لمواجهة جائحة كوفيد-19. فقد بادرت المملكة العربية السعودية بالمساهمة بمبلغ 500 مليون دولار أمريكي لمساندة الجهود الدولية في التصدي لجائحة فيروس كورونا المستجد كوفيد-19، ومن ضمنها منظومة الصحة العالمية. تم تخصيص مبلغ 80 مليون دولار أمريكي لصالح أنشطة الاستجابة لحالات الطوارئ العالمية وتطوير النظم الصحية والتدريب، ودعم أنظمة الإنذار المبكر والاستجابة للأوبئة والجوائح استجابة للنداء الذي أطلقته منظمة الصحة العالمية. تقوم رئاسة المملكة لمجموعة ال20 تنفيذا لتوجيهات خادم الحرمين الشريفين بالعمل بشكل وثيق مع الجهات ذات العلاقة على تحديد الفجوات في الاستعدادات العالمية ضد تفشي الأمراض المعدية في المدى المتوسط والطويل، بهدف إنشاء مبادرة عالمية لمعالجة هذه الفجوات وزيادة الاستعداد العالمية ضد تفشي الأمراض في المستقبل. وفي المقابل فإن المهارات والقدرات الأساسية اللازمة لتطوير اللقاحات والأدوية للأمراض الناشئة لا تزال بحاجة إلى تطوير واختبار وإطلاق لقاحات وأدوية نوعية تسهم في تقليل وطأة المرض وتقليل آثاره البشرية والاقتصادية والاجتماعية. وحتى لو توفرت هذه الوسائل فإن ضمان وصولها للجميع هو مهم جدا. وفي الختام، لكي نتعامل مع الأوبئة المستقبلية بفعالية علينا أن نستثمر في تعزيز أنظمة التأهب والاستجابة لدينا، بحيث نكون باستعداد أفضل للاستجابة لها وإنقاذ أرواح الناس والحفاظ على رفاههم. شكرا لكم.
Thank you very much, Minister. I invite Jordan to be followed by China, Lebanon, and Sweden. Jordan, you have the floor, please.
مساء الخير أصحاب المعالي، أنا الدكتور عدنان إسحاق مساعد الأمين العام للرعاية الصحية الأولية. سألقي هذه الكلمة نيابة عن معالي وزير الصحة الدكتور سعد جابر، والذي يبلغكم أشد الاعتذار لعدم تمكنه من الحضور. يأتي انعقاد أعمال هذه الدورة بظروف استثنائية نتيجة انتشار جائحة كورونا في معظم دول العالم، وما خلفته هذه الأزمة من تداعيات سلبية على جميع مناحي الحياة وبخاصة على الاقتصاد العالمي. ونحن في الأردن بعد أن تم تسجيل أول إصابة بكوفيد-19 تاريخ 2 آذار 2020، وقد تم سن قانون الدفاع الوطني بتاريخ 17 آذار وتفعيل حالة الطوارئ لاحتواء تفشي جائحة فيروس كورونا. وتبنت الحكومة إجراءات صارمة للتصدي لخطر هذا الفيروس الجديد، تمثلت بإغلاق المطارات والمدارس والجامعات والمعابر الحدودية الجوية والشركات الخاصة والخدمات العامة غير الأساسية.
Honorable Minister, I'm sorry to interrupt you, but it appears we don't have interpretation at the moment. Could we ask you to restart? Apologies for that. We missed out on your statement due to lack of interpretation. Sincere apologies. Please start again if you may.
Okay. وبفضل القيادة الحكيمة لجلالة الملك عبد الله الثاني الذي وجه الحكومة بالتعامل مع المرحلة بكل جاهزية والتحضير لما بعد الأزمة، حيث وجد الأردن نفسه أمام خيارات صعبة في مواجهة هذا الفيروس، خاصة تأثيراته الاقتصادية التي باتت تهدد بإغلاق الكثير من الأنشطة وتقييد الحركة وارتفاع مخاطر الركود الاقتصادي في الربع الثاني من العام الحالي. وكان قطاع السياحة من بين أكثر القطاعات تضرراً في المملكة نتيجة جائحة كورونا. ويفكر الأردن جدياً في استئناف عمل جميع القطاعات الاقتصادية بعد أن تم احتواء هذا الوباء، ولكن ستواكب عودة النشاط الاقتصادي في الأردن استمرارية العمل والتقيد بإجراءات السلامة العامة التي تتضمن استخدام وسائل الوقاية الشخصية والحد من تفشي المرض والحفاظ على قدرة القطاع الصحي على الاستجابة والاستمرار إجراءات التقصي الوبائي وزيادة الفحوصات العشوائية في مختلف المواقع وللفئات الأشد خطورة، وتكثيف الفحوصات للقادمين من خلال المعابر الحدودية وإجراءات الحجر الصحي للمشتبه بهم، وعزل المرضى الذين يصيبهم هذا الوباء في المستشفيات المخصصة لهذه الغاية. وشكرا.
Thank you very much, Honorable Minister. I would invite China to be followed by Lebanon. China, you have the floor.
尊敬的各位部长、各位代表，大家好！感谢谭德赛总干事的报告。我谨向全球 因新冠肺炎不幸罹难的人们致以深切哀悼，向奋战在一线的医务人员致以崇高敬意。中国政府始终坚持把人民生命安全和身体健康放在第一位。习近平主席亲自指挥、亲自领导、亲自部署，我们坚持早发现、早报告、早隔离、早治疗，集中患者、集中专家、集中资源、集中救治，付出巨大努力和牺牲。目前，疫情本土传播已基本切断。新冠病毒是全人类共同的敌人，中国始终本着及时、公开、透明和负责任的态度，第一时间向国际社会通报疫情，分享病毒基因序列、引物和探针，与各国同行开展技术交流。我们铭记国际社会的宝贵支持，力所能及地向有需要的国家提供物资和技术援助，积极参加世卫组织加快新冠肺炎疫苗和药物研发、生产和公平分配的全球合作倡议。各位部长，各国利益紧密相连，人类命运休戚与共。我们呼吁各方团结一致，支持世卫组织发挥领导作用，坚决反对谣言、污名化与歧视，携手帮助卫生体系脆弱国家提高应对能力。只要我们同舟共济，一定能够战胜疫情，并向实现健康相关的可持续发展目标不断迈进。谢谢。
Thank you very much, Minister. We understand Germany is now ready to take the floor. We would give the floor to Germany, and then we'll go to Lebanon. Germany, you have the floor, please.
Thank you, Chair. Director General Dr. Tedros, ladies and gentlemen. COVID-19 is the biggest challenge of our time. Many consequences are still unclear, including adverse long-term effects, such as inadequate care to combat other diseases, negative effects on vaccination programs, or economic consequences that affect the financing of health systems. Vaccination and medication has to become available to all mankind. Future vaccines against COVID should be seen as a global public good. I expect WHO to ensure a proper implementation of the equitable access principle. Global health security has already improved a lot through the Contingency Fund and the WHO's Health Emergency Program, to which Germany will double its contribution to €50 million. But further strengthening and reform is needed. WHO should be a place for all relevant players who are able to contribute experiences in successfully fighting COVID-19. WHO must become more independent from external interference. WHO needs a substantial increase of assessed contributions for a sustainable financing of its emergency program. Important questions remain. How can we incentivize states to comply with their international health regulation obligations, including reporting outbreaks? Multinational experts need to be able to carry out independent investigations into outbreaks as quickly as possible. After the pandemic, we need to make sure that the world is best prepared to respond to future pandemics. The world needs an extensive lesson learned process. This also implies the world-leading health organization. We need to further strengthen WHO's leading and coordinating role. Therefore, as a joint initiative with France and other European countries, we will pool our global health expertise to provide guidance to WHO for the needed review of the global health security structures, including the WHO Emergency Program and the International Health Regulation. The COVID-19 response will be the key health theme for the German EU presidency starting in July. The EU has to play a crucial role in reforming the global health security landscape. Germany fully supports WHO. It is my pleasure to announce a total amount of €176 million for WHO's programmatic work, the response plan, and efforts to develop and equitable distribute of a COVID vaccine. Thank you.
Thank you, Honorable Minister. We will move to Lebanon, followed by Sweden, and then I'll yield the floor to the President of the Assembly. Lebanon, you have the floor, please.
السيد رئيس الجمعية العامة في دورتها 73 المحترم، السيد المدير العام لنظم الصحة العالمية المحترم، السيدات والسادة الرؤساء وأعضاء الوفود المحترمين، أنه من دواعي سروري أن أخاطبكم عبر هذا التسجيل حول موضوع السنة المتعلق بجائحة كورونا المستجد الذي وعلى خطورته جمع الحامل حول قيم أساسية من أهمها التكاتف والتعاون الإنساني للتغلب عليه وإنقاذ البشرية جمعاء. أستهل حديثي بشكر منظمة الصحة العالمية على جهودها في دعم البلدان لمواجهة هذه الجائحة. إننا وعلى الرغم من الضائقة الاقتصادية التي نمر بها بوطننا عملنا بحسب توجيهات منظمة الصحة العالمية واستطعنا احتواء المرض بنجاح، ونحن على الطريق الصحيح لتصحيح المنحنى. حتى تاريخه عدد الحالات المثبتة مخبريا في لبنان 900 حالة وعدد الوفيات 26. مع ذلك لازلنا في مرحلة الخطر المتمثل بعودة المغتربين من دول لم تستطع السيطرة على الوباء مع اتخاذ كافة التدابير الآيلة إلى ضمان صحة الوافدين والمجتمع المقيم. بدأنا منذ فترة برفع عدد الفحوصات المخبرية من حوالي 200 فحص باليوم إلى حوالي 2000 فحص باليوم، وذلك بأخذ عينة من جميع القادمين من السفر والمخالطين والحالات المشتبهة أو التي تعاني من عوارض تنفسية. إننا ندعو للمزيد من التضامن الدولي، ليس فقط لمساعدة الدول على تحمل أعباء المرض بل أيضا لمساعدة جهود الأبحاث لإيجاد اللقاح في أقرب وقت ممكن، ونعول على منظمة الصحة العالمية كما عهدنا على دعمها اللوجستي والتقني لتمكين قدرات بلدنا للاستمرار بمواجهة هذا الوباء الخطير وتخطي هذا الوقت العصيب. وشكرا.
Thank you, Honorable Minister. We would now give the floor to the Minister from Sweden, and then we'll pass the floor to the President of the Assembly. Sweden, you have the floor.
Director General, Excellencies, Sweden aligns itself with the statement made on behalf of the EU and its member states. I want to express Sweden's strong support and appreciation for WHO's crucial role and irreplaceable leadership in this pandemic. Now, maybe more than ever, is the time to strengthen our international cooperation and show global solidarity. Sweden strongly supports the COVID-19 resolution, which aims to ensure equitable and timely access to quality, safe and affordable vaccine. Until we have a vaccine in place, the most important thing we can do is staying safe and healthy. In doing so, we need to ensure everyone's access to uninterrupted, affordable, essential health services, including sexual and reproductive health and rights, as well as mental health services. Vulnerable groups tend to suffer the most in crisis and the aftermath. The importance of achieving universal health coverage cannot be stressed enough. In its response to COVID-19, Sweden has benefited from having a universal welfare state, which includes a healthcare system and a social protection system that is needs-based and accessible for all. We have not yet seen the full effects of COVID-19 in Sweden or globally. This pandemic has once again reminded us on the importance of investing in resilient health systems and emergency preparedness. We should always invest in humans by investing in their health. Thank you.
Thank you very much, Honorable Minister. Honorable Ministers, we would take some interventions from the President of the Assembly, and then we'll come back to the list of speakers. Thank you very much.
Honorable delegates, I wish to seek your indulgence to make an adjustment to our speaking arrangements. Conscious that our session is moving forward with steady momentum now, and having given regard to the advice of our technical support team, I would like to suggest that we continue in session under this agenda item, but I would also note that perhaps we take a short break at 1800 for about 15 minutes. I note that some member states have indicated a strong preference for for certain speaking times. And the Secretariat will do their best to accommodate these requests. However, notwithstanding this, I think there is merit in continuing to make good progress on this agenda item with a view to concluding it this evening, including moving to adopt the associated resolution. And in that regard, delegations wishing to be added as a co-sponsor of the draft resolution on COVID-19, you may send an email to co-sponsorship@who.int. Let me repeat that, please. Co-sponsorship@who.int. You should do that before 20 Central European Time. That's 20 Central European Time. Now, I thought I should address delegates on a matter of rights of reply. I recognize that a delegation would like to exercise a right of reply. So, in accordance with Rule 57 of our Rules of Procedure, and as agreed in the special procedures, I will invite those delegations that request to exercise the right of reply to please do so at the end of this virtual meeting. I'll repeat it, please, at the end of this virtual meeting. I thought I should also make an intervention here. May I kindly request that in delivering a right of reply, delegations be as brief as possible, taking into account that at this meeting, interventions themselves are limited to 2 minutes. If delegations could kindly interpret the word brief relative to the time allotted for interventions themselves, it would be very greatly appreciated. And finally, if there are subsequent requests by delegations for additional spoken rights of reply concerning the same matter as previous replies, may I kindly request delegations to limit such spoken statements to 30 seconds or less. I hope delegations will understand that these requests are made in our common interests in the good order of our proceedings. So, yes, I'm getting further clarification here. The rights of reply at the end of the virtual meeting this evening. So does everybody get that? It's this evening, please. And I would just ask for everyone's cooperation. We only have 2 days, so thank you very much. I'll now turn over to the moderator. Thank you, sir.
Thank you, Madam President. We have the Minister of the Republic of Korea, and I understand the Minister of Algeria and Nigeria have also joined us, so we will go to Korea first, and then we'll take up our other 2 ministers who couldn't connect earlier. Minister, you have the floor, please.
Thank you, Chair. The post-COVID-19 era presents a transformational changes to our life and society. To return to our normal life and restore our economy amid these changes, we need a multi-sectoral and innovative efforts, and above everything, international cooperation. With that, I would like to make a few suggestions and respectfully ask for active cooperation from the international community. First, in order to secure the necessary and the sustainable social system, even amid the global pandemic, we should explore ways to ensure essential movement of scientists, health personnel, and the business people across board without undermining national efforts to prevent the spread of the virus. Secondly, we should enhance transparent and timely sharing of information, data, and knowledge on COVID-19. Korea has been sharing its response measures alongside characteristics and analysis of confirmed cases with the international community in a transparent manner. The country will continue to share its experience and knowledge with the world using various channels. Thirdly, we should actively take part in development and the distribution of treatment and vaccine for COVID-19. I highly recognize the launch of the access to COVID-19 tools accelerate. The international community should concentrate its political will to ensure that the efforts led by WHO to develop a vaccine and the treatment are translated into an adequate level of supply for everyone at a reasonable price. In addition, I would like to acknowledge with pleasure that Korea participated and made a pledge in the Coronavirus Global Response International Pledging Conference led by the European Commission. Although COVID-19 may have widened our physical distance, I'm sure it has brought us together closer than ever in the fight against this pandemic. Thank you.
Thank you very much, Korea. I will now invite the Minister of Nigeria to take the floor. Honorable Minister, you have the floor. Okay. We don't seem to have the Honorable Minister online. It's okay? Okay, thank you. Give the Minister a few more seconds.
Madam Secretary General, Madam President, Director General of the World, I bring greetings from the government and people of the Federal Republic of Nigeria. I congratulate you, Madam President, and other officials on your elections to chair the 73rd session of the World Health Assembly. I recognize the achievements of the World Health Organization under the able leadership of Director General Dr. Tedros Ghebreyesus and his agenda in the fight against the COVID-19 pandemic. Nigeria noted the escalating devastation wreaked on nations of the world since January 2020, the shocking loss of lives and damage to economies and livelihoods, even in countries with staunch health systems. We empathize with all families who lost loved ones in the pandemic. Well before the first case was imported into our country, we put up resources at our disposal for a robust preparedness and response plan. early screening with thermal cameras, and collection of health and travel history information from arriving passengers at all points of entry, and strengthening infection prevention and control measures, let us buy time to address health system gaps with the help of WHO partners and donors. Our first COVID-19 traveler had news on the 27th of February 2020, 2 days after arrival by air. From testing, identified him and the one contact out of 179 traced who was positive. Subsequent virus reports and the dramatic global spread underpin the extent to which all nations are connected. Our government set up a task force on COVID-19 in March to coordinate a multilateral effort to contain spread and mitigate impact on citizens' lives. The task force provides policy direction, sets priorities, and mobilizes resources to support and coordinate the national emergency operation. A 5-week lockdown was instituted in 4 high-burden states of Nigeria, which were the air gateways to the COVID-19 imported. The lockdown has since been relaxed to allow essential activities, but all land, air, and sea borders have been sealed, and only all but emergency and essential services. Nigeria is scaling up testing, surveillance, risk communication, isolation, and case management capacity. We also increased training to curtail infection in the line of duty. Non-pharmaceutical measures taken to reduce risk of transmission include closure of domestic air and rail passenger, prohibition of non-essential interstate road travel, and a nationwide curfew. Persons arriving in Nigeria undergo supervised mandatory 14-day quarantine. The use of cloth masks is mandatory for all persons when outside their homes, so as to leave medical-grade masks to frontline health workers. Personal protective equipment, diagnostic and medical devices, and kits have been supplied to healthcare facilities. Nigeria appreciates healthcare workers and has assured them hazard of bonuses and insurance. The COVID-19 pandemic has elicited new levels of collaboration between private and public sectors and among nations and agencies, which will hopefully help develop and transform health sectors around the world and bring together players in industry, banking, business, and philanthropy. Nigeria is participating in and supporting the World Health Organization-led solidarity programs and other research initiatives aimed at finding vaccines and developing treatment options. A National Economic Committee was set up to develop a comprehensive response to socio-economic disruptions and dislocation caused by COVID-19 and chart a way into the post-COVID-19 era. In this regard, Nigeria is already studying options to rebuild its health using all legislation. A state-sponsored stimulus package is to help micro business and small business enterprises to recover, and social palliative put up to palliate.
Sorry, it appears we've lost feed from Nigeria. We will proceed then to Montenegro, followed by Italy. Before we do, I'm instructed by the President to convey to honorable ministers to seek your kind indulgence to be as succinct as you possibly can. We understand that you do want to convey a lot of the things that you are doing in your country, but the President would like us to accommodate all the speakers that are on our list. So we will seek your kind indulgence, honorable ministers. Montenegro, you have the floor, followed by Italy. Thank you.
Okay. All right. Honorable of the World Health Organization, Director General Tedros, I would like personally continued support you provide countries such as Montenegro, especially for the support in these difficult to fighting COVID-19. Montenegro, its highest appreciation for your comprehensive report and for the WHO comprehensive response to the COVID-19 pandemic. I have the honor to speak on behalf of the 9 member states of the SEE Health Network who have associated themselves with this statement. Montenegro is currently holding the presidency within the Southeast European Health Network. We are all facing the new reality more than ever. The importance of partnership and solidarity is emphasized, and these are the principles that are embedded in the SEE Health Network founding document and our memorandum of cooperation. The COVID-19 pandemic has hit hard on the middle-income countries, revealing an essential value of health as an investment, not as an expenditure. Now, more than ever, the investment in the health system are crucial to be kept high on the political agenda and strive to good health and well-being of our populations. The Ministry of Health has been constantly working to improve our health system, even before the emergence of the new coronavirus in Europe. Thus, in cooperation with the World Health Organization and the European Commission, before the conference of the new coronavirus, we were working on the improvement of our national health system, and some of the activities included the following. In 2019, WHO mission for evaluation of the implementation of the international health regulation in Montenegro rated the health systems with the best marks. In January 2020, the improvement of laboratory capacity for self-diagnosis of the new strain of coronavirus was initiated. In cooperation with the World Health Organization, to which I also wish to thank for this fund help, especially to Dr. Kluge, the first mission of the World Health Organization was started with the aim of assessing national capacities for readiness and response to the COVID-19 pandemic. In total, 3 expert studies were conducted by the WHO. WHO experts estimated that the Montenegrin health system was ready to respond to the challenge. Following the recommendation of the WHO, we are one of the few countries introducing measures to prevent the import of a new coronavirus before the first case of the infection, resulting in Montenegro being among the last countries to import this virus, of which we are extremely proud. On March 17, Montenegro confirmed the first 2 cases of the new coronavirus infection. Quarantine temporary hospitals were formed based on the scenarios. We have succeeded in drawing an epidemic curve so as not to put a strain on the health system. I consider very important that our response to COVID-19 was particularly supported by well-prepared and implemented communication strategy. Since the beginning of January, the health system has been informing the citizens in a timely manner about the risk and prepared the public for the upcoming epidemic. According to the latest survey, 95% of Montenegrin citizens believe that they are well informed about the new coronavirus. The new coronavirus has so far been confirmed in 324 people in Montenegro. In our country, 9 deaths with COVID-19 infection have been reported, with over 7,000 people tested, and the number of recovered patients amounts to 312, with 3 infected at the moment. Montenegro is at the top when it comes to the number of tested people in the region. As we can see, there is a curve that will case to relaxation. It gives us the right to say that we are doing a good job. Thank you.
Thank you, Honorable Minister. The last country on my list before we take the break, as advised by the President, is Italy. Italy, you have the floor. Italy, you have the floor, please. We don't seem to have Italy on the line. Madam President, we would have to suspend for 15 minutes that you'd advise. When we come back, may I kindly read out the first 10 speakers so that they can get themselves ready. We would have Italy, if they do come back, Myanmar, Russian Federation, Laos, Bahrain, Kyrgyzstan, Azerbaijan, the Syrian Arab Republic, Uganda, Mozambique. These are the 10 countries that we speak when we do convene. Thank you very much, Madam President.
C'est Speranza.
Attends. Good afternoon. No, ça marche pas.
Dammi il numero, poi io vedo qua perché qualcuno sta già cercando di chiamare Speranza. 0039.
Je peux rien faire, moi je peux éteindre le micro.
Sì.
Good afternoon, can you hear us?
070. Ah, scusami, 073.
Yes, do you hear me?
4005.
Ah, yeah,
Ok.
I'm Roberto Speranza.
Okay. Can you say a few words?
Ok, e si chiama Mariangela, Mariangela Pompa. Ah, Maria Grazia.
7, 8, 9, 10, 11, 12.
Non so. Can you please stay online? We will not cut the connection. Just remain
Stanno
online.
parlando adesso con me.
Tanto vedo su Twitter se non è ricominciata. Adesso c'è questo. Stavo facendo il filmato, è scritto...
No, no.
La gemata sulle bandiere. Sì,
Eccola. Ecco, perché sto meglio così?
Sì, alziamo.
Ecco, però non è in Italia. Dov'è Italia? Ah, mi sembra perfetto. Va bene, dai. Sì, che bandiere vanno bene? Ecco il dottor regia. Sì.
At the last Regional Committee for the Western Pacific, Member States overwhelmingly endorsed for the future a regional implementation plan for GPW13 as our shared commitment to prepare for the health challenges of a rapidly changing world. At the time, few would have predicted how soon and how intensely we would be challenged in the form of COVID-19. Since January, governments and people in our region have made unprecedented efforts and sacrifices to minimize the devastating consequences of this epidemic, save lives, and protect the vulnerable. We are grateful that today there is no large-scale community transmission in the Western Pacific. Each week, we have met with member states, sharing the latest on the virus and effective approaches to tackle it. Countries in the Western Pacific have been applying the very principle upon which our shared vision was built. For example, standing together in solidarity. Every country is important, from the biggest to the smallest, including the Pacific Island countries. Each country is sharing and learning from each other, reaching the unreached, putting communities at the center and fostering homegrown solutions to minimize infection, care for the sick, and look out for the most vulnerable, and leveraging every part of the health system and every health worker. COVID-19 is an encounter with the future. We know others will come. This would include the health impact of climate change, surging rate of non-communicable diseases, and rapidly aging populations. Our regional vision for the future is more relevant than ever. So many people around the world have suffered from COVID-19. I think it is not just our responsibility to respond to this outbreak, but it is our obligation to make our societies and health system stronger and better prepared to face the challenges of tomorrow.
The WHO Southeast Asia region continues to work closely across the three levels of the organization in taking swift, decisive, and evidence-informed action against the COVID-19 pandemic. The region continues to be guided by the Delhi Declaration, which health ministers of the region adopted in 2019, stressing a risk-based approach to emergency preparedness and response, which since 2014 has been one of the region's 8 flagship priorities. It was on the 13th of January that the first reported case was detected outside of China in Thailand. Since then, member state action, led at the highest levels with a whole of government and whole of society approach, has restricted the regional's case count to a comparatively low level. Thailand has now flattened the curve and is preparing to further lift restrictions. India launched very early containment measures, including a complete nationwide lockdown with a massive scale-up of lab capacities. Bangladesh, Indonesia, and Nepal are using WHO's Go Data tool to carry out robust contact tracing. Bhutan, Maldives, and Timor-Leste are demonstrating how small countries with geographical vulnerabilities can generate and apply maximum capacity. India, Indonesia, Thailand, and Sri Lanka have taken the initiative to participate in WHO's path-breaking solidarity trial, and Myanmar and DPR Korea were among the first countries to develop and finalize their preparedness and response plans. WHO has provided member states in the region its full technical, operational and material support, from sharing key guidance and training health personnel to providing PPE and laboratory equipment and helping to plan, identify and meet resource requirements. The region's pursuit of universal health coverage, with a focus on human resources for health and essential medicines, has strengthened health systems region-wide, which is helping member states to protect the continuity of essential health services as they directly respond to the pandemic. We have a rich tradition of solidarity and mutual support, which is reflected in the Southeast Asia Regional Health Emergencies Fund, which has been fully harnessed from the start of the outbreak. The region's world-class medicine and vaccine manufacturing capacity will be critical to global efforts to develop and produce safe and effective therapeutics and vaccines, and to ensure they are equitably distributed to all of humanity. WHO is committed to moving forward to control and suppress spread and empower individuals and communities to stay safe, healthy, and well.
Your Excellencies, ladies and gentlemen, I am glad that the World Health Assembly is able to meet, although virtually. We have much to do. COVID-19 is sweeping across the Eastern Mediterranean region, but case numbers in most of our countries have not yet reached the explosive levels seen in some other regions. We can slow and reduce its transmission if we act decisively now. We have been working hard with our member states to make the most of this opportunity. We are concentrating resources to maximize our impact, including very significant input from the polio program. And we are coordinating with the regional partners from UN agencies, NGOs, academics and donors. We are also playing our part in the wider global response. WHO's logistical hub in Dubai is a major asset. So far, over 150 shipments of PPEs and laboratory supplies have been shipped to 100 countries across all 6 WHO regions. I am profoundly thankful to the donors and partners who are supporting our efforts. But we face serious challenges. 2/3 of our countries are affected by emergencies, and the pandemic threatens to be catastrophic for fragile health systems and vulnerable populations. It is already undermining access to essential health services, such as immunization, which we cannot afford to lose. And all too often, conflicting parties are ignoring the call for a global ceasefire, putting health workers at risk and making it even harder to contain the pandemic. As the current crisis shows, we are all part of a single global family. Let us come together with solidarity and determination to defeat our common foe. Thank you.
Honorable delegates, I would like to welcome you back from your short break. I think we may have taken a little bit more time, but I think it was worth it. We will now continue to hear the statements by delegations, which are provided under item 3, and I will turn the floor over to the Secretariat to manage this session.
Thank you, Madam President. As announced before the break, we would like to invite Italy to take the floor. Honorable Minister, you have the floor.
Vado. Madam Chair, honorable ministers, distinguished delegates, Italy aligns itself to the statement of Croatia on behalf of the European Union and its member states. Firstly, I would like to express our appreciation for the decision to convene this session of the World Health Assembly, and I want to thank WHO for the support of these months. In this period, we have all taken measures to stop the COVID-19 pandemic, and we must be ready to account promptly for our choices to our citizens and their representatives. We believe that it is absolutely necessary to start immediately, also within WHO, joint reflection on an emergency that is affecting the whole of humankind, and to develop a broader assessment of this experience. A first consideration is certainly the central role taken on by health at this time of history. It is a role that must be maintained and enforced in the future to ensure that we are prepared for the challenge to the health, security and social and economic stability of our communities. Consequently, the national ministries and the international bodies in charge of this issue will also need to enter a new season and be revitalized by extensive reforms. In particular, as regards WHO, we must ensure that it maintains and strengthens its central role, especially in times of crisis. This means that from this point forward, we need to work together to build an always stronger agency, rethinking its role and operation. At the same time, we must ensure that it is fully independent of any external influence, whether political or financial, that is only guided by science, and that is transparent in its process and fast in responding to challenges that can be complex, such as the pandemic. We should all commit to supporting this process from today, allocating appropriate human and financial resources to it, with the objective of raising the global preparedness and response capacity of individual states, with the support of the agency high-level technical and scientific expertise and solid organization at the service of all people. A fundamental challenge is the development of a safe and effective COVID vaccine. We have to fight to consider it a global public good, a right of everyone and not a privilege of few. Thank you very much.
Thank you, Inteli. We would now go back to the two regional group statements that we had technical problems with in the previous session, and we would like to call Djibouti. Monsieur le ministre, vous avez la parole.
Monsieur le directeur général, j'ai l'honneur de prononcer cette déclaration au nom du groupe des pays francophones membres et observateurs de l'Organisation internationale de la francophonie. Pour commencer, notre groupe présente ses condoléances les plus attristées aux familles éplorées par la pandémie du Covid-19 dans le monde entier. Le groupe francophone souhaite également exprimer sa reconnaissance envers les professionnels des services de santé et tous les autres travailleurs de premier plan qui font preuve d'un immense courage et de dévouement dans l'exercice de leurs fonctions pour contenir la propagation de la pandémie, mais aussi pour assurer des services essentiels au fonctionnement de nos sociétés. Le groupe francophone se félicite du rôle de chef de file de l'OMS dans le cadre de la coordination de la réponse à la pandémie du Covid-19. Le groupe salue également les efforts déployés par les Nations Unies et ses partenaires, ainsi que les actions entreprises dans ce sens au niveau régional et sous-régional en réponse à la pandémie du Covid-19, particulièrement en ce qui concerne la protection des populations les plus vulnérables. Notre groupe se félicite des initiatives engagées par l'Organisation internationale de la francophonie afin d'accompagner ses États membres et leurs populations respectives dans le contexte de la lutte contre ce virus, en particulier dans les domaines éducatifs, socio-économiques, numériques et culturels. Le groupe francophone est convaincu que cette pandémie ne pourra être endiguée efficacement que par la solidarité, la coopération internationale et l'action collective, fondée sur une approche multilatérale et basée sur la protection des droits de l'homme, avec une attention particulière aux droits des femmes, dont le rôle est essentiel, notamment dans le cadre de cette crise mondiale. À cet égard, notre groupe soutient pleinement la plateforme de coopération internationale d'accélération du développement et de la distribution équitable des tests, traitements et vaccins, ainsi que le renforcement du système de santé des pays vulnérables pour contrer la pandémie du Covid-19, lancé le 24 avril dernier et coordonné par l'OMS, ainsi que les autres initiatives engagées par la communauté internationale. Le groupe francophone encourage enfin l'OMS à intensifier ses efforts pour assurer de manière générale l'accès dans les meilleurs délais et dans toutes les langues officielles des Nations Unies aux documents stratégiques de l'OMS et, dans le contexte spécifique de la pandémie du Covid-19, l'accès rapide dans ces mêmes langues aux lignes directrices, protocoles, conseils et formations de l'OMS. Je nous souhaite à tous une assemblée mondiale de la santé fructueuse. Je vous remercie.
Merci, Votre Excellence. Now we will proceed with the Netherlands, followed by Myanmar. Netherlands, Your Excellency, you have the floor.
Dear colleagues, it's an honor to address you as a chair of the steering group of the Global Health Security Agenda, the GHSA. The GHSA represents over 70 member states, important international organizations, and non-governmental and private sector members. Our common aim is as simple as it is difficult. We want to improve the worldwide implementation of the WHO international health regulations. And that's easy said, but we all know it's not easy getting it done. But what we know is this: it's a crucial global tool when it comes to preparing ourselves against outbreaks of infectious diseases such as COVID-19. The situation we all find ourselves in today, with lockdowns, overflowing ICUs, and our economy suffering, proves that an effective implementation of the international health regulations is more important than ever. The members of the GHSA work from the principle that solidarity and cooperation are key. And we do this from a One Health perspective, as human, animal and environmental health are complexly linked, as the current zoonotic pandemic so clearly illustrates. It's our common aim to bolster pandemic preparedness and response capacities in countries by spurring political commitments and actions, by engaging the range of sectors with equities in health security, and by drawing on expertise from across our diverse membership. We share knowledge and good practices widely. While all of us know that the best way to deal with this crisis is to stay at home, we also know that the road out of this mess is the road on which we walk together. For this, the GHSA calls on everybody to commit to specific, focused and concrete actions now, so the world will be better prepared to brave the next outbreak in the future. I thank you.
Thank you for that group statement, and we now continue with the national statements. Myanmar to be followed by Algeria. Myanmar, Your Excellency, you have the floor. Yes, we do. Please go ahead.
Thank you. I'm deliver statement on behalf of the Minister of Health and Support of Myanmar. Honorable President, Excellency, Mr. Director General, this is the time when all health ministers are busy tackling the COVID-19. Myanmar is fighting this torch after adapting some of the global strategies and interventions to suit our country's scenario, given the fact that Myanmar is a developing country but with a relatively strong health system. From the very beginning, starting 5th January 2020, we have issued guidelines, standard operating procedures, do's and don'ts to prevent and control COVID-19. We take note of the fact that the virus is new. We are not fully aware of the behavior of the virus. So that's the natural history of COVID-19. We therefore need very clear-cut scientific evidences from WHO and other renowned research and health institutions like CDC Atlanta and WHO collaborating centers in the real-time basis. Sharing of experiences among neighboring countries is one of the predictors for successfully controlling and containing the pandemic. We should give special attention on the importance of psychological impact of COVID-19 on the population, let along the economic impact. At the same time, we should take advantage of conducting several relevant researches for helping us in managing and containing future pandemic. Myanmar's experience is that as the pandemic is progressing, it is clear that without proactive involvement and synchronized collaboration and coordination of the population, we will not be successful in containing the pandemic. Under the able leadership of our State Councillor, Aung San Suu Kyi, Chair of the Central Committee on Prevention, Control and Treatment of COVID-19, I should say we can keep the situation under control at this point in time. In managing this pandemic of such magnitude, we should be swift in action as the interventions are time sensitive or time bound. Before concluding, Madam President, my delegation would like to reiterate our support of the One China policy in line with the UNGA Resolution 2758. We are of the view that any arrangement allowing Taiwan's participation in WHA should be guided by the One China policy. I thank you, Madam President.
Thank you very much, Your Excellency. We will now go to Algeria. Votre Excellence, vous avez la parole.
Madame, Monsieur le directeur général de l'OMS, honorables participants, l'Algérie tient d'abord à exprimer ses condoléances attristées aux familles et aux proches des victimes de la pandémie de la COVID-19 et rendre hommage, un vibrant hommage à tous les premiers intervenants engagés dans la lutte contre cette pandémie. Cette pandémie nous rappelle le bien fondé de notre Assemblée qui incarne l'importance du multilatéralisme, de la solidarité et de la coopération internationale auquel mon pays réaffirme son profond attachement. Madame la Présidente, dès l'apparition du virus, des mesures multisectorielles d'envergure ont été prises par les autorités algériennes pour endiguer la propagation du virus. Elles reposent sur la prévention, la communication, le confinement des foyers d'infection, l'adoption d'un protocole thérapeutique national et la standardisation des diagnostics ainsi que le renforcement des capacités de dépistage. À l'évidence, nous ne saurions nous satisfaire d'une réponse nationale. C'est pourquoi l'Algérie demeure résolument engagée au sein du continent africain et auprès des pays frères afin de renforcer nos capacités de riposte au niveau régional sous l'égide de l'Union africaine et en collaboration avec le Bureau régional Afrique de l'OMS, dont nous tenons à saluer le leadership de sa directrice, le Dr Ouetti. À cet égard, l'Algérie salue le rôle prépondérant du système des Nations Unies et le leadership de l'OMS dans la mobilisation de ressources et la coordination des efforts déployés à tous les niveaux pour apporter une réponse globale à la COVID-19. Mon pays se félicite de l'adoption de la résolution relative à la riposte à la COVID-19, à laquelle il adhère pleinement, et nous espérons qu'elle servira de feuille de route à la communauté internationale, en particulier lorsqu'un vaccin sûr et efficace aura été mis au point. Il nous est apparu primordial que référence soit faite à l'accès universel aux produits et aux technologies de santé nécessaires pour lutter contre la COVID-19, en développement, dont les vulnérabilités financières doivent également entrer en ligne de compte. En prévision de l'après-crise qui s'annonce, nous serons tous appelés à tirer les enseignements de cette pandémie afin d'éviter qu'une telle catastrophe ne se reproduise. Un bilan pour lequel l'OMS sera amené à jouer un rôle central. Pour sa part, l'Algérie continuera d'œuvrer en ce sens, ainsi qu'à la réalisation de la santé pour tous et des objectifs de développement durable. Je vous remercie.
Merci, Votre Excellence. We will continue with the Russian Federation. Уважаемый министр, вам слово.
Уважаемый генеральный директор и господин председатель, уважаемые коллеги, благодарим генерального директора за представленный доклад и всецело поддерживаем усилия ВОЗ по борьбе с пандемией нового коронавируса. Реализуемый Российской Федерацией комплекс мер позволил не допустить взрывного распространения COVID-19 внутри страны. Для этого были приняты широкие противоэпидемические меры, введен режим нерабочих дней продолжительностью 1,5 месяца. И организовано масштабное тестирование населения. Ежедневно проводятся более 150 тысяч тестов, и они ежедневно увеличиваются. Организована массовая информационная кампания. Для оказания своевременной медицинской помощи оперативно проведена переподготовка более 1,4 миллиона специалистов. Развернуты более 130 тысяч специализированных медицинских коек, в том числе с реанимационной защитой. Медицинский персонал обеспечиваться средствами индивидуальной защиты, хотя на начальном этапе мы испытывали трудности. Предпринятые меры позволили достичь одного из самых низких показателей летальности. В России производятся в том числе тест-системы. Их сегодня более 20. Разрабатываются лекарственные препараты полного цикла, которые уже доступны для клинической практики. Ведется интенсивная работа над вакцинами для профилактики заболеваний. Через месяц планируется начать их клиническое исследование. Подготовлен национальный план снижения ограничительных мер. Российская Федерация выступает за укрепление ВОЗ в качестве лидера международного сотрудничества в сфере здравоохранения. Отмечаем ее важнейшую роль в координации многосторонних усилий по борьбе с COVID-19. С целью содействия ВОЗ нами были выделены финансовые и методические ресурсы, поддержаны инициативные проекты организации. Российские эксперты приняли участие в страновых миссиях ВОЗ по вопросам борьбы со вспышкой коронавируса. В завершении хотел бы подчеркнуть, что только совместными усилиями нам удастся одержать победу над инфекцией. Благодарю вас за внимание.
Спасибо большое. La République démocratique populaire Lao, Votre Excellence, vous avez la parole.
Pandemic has adopted the traditional ways of living, traveling, and working, and it will stay with us for some time, if not forever. Global challenges need a global response. Do you hear me? Hello?
Yes, we can hear you. Please go ahead, Your Excellency.
Hello?
Yes, we can hear you. You can proceed, please.
Okay. Excellencies, the COVID-19 pandemic has disrupted the traditional ways of living, traveling, and working, and its global challenges need a global response. We acknowledge and thank Dr. Tedros for his key role for bringing a global solidarity to address this crisis. Low and middle income countries are the most vulnerable and need special attention and assistance. At this time, the WHO needs support more than ever to effectively carry out its critical duties on global coordination and assistance around the world. Madam President, my country is very limited resources and capacity to deal with a large number of infected people. We therefore took early preventive measures to contain infection as much as possible. We profoundly thank the valuable assistance from the friendly countries and international organizations who help us to limit the number of infected cases to 19 with no deaths. We have taken this precious time with a few cases to strengthen our hospital capacity, including infection prevention and control, and to build committee mechanisms to detect cases early. I also firmly hope that the assistance will be continued so that we can meet the SDGs and no one will be left behind. In closing, I wish more solidarity and collaboration to overcome this difficult situation and better maintain essential health services. We confirm our full support and cooperation for the success of the meeting. I do thank you.
Thank you, Your Excellency. I would now like to invite Bahrain to take the floor. Distinguished Minister, you have the floor.
بالنيابة عن وزيرة الصحة، معالي الرئيس، معالي المدير العام لمنظمة الصحة العالمية، أصحاب المعالي والسعادة، السلام عليكم جميعا. بداية يسرني أن أشيد بالجهود العالمية وتضافرنا في مواجهة جائحة فيروس كورونا المستجد كوفيد-19. هذا الوباء الذي أثر سلبا على العديد من القطاعات وشكل عبئا لا سابق له على الخدمات الصحية والاجتماعية والاقتصادية في جميع أنحاء العالم. ونحن اليوم في الدورة 73 لجمعية الصحة العالمية كان من المفترض أن نحتفل معا في هذه الدورة العام الدولي للتمريض والإبالة، ولكن مع الأسف الشديد لم يحقق هذا العام ما كنا نصل إليه من فعاليات ومشاريع وأنشطة من أجلهم لتحقيق الأهداف النبيلة من خلال تخصيص هذا العام لهذه الفئة من العاملين في المجال الصحي الذين يكون لهم كل الشكر والتقدير على ما يقومون به. ونحن هنا نقف اليوم جميعا إجلالا واحتراما لجميع العاملين في الصفوف الأمامية من الكوادر الطبية والتمريضية والصحية والخدمات الطبية المساندة للتصدي لوباء لم نشهد في عمرنا له مثيل، فهناك أرواح قد فقدناها بسبب هذا الفيروس ومعاناة لم يشهده الكادر الطبي والصحي في حياتهم في هذا العصر الحديث. مع تعرضهم للمخاطر من هذا الوباء، الحياة في زمن كورونا صعبة على الجميع، والمطلوب في هذه المحنة والأزمة توحيد الجهود والتعاون بين دول العالم واتخاذ الإجراءات الشاملة للحد من انتشار الفيروس بأسرع وقت ممكن، واتخاذ التدابير الوقائية الفعالة للحد من هذه الجائحة وسرعة إيجاد العلاج لإنقاذ ما يمكن إنقاذه، ولمنظمة الصحة العالمية دور فعال في ذلك الإنساني وتهمنا جميعا. معالي الرئيس، لقد كان لتبني مملكة البحرين النهج الحكومي المتكامل في الاستجابة لجائحة كوفيد-19 دورا مركزيا بالغ الأثر في إبطاء وتيرة انتشار المرض. وقد تم إعداد خطة استجابة شاملة ركزت على مبدأ القيادة الاستراتيجية الموحدة والفاعل، حيث يقود الجهود الوطنية بصورة مباشرة صاحب السمو الملكي الأمير سلمان بن حمد آل خليفة ولي العهد نائب القائد الأعلى النائب الأول لرئيس مجلس الوزراء حفظه الله. وقد تم تشكيل فريق وطني بعضوية ممثلين من جميع الجهات الحكومية يتولى إدارة كافة الإجراءات الاحترازية والسياسات واتخاذ العديد من التدابير للتخفيف والاحتواء وتعبئة الجمهور مع تنفيذ أعلى معايير التتبع والمخالطة للحالات المختلفة. كما حصلت سلطنة البحرين حرصت على توفير التمويل اللازم من أجل زيادة الطاقة الاستيعابية للمستشفيات ومواقع الحجر والعزل في الخطط المخبري، ووضع خطة لتأمين المسؤولات اللازمة لعمل الفتوحات المخبرية ومعدات العناية المركزة ومعدات الحماية. كما تم وضع خطة كاملة لتكثيف القوى العاملة اللازمة وتأهيلهم وتدريبهم. وفيما يخص إدارة الحالات وتحسين القدرة العلاجية، أثبتت البروتوكولات العلاجية المعتمدة في مملكة البحرين فعاليتها في تعافي عديد كبير من الحالات الإصابة. وقد كانت البحرين الأولى عربيا في الانضمام إلى اختبار التضامن لتجربة أول لقاح، كما وبدأنا التجارب السريرية للعلاج بالنسبة المتعافين. معالي الرئيس، ختاما لبياننا هذا أود أن أقتبس مقولة لمعالي المدير العام الدكتور تدرس، وهي: لن يكون أحد مأمن حتى يصبح الجميع بأمان. وعليه لابد لنا كدول أن نواصل جهودنا وتضافرنا معا مع منظمة الصحة العالمية حتى نتغلب على هذا الوباء يدا بيد دون أن يتخلف أحد عن الرجل. شكرا سيدة الرئيسة.
Thank you, Your Excellency. I would like to invite Kyrgyzstan. Kyrgyzstan, Your Excellency, you have the floor.
Позвольте приветствовать всех участников заседания 73-й сессии Всемирной ассамблеи здравоохранения и выразить признательность генеральному директору Всемирной организации здравоохранения, уважаемому доктору Тедросу Гебрейсусу за организацию сессии в онлайн-режиме. Эпидемия COVID-19, объявленная 11 марта Всемирной организацией здравоохранения как пандемия, стала серьезной угрозой стран мира и их народам, диктуя новые измерения мирового порядка. В соответствии с рекомендациями Всемирной организации здравоохранения для предупреждения завоза и дальнейшего распространения коронавирусной инфекции, Кыргызская республика проводит активную работу по выявлению, изоляцию лиц, контактировавших с зараженными лицами, а также лечение больных с диагнозом COVID-19. Пандемия COVID-19 и вызванные его социально-экономические последствия могут быть привести к снижению возможности по своевременному достижению целей устойчивого развития. Со своей стороны, правительство Кыргызской республики принимает ряд мер по смягчению негативного воздействия на экономику. Кыргызская сторона считает важным в текущих условиях пандемии коронавируса объединить усилия стран или предпринять единые неотложных мер по предотвращению и ликвидации пандемии и поощрять обмен опытом для объединения усилий, не жалея своего научного, технологического и медицинского потенциала в борьбе с этой глобальной проблемой. Мы надеемся, что общими усилиями, новыми инструментами, жизненно важными уроками этой пандемии мы достигнем более полного всеобщего охвата населения услугами здравоохранения. Благодарю за внимание.
Thank you, Your Excellency. We now call Azerbaijan. Distinguished Minister, you have the floor.
Уважаемый президент Ассамблеи, уважаемый генеральный директор, дамы и господа, безусловно, на такой значимой ассамблее, которая проводится впервые в истории ВОС в таком формате, главным приоритетом является координация мер по борьбе с пандемией COVID-19. В коротком выступлении трудно сказать об огромном объеме работы, проделанной за короткий период времени по борьбе с пандемией, об успехах, потерях, об ударах по экономической системе и социальных последствиях. К сожалению, во многих случаях страны в одиночку борются с этим злом. Каждая страна должна знать, что проблема Азии, Европы, Африки, Америки – это не только их проблема, это проблема для всех нас. В это трудное время у нас в стране президент Азербайджанской республики господин Ильхам Алиев выступил с призывом к народу. Вместе мы сильны. Думаю, что этот призыв верен и на международном уровне. Только объединив усилия, выстроив целенаправленную, продуманную стратегию действия, можно достичь успеха в борьбе с пандемией. Что касается опыта Азербайджана, хочу сказать, что наше правительство организовало меры по борьбе с коронавирусом по нескольким направлениям. Это меры, принимаемые для предотвращения проникновения вируса в страну, меры, принимаемые для предотвращения распространения инфекции внутри страны, своевременное выявление зараженных людей и, наконец, организация лечения больных. В результате этих принятых мер на сегодняшний день в стране с 10 миллионным населением переболело всего 3274 человека. Из них 2015 выздоровело. Смертность составила 1,2%. Уважаемые коллеги, в борьбе с глобальной пандемией солидарность и сотрудничество между странами и международными организациями особенно актуальны. Мы выражаем готовность и дальше сотрудничать с международными институтами и мировым сообществом. Уверен, что ценные идеи и предложения, высказанные сегодня главами делегаций, руководителями международных организаций, будут способствовать нашей совместной борьбе с коронавирусом. В завершение выступления хочу выявить уверенность в дальнейшем укреплении и консолидации наших усилий во имя и на благо охраны здоровья людей, ценнейшего из достояний мировой цивилизации. Благодарю за внимание.
Thank you, Your Excellency. We would like to invite the Arab Republic of Syria. Distinguished Minister, you have the floor.
تنعقد أعمال الدورة الحالية لجمعية الصحة العالمية افتراضياً في وقت حالت فيه جائحة كوفيد-19 دون عقدها بشكلها التقليدي لتأكيد ضرورة الالتزام بالمبدأ الأساسي الذي تدعو إليه الأمم المتحدة، وهو التضامن والتعاون الجماعي في مواجهة التحديات والترفع عن تسييس عمل منظم، ولا سيما أن العالم يواجه اليوم جائحة تلقي بتداعيات خطيرة وقصيرة وقد تكون طويلة الأمد على النظم الصحية والاقتصادية. وفي سوريا يستجيب العاملون الصحيون للجائحة بشجاعة وفي ظل ظروف استثنائية فرضتها الحرب الإرهابية المستمرة منذ أكثر من 9 سنوات والمترافقة مع الإجراءات الاقتصادية القصرية الجائرة أحادية الجانب والتي تقيد قدرة القطاعات الخدمية ولا سيما القطاع الصحي. وفيما تواجه بلدان لديها أنظمة صحية واقتصادية قوية صعوبة باحتواء الوباء وإنقاذ الأرواح، تواصل الولايات المتحدة الأمريكية ودول الأوروبية بفرض الإجراءات القصرية على سوريا وحصارها اللا إنساني الذي يعيق قدرة القطاع الصحي على الاستجابة للجائحة وتأمين المعدات اللازمة للوقاية والتشخيص والعلاج. ومن هنا نجدد مطالبنا برفع الإجراءات القصرية عن بلادنا لتتمكن من حماية أمنها الصحي وحياة وسلامة مواطنيها في مختلف الظروف، ونشجب إصرار تلك الدول على عرقلة تضمين مشروع القرار المعروض على الدورة الحالية حول الاستجابة لوباء كورونا التزامات واضحة برفع الإجراءات التي تعيق قدرة الدول المستهدفة على مواجهة الوباء بفاعلية. إن الوضع الصحي لأهلنا في فلسطين والجولان ولا سيما الأسرى منهم في سجون الاحتلال مثير للقلق في ظل الممارسات الوحشية بحقهم والإهمال الطبي المتعمد، ما يجعلهم فريسة سهلة لجائحة كورونا، ويستدعي من المؤسسات الأممية الوقوف عن مسؤولياتها تجاههم. وفي الختام نود التأكيد أن الصين ساهمت في مواجهة هذه الجائحة، وعلى دول العالم ألا تعترف إلا بصين واحد هي جمهورية الصين الشعبية.
Thank you, Your Excellency. We would like to give the floor to Nauru. Distinguished Minister, you have the floor. We have small technical problems. We will come back to Nauru later. I would now like to invite Uganda. Distinguished Minister, you have the floor. We will proceed to Mozambique now. Votre Excellence, vous avez la parole.
Thank you. On behalf of His Excellency Minister of Health of Mozambique, Dr. Tiago, Madam President, Honorable Ministers of Health, Director General of WHO, distinguished delegates, Mozambique aligns itself with statement presented by Congo on behalf of the African Group. It is with great honor that I address this assembly, and I would like to start by congratulating the Director General of WHO and his team for the leadership and technical support provided to prevent and combat this pandemic. Allow me to convey a message of encouragement from His Excellency Philippe Jacinto Nunes, President of the Republic of Mozambique, and the government for the efforts made by the United Nations agencies, in particular the WHO, in responding to COVID-19. It is with that value of this support that Mozambique still registers a relatively small number of COVID-19 cases. We are convinced that if we continue to work with all stakeholders, including communities, we can break the chain of the infection transmission. Until today, Mozambique registers 145 cases of COVID-19 with no deaths, and is following all the protocols from WHO regarding prevention, health promotion, diagnosis, and treatment. We take this opportunity to thank all the health professionals from all over the world, as they are the main front line in this titanic struggle. Finally, We reiterate our commitment to continue to make coordinated efforts to overcome current constraints and call for the need to strengthen the implementation of the global strategy on public health action plan and innovation, attributing greater investment in research and development, which can contribute to discovery of drugs and vaccines against COVID-19, and thus to improve the health situation of our communities. I thank you for the attention.
Thank you, Your Excellency. I would like to read out the 10 following countries on our speakers list. It will be starting with Qatar and then following with Luxembourg, Barbados, Niger, Paraguay, Portugal, Armenia, Mali, Iceland, Lithuania, and Latvia. Qatar, distinguished minister, you have the floor.
Your Excellency, Madam President, Your Excellency, WHO Director, Your Excellency, ladies and gentlemen, Qatar has addressed the COVID-19 threat with a whole government, whole society approach. Continuity plans were put into action to ensure that our everyday activities, the businesses and society at large function as normally as possible during this pandemic. In order to control the spread of the disease in the community, we activated extensive community surveillance systems to detect clusters and respond promptly with control measures. We are still in the exponential growth phase of the pandemic, and we are reaching our peak. The number of cases reported is high, 11,600 per million, but as documented throughout the world, this is in great part due to our intense testing policy and case finding, which allows us to detect a larger fraction of positive individuals than usual. Currently, 94% of our positive cases are mild or asymptomatic, 5%
Your Excellency, we have some technical problems. We lost you. Can you start again, please?
Sure. Is it clear now?
Yes, please. Go ahead.
Would you like me to start from the beginning?
Yes, you can.
Okay. Your Excellency, Madam President, Your Excellency, WHO Director General, Your Excellencies, ladies and gentlemen, Qatar has addressed the COVID-19 threat with a whole government, whole society approach. Continuity plans were put into action to ensure that our everyday activities, the businesses and society at large, function as normally as possible during this pandemic. In order to control the spread of the disease in the community, we activate extensive community surveillance systems to detect clusters and respond promptly with control measures. We are still in the exponential growth phase of the epidemic as we are reaching our peak. The number of cases reported is high, 11,600 per million, but as documented throughout the world, this is in great part due to our intensive testing policy and case finding, which allows us to detect a larger fraction of positive individuals than usual. Currently, 94% of our positive cases are mild or asymptomatic. 5% require hospitalization, and only less than 1% end up in the ICU. We have seen very few deaths among patients with COVID-19. Our case fatality rate is currently 0.5 per 1,000. We believe that this picture, different from that of a number of other countries, is attributable to several factors. The overall young age of our population, the active search for cases through an intense testing program. We have tested approximately 56,000 persons per million, and a very efficient and effective healthcare system which diagnoses and treats the most severe patients early enough to improve their course of disease and decrease complications. To prepare our healthcare system to respond to the challenges posed by the epidemic, we activated our contingency plan to increase our capacity in infrastructure, manpower, and resources to deal with any anticipated surge required as a result of increase in demand. We intensified our relevant training programs and ensured that our staff have the necessary PPE for their safety. And to ensure that all our patients are taken care of and not overlooked while we are fighting COVID-19, we transformed our healthcare services, primary elective care, and particularly for those with chronic diseases, are assisted virtually to ensure that this vulnerable group of population have continuity of care. Your Excellencies, ladies and gentlemen, our Emir, His Highness Sheikh Tamim bin Hamad Al Thani, recognizing our responsibility towards the global community, has directed that respective authorities, Qatar-based institutions, should provide all possible global support to the people and countries impacted by the COVID-19 pandemic. As a result, Qatar Airways has carried around 1 million global citizens back to their home countries, as well as repatriated thousands of travelers stranded by coronavirus aviation shutdown through chartered flights. Qatar Fund for Development has also provided around 132.5 tons of medical aid to 13 countries so far. In this regard, we believe that universal, timely, and equitable access to and fair distribution of all quality, safe, and efficient and affordable essential health technologies and products should be ensured in line with the Doha Declaration on the TRIPS Agreement and Public Health. The state of Qatar has also recently co-launched, alongside South Korea, Canada, and Denmark, and Sierra Leone, in a virtual event at the United Nations headquarters in New York, the group of Friends of Solidarity for Global Health Security to combat the coronavirus pandemic COVID-19. We call on all countries to join us in this initiative, and we thank WHO. Thank you, Your
Thank you, Madam Minister. We go to Luxembourg now. Your Excellency, you have the floor.
Présidente, Monsieur le Directeur Général, Excellence, le Luxembourg s'aligne sur la déclaration prononcée par l'Union européenne et ses 27 États membres. Nous déplorons la perte tragique de vies humaines et les souffrances que subissent les peuples du monde entier dans le cadre de cette crise sanitaire inégalée. Nous exprimons notre fort soutien au multilatéralisme, au rôle et au leadership joué par l'OMS dans la réponse à cette pandémie. Nous remercions le directeur général et son équipe, ainsi que tout le staff de l'OMS pour leurs efforts inlassables pour contenir la pandémie. Nous rappelons le rôle fondamental du personnel de santé joué dans cette crise et le lourd prix payé par les agents de santé dans leur mission quotidienne visant à sauver des vies. Nous rappelons le besoin du développement sûr et efficace d'un vaccin contre le COVID-19 équitable, accessible à tous et à des prix abordables qui devra servir de bien commun global. Nous soulignons le besoin d'une approche basée sur les droits de l'homme, ne laissant personne pour compte. Et nous rappelons l'urgence de protéger la santé et les droits maternels, sexuels et reproductifs. En tant que partenaire fiable et flexible de l'OMS, le Luxembourg soutient le besoin de revoir à la hausse les contributions obligatoires et volontaires des États membres de l'OMS afin de contribuer à renverser son financement chronique. Nous soulignons également le besoin de faire preuve de réactivité et de la plus grande transparence dans le partage des informations dans la réponse à la crise. Nous rappelons que la priorité reste de tester toute personne pour permettre un traçage efficace et identifier toute personne porteur du virus, visant à mettre en quarantaine tous les cas testés positifs et les contacts proches, doublés d'une approche qui respecte les gestes barrières. Enfin, nous soutenons l'idée d'une évaluation indépendante de la gestion de la crise une fois la crise terminée. Finalement, l'action, la solidarité et la coopération à l'échelle internationale sont plus que jamais nécessaires pour faire face à cette pandémie. Nous sommes confiants dans notre capacité de surmonter cette crise en travaillant étroitement ensemble. Je vous remercie.
Merci, Monsieur le Ministre. Distinguished Minister from Barbados, you have the floor.
Honorable delegates, Barbados has set out on the journey to strengthen its health systems in the face of and in response to the relentless COVID-19 pandemic. Within a few short weeks of the first cases being reported in China, we immediately set up our Health Emergency Operations Center to guide the implementation of a suite of strategies aimed at preventing or delaying, detecting, suppressing, and containing the transmission of COVID-19 in Barbados. Key highlights of our response have included procuring urgently needed medical equipment and supplies in an environment of global scarcity, strengthening the infrastructure of the healthcare system, including laboratory capacity for the diagnosis of COVID-19. We are cognizant of the ongoing health needs of our people and are determined to not be paralyzed by this pandemic. We must continue to adequately address all the pressing health concerns, ranging from NCDs to maternal child health issues and to disaster preparedness, to mention a few. Barbados will continue to work on understanding the social, economic, and political impacts of the current crisis and to craft strategies to mitigate them with sustainable, resilient, and rights-based solutions involving an array of actors with a whole of society approach. However, implementing comprehensive health strategies aimed at suppressing transmissions and preventing them from spreading, along with focused efforts on linkages between health systems and health security, requires sustainable resources. Despite our country's designation as a high-income country, we and other similarly vulnerable states urgently need global support and solidarity to ensure the continuity of essential health and social services to safeguard the health and well-being of our people. We remain appreciative of the efforts of WHO, PAHO, and the Caribbean Public Health Agency, CARPA, in providing unwavering assistance and stewardship to Barbados and our partner countries in the Caribbean region as we aim to improve the health and quality of life of all of our people. I thank you, Madam President.
Thank you, Honorable Minister. I would like to invite Niger to take the floor, followed by Portugal.
Madame la Présidente, distingués délégués, permettez-moi tout d'abord d'adresser mes chaleureuses salutations et félicitations à Madame la Présidente ainsi que les autres membres du bureau de la présente Assemblée pour leur élection. Je voudrais également féliciter le docteur Tedros Adhanom Ghebreyesus ainsi que la Direction générale de l'OMS pour l'organisation de la présente session dans un contexte particulièrement difficile imposé par la pandémie à la COVID-19 et les assure du soutien indéfectible du Niger dans la poursuite de leur noble mission. Madame la Présidente, depuis décembre 2019, le monde entier est confronté à la pandémie à la COVID-19. La crise sanitaire qu'elle a entraînée a provoqué des conséquences humaines, sociales et économiques dont on est loin de pouvoir mesurer l'ampleur. Pour faire face à la pandémie, le gouvernement du Niger a pris d'importantes mesures et a élaboré un programme global de réponse à la pandémie à la COVID-19 avec l'appui des partenaires techniques et financiers. Grâce à la mise en œuvre de ces mesures, une tendance à la baisse des cas est observée depuis quelques jours. Cependant, nous devons rester vigilants vu la situation épidémiologique actuelle de la pandémie au niveau mondial et sous-régional. Madame la Présidente, cette crise du COVID-19 intervient dans un contexte national caractérisé par une faible capacité du système sanitaire et une insécurité persistante dans la sous-région sahélo-sahélienne. À cet égard, nous plaidons notamment pour davantage d'investissements dans le système de santé afin de le rendre résilient pour faire face à la pandémie, à la COVID-19, aux autres maladies émergentes et assurer la fourniture aux populations de tous les services de soins de santé. Madame la Présidente, pour terminer, permettez-moi de remercier l'OMS et les autres partenaires bilatéraux et multilatéraux pour l'assistance multiforme en prévention et gestion de la pandémie qui nous apporte au moment où nous en avons. Mon pays, par ma voix, a l'initiative ACT par l'OMS et les partenaires bilatéraux et multilatéraux visant la mise au point, la production et la distribution équitable des produits de diagnostic et de traitement de COVID-19. Pour cela, nous exhortons l'ensemble de la communauté internationale à se mobiliser autour de l'OMS en vue de l'aboutissement rapide de cette initiative et de lui apporter tout le nécessaire. Je vous remercie.
Merci, Monsieur le Ministre. Nous invitons Portugal de prendre la parole. Votre Excellence, vous avez la parole.
Senhor Diretor-Geral, caros colegas e delegados, há um ano, quando reunimos pela última vez em Genebra, seria difícil imaginar que a próxima Assembleia Mundial decorreria nestas circunstâncias. A pandemia de Covid-19 mudou as nossas vidas e o seu impacto e consequências continuarão a fazer sentir por bastante tempo. Veio recordar-nos o quão importante e central é a saúde pública e o quão vastas e transversais são as suas implicações na sociedade. Mostrou também que nenhum país estava inteiramente preparado para fazer face a uma ameaça deste género e como somos todos dependentes uns dos outros. Antes de sublinhar algumas das lições da pandemia, gostaria de dirigir um conjunto de agradecimentos. Em primeiro lugar, a todo o pessoal de saúde e a todos os demais profissionais que estiveram e estão na linha da frente por todo o seu esforço e dedicação. Depois, à sociedade em geral, e permitam-me que mencione em particular o povo português, pela maneira responsável como soube responder aos apelos de confinamento e, nesta fase, às regras do lento retomar da vida em sociedade. Também às Nações Unidas, pela forma expedita e coordenada como reagiram à pandemia, destacando naturalmente o papel central da Organização Mundial de Saúde. Por fim, a toda a comunidade científica, pela mobilização de esforços em torno da investigação e desenvolvimento de terapêuticas e de uma vacina para a Covid. O combate à Covid tem sido uma prioridade do governo português. O respeito pelos direitos humanos foi uma condição de base de todas as medidas de combate à pandemia, incluindo durante a vigência do estado de emergência. Regularizámos temporariamente o estatuto de todos os migrantes, refugiados e requerentes de asilo, equiparando-os a residentes regulares em Portugal para que pudessem ter acesso, sem discriminação, aos serviços de saúde e prestações sociais. Pusemos em prática um conjunto de apoios sociais dirigidos aos trabalhadores e às populações mais vulneráveis para mitigar os efeitos negativos da pandemia. Dedicámos ainda especial atenção à saúde mental, reforçando a sua intrínseca ligação com os direitos humanos. Terminaria referindo uma das conclusões que devemos retirar da atual pandemia. É essencial um investimento constante no fortalecimento dos sistemas de saúde e na cobertura universal em saúde. E esse investimento passa por uma arquitetura global de saúde pública forte, bem coordenada e com os recursos suficientes para a qual todos os países colaborarão de forma transparente e solidária. Obrigada.
Thank you, Madam Minister. Now I'd like to invite Armenia. Your Excellency, you have the floor.
Honorable President, Director General, Ministers, Excellencies, distinguished delegates. We thank the WHO for convening World Health Assembly at this critical time. COVID-19 pandemic is spreading worldwide. This session is not only the first visual meeting of WHA, but also the most important one to understand where we are and discuss further way forward in implementing our joint approach to response to COVID-19 nationally and globally. It is my honor to represent the Republic of Armenia by the delegates in the fight against COVID-19. Every single day of the past months, every single hour, we engaged ourselves in a battle wrapped in uncertainties. The path of our response to the side may seem like a walking in the dark. But the good news is that the strategies of early detection, isolation, testing, contact tracing, and quarantine, along with physical distancing, have shown to be critical elements to slow the disease transmission. Dear colleagues, the COVID-19 pandemic pushed many of us into new realities. But one thing is clear for now. Priorities have not been changed and became bolder. Let me summarize 4 lessons learned. First, the COVID-19 outbreak revealed gaps in our systems, but also showed our strengths developed from the valuable experience responding to other health threats. The epidemic proved that health is one of the most important priorities of all governments. Second, emergency preparedness is a core for effective response and containment of the epidemic. Armenia has the wealth of experience in implementing agile emergency capacities, but we should certainly revise the approach to implementation of unified measures and communication. Third, beating NCD is also at the core of COVID-19 response. Epidemic hits the most vulnerable with NCDs. Therefore, we should continue focusing on prevention, early detection, and management of NCDs to prevent the onset of diseases, neither struggling to save their lives during any epidemic. Fourth, as COVID-19 continues to spread around the world, the fight with the pandemic requires new tools, more research, and innovation at global level. Pandemics of this magnitude do not respect borders. Therefore, they require global action to counter and overcome the crisis. Indeed, the national community, regional cooperation, and global solidarity are essential to these efforts. I thank you for your attention.
Thank you, distinguished minister. Would like to invite Iceland to take the floor. Your Excellency, please go ahead. You have the floor.
President, Director General Dr. Tedros, honorable ministers, distinguished delegates. Iceland would like to thank WHO for its guidance and leadership in combating COVID-19. The pandemic concerns us all. A global platform like WHO is important when fighting a common threat. In Iceland, we have followed WHO guidelines and leadership. We have been able to delay and prevent the spread of the virus, safeguard our healthcare system, and protect our population. The Icelandic healthcare system has endured the pressure of the pandemic. We have managed to build a strong and resilient public health system that is both flexible and adaptive. The lessons we have learned will be useful when planning for the future. The outbreak is causing unprecedented crisis with increased unemployment and insecurity affecting people all around the world. We need to monitor the impact on people's mental health and well-being, protect our social infrastructure, and ensure that no one is left behind. Attention must be made to vulnerable groups like women and children, as well as the populations of the developing countries. We are still in the middle of the pandemic. Continued global solidarity is essential. This includes collaboration in research and in the development of a vaccine against the virus. We live in a community of nations where we share common goals. which we recognize as the UN Sustainable Development Goals. Let's make these goals guide us on our way forward, building on the principle of leaving no one behind.
Thank you, Your Excellency. Would like to invite Lithuania. Your Excellency, you have the floor.
Honorable Chair, distinguished Director General, colleagues. Lithuania fully aligns itself with the statement made by Croatia on behalf of EU and its member states. Today, the world is facing the unprecedented challenge posed by COVID-19 pandemics, the challenge we have never faced before in our lifetime. The pandemics has a significant impact on the health systems, economies, livelihood and well-being of the societies, and adversely affects the exercise of human rights all over the world. We cannot win this war standing alone. Only by adhering to the principle of effective multilateralism, only by working together, we are stronger and more effective. Only solidarity and unity will help to effectively respond to this fast-growing threat. We emphasize the need for the global leadership in coordinating joint international efforts and actions. Therefore, we recognize and appreciate the leadership and efforts of the World Health Organization in supporting and guiding member states as they fight the pandemics. We also recognize the importance of research and development, including the development of vaccines and their accessibility and affordability, diagnostics and treatment, as well as the availability of personal protective equipment equitably to all population groups. Lithuania reacted very rapidly to the extent of the spread of the virus in the world and the threats posed by it to human health and life, and has taken effective measures to contain the virus from spreading. Lithuania remains committed to working together with the international community in responding effectively to COVID-19 crisis. Thank you.
Thank you, distinguished Minister. We would now like to invite Latvia to take the floor. Your Excellency, you have the floor.
Distinguished Director General, Excellencies, ladies and gentlemen, Latvia aligns with the statement of the European Union. Currently, due to COVID-19, the whole world is undergoing a challenging time that tests not only the national health system's capacities, but also society's physical and mental health. The virus has affected all possible sectors, but there is no time to mourn the losses and adversity associated with COVID-19. This is time toward finding solutions to the current challenges, to evaluate response actions, draw conclusions on which measures work better than others, and to move forward with renewed vigor into the future. Latvia is one of those countries where the response to COVID-19 was very well managed. It is due to the hard work of our epidemiologists who studied each case very thoroughly, tracing the cases and contacts. We have applied the whole government approach following closely the epidemiologists' advice. We have dedicated health workers. Population has followed sanitary guidelines. It has been a common effort. The first lesson that we learned was that the evidence-based approach is the best. Latvia highly evaluates the contribution, support and guidelines of the World Health Organization and its coordinated approach not only in the initial stage of COVID-19, but also now in the transition phase. Latvian government also supported the work of WHO by a voluntary contribution to the Strategic Preparedness and Response Plan. Undeniably, COVID-19 is a painful experience for the whole world. It has shown the need for coordination and international cooperation transcending national boundaries. Latvia believes that only together and united in solidarity we can overcome challenges and prevent future pandemics. Thank you.
Thank you, Madam Minister. We would like to invite Kazakhstan. Your Excellency, you have the floor.
President, Director General, on the behalf of the Minister, it is my great pleasure to address you at the 73rd session of the Assembly. I would like to express our gratitude and full support to the work of the organization and its Director General, Dr. Tedros Adhanom Ghebreyesus, in the combating of COVID-19. We thank WHO for all technical guidance in the preparedness, readiness, and response action to COVID-19. Kazakhstan has taken tremendous effort to contain the spread of COVID-19, and now we are focusing on transition by mitigating restriction measures. At the same time, we are taking actions to robust the health system for the possible wave by integrating primary health care into the overall public health response to COVID-19. The role of PHT is crucial in informing patients and community about the COVID-19, interrupting the chain of transmission and identifying vulnerable populations, as well as ensuring appropriate referral for home isolation and hospital admission. The other important issue is a broader use of digital technologies and development of a digital health ecosystem, which provide us new possibilities during the challenging time for the COVID-19 pandemic. Digitalization of public health surveillance, laboratories, and PHT has been playing an important role in Kazakhstan in timely and right action. On the last session of WHO Executive Board, Kazakhstan initiated the decision on primary health care to adopt the operational framework on the PHT that was supported by all member states. I once again want to highlight the importance of strengthening primary health care, which is playing a major role in the eradication of current pandemic and prevention of other infectious diseases. We need to stay on track of the principles of UHC and PHT. Dear colleagues, the whole world, international organization, and other stakeholders need to combine efforts to provide people with safe, effective, and affordable vaccines, tests, and treatment. We express our highest appreciation and support to the dedication, effort, and sacrifices of all healthcare professionals, health workers, and other frontline workers. Only together we can win. Thank you.
Thank you. We would like to invite Morocco. Your Excellency, you have the floor.
بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين أصحاب الفخامة والسعادة السيد المدير العام لمنظمة الصحة العالمية السيدات والسادة الوزراء السيدات والسادة السفراء السلام عليكم. إن جائحة كوفيد-19 تعد بمثابة أكبر تحدي واجهناه منذ الحرب العالمية الثانية، حيث أدت إلى أزمات اجتماعية واقتصادية وسياسية دفعتها الحكومات في جميع أنحاء العالم إلى اتخاذ التدابير والإجراءات اللازمة، وذلك من خلال استجابات جماعية متعددة الأبعاد وموحدة بغية القضاء عليها. وفي هذا السياق يبدو من الضروري بالنسبة لنا دعم القيادة والدور المركزي لمنظمة الصحة العالمية ومديرها العام السيد تدروس في إدارة هذه الجائحة. سيداتي وسادتي، منذ أن أعلنت منظمة الصحة العالمية أن أوروبا أصبحت المركز الجديد لوباء فيروس كورونا المستجد، اتخذت المملكة المغربية وبقيادة مستنيرة ورشيدة لصاحب الجلالة الملك محمد السادس نصره الله حزمة من التدابير والإجراءات الاحترازية والوقائية الاستعجالية لمنع انتشار هذا الوباء من خلال إعطاء الأولوية لصحة المواطنين. ذلك أن مجهودنا الوطني يتوقف وبشكل رئيسي على 3 محاور: الصحة والاقتصاد والسلم الاجتماعي. وقد مكن انخراط المؤسسات العامة والقطاعات الخاصة وفعاليات المجتمع المدني من السيطرة إلى حد ما على الجائحة. وتميزت الإجراءات المتخذة بتعليق جميع الرحلات الدولية وإغلاق جميع الأماكن العامة وإلغاء كل التجمعات الكبيرة والتشجيع على الحجر المنزلي ثم الحجر الصحي الإلزامي وإنشاء صندوق خاص بتدبير الجائحة. وبخصوص قطاع الصحة تم إعطاء الأولوية لتعزيز البنية التحتية الصحية وتقوية العرض الصحي وإنشاء هيئة قيادة الأزمة وتعزيز التكفل الطبي، وكذا وضع استراتيجيات علاجية واعتماد خطة تواصلية تضمن نشر التقرير اليومي حول تطور المرض وكذا الإجراءات الوقائية. إن الخروج من الحجر الصحي رهين باستقرار الحالة الوبائية بالمملكة المغربية، كما أن تدبير هذه الجائحة لا يمكن أن يكون ناجحا إلا في حالة الولوج الشامل لوسائل الكشف والعلاج وبأسعار معقولة للجميع. سيداتي وسادتي، إن المبادرة الإفريقية التي أطلقها صاحب الجلالة الملك محمد السادس نصره الله تعد إطارا عمليا لتضافر الجهود والموارد، ذلك من خلال تقاسم التجارب والممارسات الجيدة. إن انخراط الجميع تحت ريادة منظمة الصحة العالمية سيمكن لا محالة من مكافحة هذه الجائحة. وشكرا لكم على حسن استماعكم، والسلام عليكم ورحمة الله.
Merci, Monsieur le Ministre. Roumanie, Votre Excellence, vous avez la parole.
Honorable Chair, Director General, Excellencies, Honorable Ministers, Romania fully aligns itself with the European Union statement. The COVID-19 pandemic brought us together today in a virtual format. The same exceptional circumstances have called upon us to come together to show resolve, commitment, and solidarity. The coronavirus knows no boundaries, no social status, religious belief, or political preference. I would like to express my deepest sympathy to all the families of the victims of this unequal battle, with a special thought for all those on the forefront of the fight against COVID-19. I'm confident that we will emerge stronger from this dramatic crisis, but to do so, we need a coordinated and human rights-based approach. I would like to thank World Health Organization for the constant and qualified support to member states, demonstrating leadership as coordinating authority in this time of crisis. Romania's national containment strategy has used a comprehensive approach of identifying, testing, tracing, isolating, and treating infected persons. Romania, as most states, faced difficult decisions in responding to the pandemic. Lockdowns, closure of schools, restrictions on services, physical distancing, border closures with a significant socio-economic impact. Our citizens deserve our appreciation for respecting rules and coming together in this very difficult time. This crisis can and should be an opportunity to build a more resilient world by thinking and acting at a global, regional, and national level. We need to partner in order to develop and to ensure equitable access to safe and effective medicines and vaccines against COVID-19. Thank you.
Thank you, Honourable Minister. I would now like to invite Ireland. Your Excellency, you have the floor.
Yes. Honourable Chair, distinguished Director General, distinguished delegates, Ireland aligns itself with the statement delivered by Croatia on behalf of the EU and its member states. In the COVID-19 pandemic, we are facing global challenges unlike anything seen before in our lifetime. I wish to pay tribute to all healthcare workers serving on the front line, in particular, those who are doing so in humanitarian settings. They are showing extraordinary courage and dedication in their efforts to respond to this virus, and we call for their protection to ensure them around the world. In the International Day of the Nurse and Midwife, we also recognize the special contribution of our nurses and midwives, who account for half of the world's health workforce and are playing a critical role in our response to COVID-19. Ireland strongly supports the WHO, believes that the UN is the most central for global response across the three pillars of development, human rights, and peace and security. Should Ireland to the Security Council for the 2021-2022 term, we will work for the leadership and engagement expected of the Security Council at this critical moment. As we work towards effective treatment and a vaccine, we must ensure that there is equitable access to vaccines, diagnostics, therapeutics and equipment in line with our commitment to the 2030 agenda to leave no one behind. Ireland will continue to act in solidarity to help around the world and has already allocated more than 78 million euro to the global COVID-19 response, including a fourfold increase in our WHO contribution this year. I am also conscious of the importance of maintaining the range of essential health services at this time, including immunisation systems and also the priority of strengthening resilience in our health systems to build back better. Ireland stands ready to work with the international community to put an end to this crisis as soon as possible. As we say in Ireland, or there is strength when we come together. Thank you, Chair.
Thank you, Madam Minister. Would now like to invite Pakistan. Your Excellency, you have the floor. We have some technical problems. Pakistan, we will continue to Cambodia. Your Excellency, you have the floor. Your Excellency, we can hear you. Please continue.
Pakistan. Honorable President, Honorable Dr. Tedros, Honorable Ministers, distinguished ladies and gentlemen, today I'm truly delighted and extremely honored to have been invited to address this considered World Health Assembly on the topic combating COVID-19. On behalf of the government and my own behalf, I would like to express my deep appreciation for the invitation extended by His Excellency Tedros, Director General of the World Health Organization. COVID-19 Cambodia is a small country with a big heart. Cambodia has been calling for global international solidarity. No one can overcome the COVID-19. Cambodia has been recognized globally for the management of the Western cruise ship Haven and 2020. The decision which has become the Prime Minister of Cambodia chose to accept the ship in Cambodia was running short on supply to being turned away from several parts of the world. In collaboration and coordination with the World Organization, USCDC, and Super Board, and other partners, Cambodia made great effort in managing the screening, quarantine, lab testing, onward transfer of passengers and crew members. Cambodia and managing Amsterdam cruise ship event have highly appreciated contributions and work. At the time, the common health by COVID-19 required life, solidarity, and vital cooperation more than efforts. I believe that the World Health Organization and UN special agencies should handle the question related to Taiwan and according to the One China principle set for Resolution 2758 of the UN General Assembly, the Resolution 25.1 of the World Health Assembly. Cambodia respects the decision of the Republic of China and set up also matters. Since the first case expected on 27 January 20, Cambodia made our heavy effort to rapidly respond to all 150 confirmed cases with no death and 102 recovered today. We did not have any new cases for more than 1 month. However, in our high vigilance, we are currently gradually adjusting our public health and social measures through wise approach to maintain social economic continuities. Cambodia's development master plan 19 with 9 priorities. One, incident management and planning, second, surveillance and risk assessment, 3, laboratory, 4, clinical treatment and healthcare services, 5, infection prevention and control, 6, non-pharmaceutical public health material, 7, risk education, 8, point of entry, 9, operational logistics. The Honorable Minister, National Committee Combat COVID-19 has established and led some the Prime Minister of Cambodia, then the International Committee Combat COVID-19 with Prime Minister has played a role and is leading and coordinating the implementation and playing each role and responsibility the implementation measures across the whole of government and whole of society, including screening, quarantine, contact tracing, pharmaceutical and reducing and their own setback, as well as supporting communication and messaging health measures for communities, addressing the social and economic impact and ensuring business continuity with strongly supported by the provincial committees to combat COVID-19 at the subnational level. Good progress has been made on the implementation of the master plan. Funding has mobilized from the Royal Cambodia, development, private sectors, and civil society, national hotline, investment team, capacity, testing, enhance, value, physical distancing measures, like schools closure, school closure, and other technologies to reduce transmission. Health facilities and upgrade to manage COVID-19 patients with health workers.
Excuse me.
Management and infection prevention.
Excuse me, I would like to interject here. My apologies, but the distinguished delegate has far exceeded the allotted time. He needs to wrap up, please.
And many countries now have been supporting Cambodia in fighting against COVID-19 today. Finally, I wish you at the delegation, ladies and gentlemen, good health and success for deliberations.
Thank you, Honourable Minister. Would like to invite New Zealand. Your Excellency, you have the floor.
This crisis has reinforced the critical importance of healthcare and other essential workers, as well as global cooperation. New Zealand has looked to the information and experience of others to help shape a response appropriate for our own national context. We've also been open to sharing our experience in the hope that it will benefit others. Our relationship with the Pacific is particularly important in this respect. In looking to the future, we will be able to save lives, communities and economies if we commit to building on the strengthening of global relationships and mechanisms. In this respect, New Zealand is pleased to co-sponsor the resolution on COVID-19. We very much hope that all member states join with us in taking the steps towards a new era of global solidarity. It is vital that we uphold principles of non-politicisation and inclusivity when we come together at the international level. There is much work ahead, and New Zealand stands ready to work alongside the WHO, other member states and organisations. This experience has reinforced the critical role of the WHO, and we have borne witness to the excellent support provided to our neighbours in the Pacific, as well as using WHO's technical products nationally. In New Zealand, we will continue our focus on protecting the most vulnerable in society. As part of this, we recognise that people will experience differences in health and well-being that are not only avoidable, but that are also unfair and unjust. In the context of COVID-19, addressing equity means protecting older people and those with underlying conditions. It also means actively focusing on and mitigating any risk that this situation will further exacerbate the inequalities experienced by Māori and Pacific peoples in New Zealand.
Thank you, Honourable Minister. I would like to invite Cyprus. Your Excellency, you have the floor.
Of the world, on behalf of the Republic of Cyprus, a small island of 900,000 citizens in the Eastern Mediterranean, a member of the EU, it is my pleasure to address you today on the 73rd World Health Assembly and to express our gratitude to the World Health Organization for showing its global leadership in these unprecedented times. Cyprus aligns itself with the EU statement delivered by Croatia on behalf of the EU and its member states. Furthermore, we are grateful for the leadership role of the Director General of the World Health Organization. Today, we are united in a common goal of fighting the invisible, ruthless enemy of the COVID-19 pandemic, limiting its devastating impact on global health, economies, and social order. Today is an opportunity to stand back and take stock of what we have achieved so far, what lessons are there to be learned, and what we need to do in the future to win the war against COVID-19. A gateway between East and West and a popular tourist destination, Cyprus has always enjoyed huge movement of people to and from the island. From the outset of the pandemic, Cyprus has closely followed recommendations from WHO. Since March 9th, when the first 2 imported cases of COVID-19 were identified, as of today, 905 total cases have been reported. 401 of these cases have recovered. 1 in 5 cases out of 5 cases are healthcare professionals, and unfortunately, 17 deaths have occurred due to COVID-19. In the last weeks, the curve is finally flattening, and the number of new cases now is in single digits every day, and the ICU bed capacity is less than 5%. Cyprus has one of the highest uses of diagnostic tests, testing with more than 8,000 per 100,000 people, and our policy is to test early, contact tracing, and isolate. Our success in dealing so far with this pandemic is based on the following. First of all, there was and still is strong political commitment to take robust and proactive measures in line with HUD guidance to protect citizens from the spread of the COVID-19 pandemic. We did not hesitate to take hard measures early on, always in line with the guidelines of WHO and ECDC. As of February, we took measures at our entry points, monitoring passengers according to their country of origin. We implemented social distancing measures and actively educated our health professionals and the public as well. We declared a state of emergency on the 15th of March and allocated €100 million emergency fund for strengthening of our healthcare system. We proceeded with the establishment of public health clinics for assessment and management of suspected cases of COVID-19 and opening of helplines for the public and health professionals. At the same time, we imposed strict lockdown measures that restricted the movement of people, adopting a lockdown stay-home policy with curfews, with penalties for non-adherence and closure of all non-essential businesses. Furthermore, we have restricted entry to the country to only Cypriot nationals who, upon entry, they undergo a PCR test and are quarantined for 14 days in hotels monitored by the government with the assistance of the Ministry of Health. Great emphasis throughout this period was placed in the rapid identification of new cases through early testing and active contact tracing, isolation of suspected or symptomatic cases for 14 days, and self-isolation of contacts, close contacts. Furthermore, we engaged in random sampling and testing of the population, but also the frontline workers and healthcare professionals and vulnerable groups. Further actions were taken to protect vulnerable groups through stay-at-home policies and home deliveries. At the same time, we placed great emphasis on continuous monitoring of personal protective equipment and controlling and procuring stock, equipment and necessary consumables, and last, we actively trained staff in the proper use of personal protective equipment. We took measures to increase the capacity of healthcare system through mobilizing staff, decree of requisition of healthcare professionals from the private sector, and cancelled all elective surgical procedures, and designation of one general hospital for COVID-19 patients. Finally, we engaged in a communication strategy with daily press releases, travel advice, health information campaigns for hand hygiene, disinfection of areas and surfaces, and social distancing in different languages, utilizing both above and below the line marketing channels. The favorable epidemiological data and guidance from our scientific experts has led to a phased plan of gradual lifting of restrictions in 4 phases, guided by our epidemiological trends and active contact tracing. Phase 1, which started on the 4th of May, will see resumption of construction, non-urgent healthcare and schools according to the new directives. Phase 2, which will start on the 21st of May until the June 8th, will see the reopening of some food and beverage outlets, other retail businesses with strict physical distancing and hygiene protocols in place, and mandatory wearing of surgical masks in enclosed public places
Honourable
for
Minister,
employees
my
with
apologies,
strict
we will
supervision
have to
carried out.
move on with the
Phase
list of
3,
speakers.
which will be from the 9th of June until the 13th of July, calls for reopening of large commercial places, centres, hotels and airports. Resumption of activities will be in line with directives and continued favourable epidemiological data.
Thank you, Honourable Minister. We now go to Finland. Your Excellency, you have the floor.
Honourable President, Director General, delegates. Finland aligns herself with the statement of the European Union and its member states. To complement those messages, I would like to take a forward-looking approach. When this pandemic eventually ends, the world will look different. The toll on public health, the economy, and the society are beyond anything we have predicted. Yet, I want to be optimistic. I believe we have the power to translate the commitment to global solidarity into actions and build back better. We can do this by ensuring that health workers are kept safe, the most vulnerable groups are protected, the vaccines are common goods for health, inequity is countered through social security, and businesses are supported. It is imperative that we base our actions on a right-based approach and use a gender lens. We already know what works: universal health coverage and strong health systems, health in all policies approach rooted in evidence and impact evaluation, preparedness through essential public health functions, and taking a whole of society approach. We also have new tools that will help us get there. We can boost health systems through digital solutions and technological innovation if we mind the issues related to rights, ethics, and data protection. If we resolve to take a more comprehensive approach to recovery, we can avoid the pitfalls of past recessions. The economy of well-being can lead the way to a socially, economically, and ecologically more sustainable recovery. Thank you.
Honourable delegates, I would like to take this opportunity to remind everyone that during this session, speakers are taking the floor according to the list that we have established. For remaining speakers, kindly observe the time limits for the length of statements. There are still a number of speakers left on the list for today's session. In this case, it's not necessary for delegations to raise their flag at this time. Nonetheless, we have noticed that several flags are raised, and I would therefore like to ask that flags be lowered. Thank you for your cooperation and your understanding.
Thank you, Madam President. We would now like to invite Pakistan. Your Excellency, you have the floor. We are moving on with the list, and we would like to invite Nauru to deliver a regional statement. Your Excellency, you have the floor.
Director General of the World Health Organization, Dr. Tedros, Excellencies, Honorable Ministers, Ambassadors, ladies and gentlemen, I am honored to address the 73rd World Health Assembly on behalf of the Pacific Island countries, namely Cook Islands, Fiji, Kiribati, Marshall Islands, Federated States of Micronesia, Niue, Palau, Papua New Guinea, Samoa, Solomon Islands, Tonga, Tuvalu, Vanuatu, and my own country, Nauru. We extend our warm greetings to you all from the Pacific. As of today, there are 273 confirmed cases of COVID-19 reported in the Pacific: Fiji, French Polynesia, Guam, New Caledonia, CNMI, and PNG. The rest of the Pacific are still free of the coronavirus. We have not been idle. In fact, the Pacific health ministers met more frequently than ever since early 2020. We met once a week to discuss how we can prepare and respond to COVID-19. Each of our countries has unique customs and traditions, but share many characteristics: relatively small populations dispersed across vast distances. That means we face many common challenges in dealing with COVID-19. Working in solidarity, we focused on a common framework of health sector preparedness and response plan for the Pacific. We inventoried the capacity of our health systems, including technical capacity on critical preparedness, readiness, and response actions for COVID-19. Critical laboratory and medical supplies, personal protective equipment, and worked with partners to address the gaps we could without any delay. It is one of the most challenging tasks we are dealing with in the Pacific, and many of us started to implement border restrictions early on to avoid importation of the virus. In my own country, Nauru, our key challenges are geographical isolation, small healthcare workforce, a small critical care units, and communal living family arrangements that can easily fuel local transmission. For the Pacific, as countries start to implement tighter border restrictions in our region and globally, it became harder to send samples for testing, harder to send critical samples in. We subsequently agreed to form a humanitarian pathway, a mechanism that enabled the provision of medical and humanitarian assistance from regional, international, and development partners in a timely, safe, effective, and equitable manner. Moving forward, our Pacific Island countries are preparing for what is going to be a new normal. We have urgent, unfinished business such as building strong health systems, closing immunization gaps we cannot ignore. And there are emerging issues that demand our attention in the new normal. The COVID-19 pandemic is a global health emergency of unprecedented scale. It poses a real and extreme danger to the health and security of the Pacific people. In this time of crisis, we gather, albeit virtually, with our Pacific family to work in solidarity and with the continued support.
Thank you, Honorable Minister. We invite now Antigua and Barbuda to deliver a regional statement. Honorable Minister, you have the floor.
Director General, Excellencies, ladies and gentlemen, it is my honor to deliver this statement on behalf of the delegations of the Organization of the Eastern Caribbean States and Barbados. The Eastern Caribbean region watched the global pandemic of COVID-19 unfold, and with great concern, particularly because of the high risk of severe disease related to our high burden of chronic and non-communicable diseases. When the first cases were reported, the region took swift and decisive action to contain the spread of the disease, relying on basic public health measures of hygiene, quarantine, detection, contact tracing, isolation, physical distancing, and travel restrictions. Allow me, Mr. President, to pause and recognize the dedication and courage of our healthcare workers who serve on the front line, especially our nurses and our doctors. Containment works. All countries in the region were able to flatten the curve. However, the needed response to the public health crisis has resulted in the related unprecedented economic and social crises. International travel restrictions and strict physical distancing protocols have devastated tourism and other economic sectors. On average, tourism contributes over 50% of GDP and nearly 40% of employment across the region. Given the interconnectedness of our economies to countries in Europe and North America, our ability to respond to the pandemic is inextricably linked to the success of measures taken outside our shores. The region's response is further constrained by a fragile macroeconomic climate and high levels of external debt, contraction in donor support, and the threat of natural disasters. We are still recovering from the devastating impact of hurricanes in 2017, and the new hurricane season begins in 2 weeks. Mr. President, to ensure our small states are not left behind, the region calls on global partnership in the spirit of solidarity to address the following needs of COVID-19 and beyond. 1. Access to financing and debt forgiveness to allow the region to effectively address the fallout of the pandemic and to support vulnerable populations, households, and businesses. 2. Continued support of PAHO and WHO to strengthen health systems and support transitioning to appropriate technologies, including digital and telemedicine solutions. 3. Access to currently needed supplies for COVID-19 response and equal access to emerging rapid tests, medicines, vaccines, and technologies. And 4. Development of relevant protocols for reopening of the economies, including the hospitality and cruise industry. At this time, Mr. President, we would like to take the opportunity to thank PAHO and several regional agencies in the Caribbean community, including the Caribbean Public Health Agency, CARPHA, the Caribbean Disaster Management Agency, CDEMA, the Implementation Agency for Crime and Security, IMPACT, the Regional Security System, RSS, the University of the West Indies, UWI, for their continued and invaluable support. Mr. President, I thank you.
Thank you, Honorable Minister. We would like to invite Mali. Your Excellency, you have the floor. Your Excellency, we don't hear you. Can you please unmute and start again? No, we still cannot hear you. Distinguished Minister, we will come back. We invite Togo now to take the floor, and we will work with you to resolve these issues. Your Excellency from Togo, you have the floor.
Monsieur le Directeur général, Mesdames et Messieurs les ministres, chers collègues, distingués invités, nous nous inclinons devant la mémoire de tous ceux qui ont perdu leur vie dans l'actuelle pandémie de COVID-19 et souhaitons un prompt rétablissement à tous les malades. Monsieur le Directeur général, le gouvernement togolais félicite et salue l'Organisation mondiale de la santé pour son rôle moteur dans l'organisation de la riposte contre la COVID-19, à travers notamment son appui technique et financier, mais surtout les lignes directrices qu'elle édicte au fur et à mesure que les connaissances sur la maladie s'améliorent. Dans le même sillage, je voudrais ici saluer les autres organisations internationales, l'Union africaine, les organisations régionales, les pays amis et les philanthropes pour leur appui multiforme au contrôle de cette pandémie. Dès le début des alertes relatives au caractère pandémique de cette maladie et à la menace qu'elle représente pour tous les pays, un comité de gestion de la crise, présidé par le chef de l'État, a été mis en place dans mon pays. Des mesures appropriées ont été prises pour protéger les populations et limiter la propagation du virus. Ces mesures recherchaient le juste équilibre entre la protection de la santé des populations, la protection de l'économie nationale, la protection des droits sociaux et le respect des droits humains sous leurs divers aspects. Je vous remercie de votre bienveillante attention.
Merci, Monsieur le Ministre. We are going back to Mali. Distinguished Minister, you have the floor.
Je ne sais pas qui avait gardé son appareil. Non, hein? C'est la technique. C'est chez eux? Ah.
It seems we still have technical problems with Mali. I will now like to invite Haiti. Honorable Minister, you have the floor.
Prendre la parole au nom de la ministre de la Santé d'Haïti, Madame Clément. Madame la Présidente, Monsieur le Directeur général de l'OMS, Excellent, Mesdames et Messieurs, permettez-moi d'abord de vous transmettre les meilleurs vœux, président de la République d'Haïti, Jovenel Moïse, pour une assemblée mondiale de la santé consultative et fructueuse. Haïti souscrit à la déclaration prononcée par Tedros au nom du peuple francophone. Madame la Présidente, ma délégation félicite pour l'accès de votre pays, la communauté du monde web des Bahamas, nation chère de la Caraïbe, à la présidence de cette dite assemblée. Comme la plupart des pays, Haïti a décidé des mesures visant à prévenir et à contrôler la propagation de la pandémie de COVID-19. Avant même la manifestation de la maladie sur le territoire, les autorités haïtiennes ont élaboré, selon les directives de l'OMS, un plan de préparation et de réponse. le 19 mars dernier, suite à la confirmation du premier cas. Elles ont aussitôt décrété l'état d'urgence sanitaire sur toutes les zones du territoire. Dans le même ordre d'idée, une cellule scientifique, une commission sectorielle de gestion ont été mises en place. Des mesures barrières ont été renforcées et enfin, des ressources additionnelles ont été mobilisées pour la mise en œuvre du plan. Jusqu'à date, Haïti a enregistré 450 cas confirmés, 20 décès et 21 guérisons. Toutefois, force de reconnaître qu'en raison de la faiblesse de son système de santé, le pays n'est pas en mesure de faire face tout seul aux nombreux défis à la pandémie. La solidarité et la coopération internationale s'avèrent plus que jamais indispensables. Madame la Présidente, cette pandémie de COVID-19 est venue souligner pour nous la nécessité d'avoir des systèmes de santé solides et résilients, basés sur la solidarité internationale comme fondement de la sécurité sanitaire mondiale et de la couverture sanitaire universelle. À cet égard, Haïti soutient pleinement la plateforme internationale visant à accélérer le développement et la distribution équitable des tests, des traitements et des vaccins, ainsi que le renforcement des systèmes de santé des pays les plus vulnérables. Par ailleurs, ma délégation encore, une fois plaidé en faveur des Taïwan et les discussions à l'OMS, ne serait d'observateurs. Aujourd'hui, rien ne justifie que ce peuple qui a montré l'efficacité de son savoir-faire et la force de son système sanitaire dans la gestion de la COVID-19 sur son territoire soit resté en dehors du système de santé mondial. Pour finir, Haïti présente ses condoléances à toutes les victimes de la COVID-19 et profite pour exprimer sa solidarité aux travailleurs de la santé, au gouvernement et au peuple qui en sont touchés. Haïti est convaincu que par la commun de nos risques et de nos connaissances, nous arriverons à surmonter cette crise sanitaire mondiale sans précédent. Merci de votre attention.
Merci, Monsieur le Ministre. I would like to invite Maldives. Your Excellency, you have the floor.
Director General, my fellow Ministers of Health and other representatives from member countries, Chairperson, Assalamu alaikum and warm greetings from Maldives. At the very outset, I wish to state that in this time of an unprecedented global public health crisis caused by the COVID-19 pandemic, peoples and nations, and above all, we Ministers of Health need to stay ever more focused, resolute, and lead the efforts to overcome this calamity. For countries as well as for WHO, this crisis has taught many lessons. That no country or the world could predict a crisis of this nature or magnitude, that the less obvious consequences or collateral can be as impactful. As countries exhaust all their resources and energy on COVID-19, there may be other neglected health issues and health system needs, as well as socio-economic fallout from this crisis. Therefore, in my opinion, we need to look beyond and the aftermath of the pandemic. Another important conclusion we can draw from this crisis is the importance of health in all spheres of life, be it economy, be it environment, or any other aspect of life. The primacy of health cannot be undermined. When the world is faced with global health crisis, it is all of humanity that suffers. Mr. Chair, just like other countries, and despite early and rigorous efforts, Maldives was unable to prevent it from our shores and had to face its consequences. On one hand, the freeze on tourism activities and fishery exports were affecting our very livelihoods, while on the other, manufacturing countries were placing embargoes and global movements of goods came to a grinding halt. This affected us badly, impacting our containment efforts as well. Medical and other supplies were becoming very hard to procure and import. Here I wish to laud and appreciate the regional leadership by WHO Regional Office and bilateral assistance from neighboring countries, particularly that of India. And although not from our region, we also wish to note the assistance from China. Maldives, China has enjoyed decades of cooperation based on our commitment to One China policy. Indeed, we can contain this pandemic only through regional and international cooperation, and when all countries start working together and sharing critical information and resources. Viruses do not recognize borders. Together as one world, we can overcome COVID-19. Thank you.
Thank you, Honorable Minister. I would like to invite Brunei Darussalam. Your Excellency, you have the floor.
Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Mr. President, Vice President, Honorable Ministers, Director General, ladies and gentlemen. On behalf of the government of Brunei Darussalam, I wish to extend our sympathies to all who have lost loved ones and express our solidarity with those affected by COVID-19 and the healthcare workers and frontliners who work tirelessly to combat this. Since the start of the outbreak, we have detected a total of 141 cases and reported 1 death. Thankfully, through a careful program of testing, contact tracing, isolation and treatment, we have managed to control our first few clusters. Although the battle is not yet over, I wish to share 2 lessons from our experience in responding to COVID-19. First is the importance of enhanced surveillance and testing. We are an early adopter of testing in absence of symptoms, and we also conduct random sampling in community health centers and among the foreign worker population. Our test per capita ratio is among the world's highest, and we believe that containment efforts have been crucial in preventing widespread community transmission. Second, we established an effective community engagement strategy with daily press conferences, a dedicated 24-hour hotline for public inquiries, and a self-screening mobile application integrated with artificial intelligence and data analytic capabilities. Civic society has played a key role, and a significant grassroots movement sparked a surge of volunteerism and community advocacy. Our emphasis on containment along with community engagement has allowed us to control the disease without resorting to whole-scale lockdowns. Although we have implemented some level of moderate physical distancing, public services and businesses remain open and no movement restriction within the country have been imposed. As such, this combination of targeted approaches can be a useful way forward in the months ahead. Adopting a phased approach to de-escalation and leveraging technology for swift contact tracing could be a viable strategy to sustain the response to COVID-19 pandemic. We stand ready to work with WHO and the global health community on this important issue. Thank you.
Thank you, Honorable Minister. We would now like to invite Paraguay. Your Excellency, you have the floor.
Señor Presidente de la Asamblea Mundial de la Salud, Estados miembros, señor Director de la Organización Mundial de la Salud. La reunión de este año se realiza de modo no habitual, en un contexto extraordinario que interpela a toda la civilización para hacer frente a una pandemia que obliga a replantear nuestros sistemas de salud y la integración de nuestros pueblos. El Paraguay ha tomado decisiones drásticas de distanciamiento social muy tempranas, en consideración a la reciente mayor epidemia de dengue de su historia y de la fragilidad de su sistema de salud pública que actualmente se encuentra en un proceso de reforma, pero sobre todo en reconocimiento del valor de la vida. A 65 días de aquel momento, los datos actuales demuestran que las decisiones tomadas han sido correctas. Ahora toca la tarea, si se quiere más complicada, de levantar restricciones gradualmente y llevar adelante lo que hemos denominado como cuarentena inteligente, para enfatizar el concepto de dinamismo de las medidas y evitar el relajamiento en la estrategia. El pueblo paraguayo ha alcanzado una cohesión en torno a estas medidas, que acompaña con entusiasmo, incorporando un nuevo estilo de vida. Por otra parte, ante la rápida propagación del virus, resulta imperativo incluir a todas las partes relevantes, ya que la prevención y la contención epidémicas trascienden las fronteras. La plena participación de Taiwán en la Organización Mundial de la Salud y el estatus de observador en la Asamblea le permitirán a Taiwán compartir su experiencia con todo el mundo. Transitemos juntos por esta senda de desafíos impensados, poniendo lo mejor de nosotros, velando por nuestros pueblos, sabiendo que la humanidad puede y debe buscar maneras cada vez más justas y efectivas de convivir y crecer. Muchas gracias.
Thank you, Minister. We would now like to invite Pakistan. Your Excellency, you have the floor. We will continue with Ethiopia. Honorable Minister, you have the floor.
Thank you, Chair. Ethiopia commends the Director General for his inclusive report on COVID-19 and highly appreciates the fundamental leadership role of WHO in coordinating the comprehensive global response to the COVID-19 pandemic, as well as supporting the national response efforts of member states. The dedication of WHO leadership and staff demonstrated is to be highly valued rather than undermined during this crucial moment. Excellencies, distinguished delegates, the increased adverse impacts of COVID-19 pandemics on the lives of people and in the fabrics of society around the world is concerning. The virus is not only attacking the health of our people, but also devastating economies, social and cultural lives, and affecting our way of living at large. This is why the COVID-19 response requires a whole of government, a whole of society approach at national level and increased collaboration and support with a spirit of solidarity at the global level. Ethiopia calls for universal, timely and equitable access to quality, essential, affordable and efficacious health technologies and products, including vaccines, diagnostics, therapeutics and protective equipment. We call for the removal of all kinds of legal, policy or technical barriers that impede access. Since the first case was identified in Ethiopia on March 13, 2020, the government of Ethiopia took decisive measures, multidimensional measures to contain the spread of the disease in the country. Ethiopia is also actively contributing to the continental response through ensuring timely distribution of test kits and protective equipment to the African countries in collaboration with WHO, Africa CDC, and our partners. Ethiopia is committed to continue working closely with our neighboring countries to control the spread of this devastating disease in the region. I would like to conclude by reiterating that the only way out of this unfortunate and dreadful situation is collaboration based on respect and solidarity. I would also like to emphasize the instrumentality of WHO's leadership in order to overcome the challenge and to recover quickly by adopting to the new norm of global health security and health diplomacy. Thank you.
Merci, Madame la Ministre. Nous invitons Gabon. Votre Excellence, vous avez la parole.
Madame la Présidente, la délégation gabonaise vous félicite pour votre élection à la présidence de la 73e Assemblée mondiale de la santé et se réjouit de la tenue de cette Assemblée mondiale virtuelle en cette période de pandémie dévastatrice. Madame la Présidente, le Gabon a notifié son premier cas de COVID-19 le 12 mars 2020. Cependant, dès le 25 février, le président de la République, chef de l'État, son Excellence Ali Bongo Ondimba, avait instruit le Premier ministre, chef du gouvernement, de coordonner l'ensemble des interventions liées à la préparation et à la riposte à la COVID-19. C'est ainsi qu'un comité de pilotage du plan de veille et de riposte contre l'épidémie à coronavirus au Gabon et une commission technique nationale en charge de la coordination des interventions techniques sur toute l'étendue du territoire ont été créés, de même qu'un comité scientifique. Tout en veillant à assurer les fonctions essentielles du système de santé pendant la phase 4 de l'épidémie à coronavirus, le Gabon a pris un ensemble de mesures, tant sanitaires, sécuritaires, sociales qu'économiques, pour maîtriser les chaînes de transmission locales. Pour ne parler que des mesures sanitaires, l'accent a été mis sur le dépistage de masse, la prise en charge médicale et psychologique des cas de COVID-19, la recherche active des cas contacts et leur confinement, la communication sur les risques et par-dessus tout, la protection des personnels de santé et la promotion des mesures barrières. Madame la Présidente, la pandémie de la COVID-19 est bien plus qu'une crise sanitaire, économique et sociale. C'est un bouleversement de l'équilibre planétaire préétabli qui doit nous amener à repenser nos échanges de valeurs, réinventer nos modèles économiques et utiliser tous les paradigmes qui guident la coopération internationale. Les remèdes contre le coronavirus, il n'y en a point pour l'heure, mais déjà pointe à l'horizon de grandes manœuvres pour le contrôle d'une ressource qui, si elle n'est pas partagée, ne profitera à personne. Cette situation préoccupante nous donne l'occasion de faire un plaidoyer pour que les thérapies curatives et préventives liées à la COVID-19 soient les biens universels partagés équitablement par les peuples. Il en est de même sur l'urgence et l'impérieuse nécessité de trouver des remèdes à toutes les maladies qui tuent et déciment bien plus que la COVID-19 dans les pays en développement et singulièrement en Afrique, car il en va de la sécurité sanitaire de l'humanité toute entière. Enfin, le Gabon salue l'action de l'OMS, l'Africa CDC et de tous les partenaires engagés à ses côtés dans la riposte à la COVID-19 et réitère son total soutien au directeur général de l'OMS, le Dr Tedros. Je vous remercie.
Merci, Monsieur le Ministre. I would like to invite Belarus. Your Excellency, you have the floor.
Господин председатель, пандемия коронавируса представляет серьезный вызов современному миру. Ее последствия политические, экономические, социальные коснутся нас всех. В этом нет никаких сомнений. Пандемия еще не завершилась, но мы уже можем обсуждать некоторые вынесенные уроки. Беларусь хотел бы акцентировать внимание на трех. Первое. Пандемия продемонстрировала, что в мире нет единства и солидарности, которые позволили бы нам, сообща, выработать быстрый и эффективный ответ. Это закономерный результат нынешней геополитической неопределенности. Президент Беларуси Александр Лукашенко предложил выход из ситуации, провести глобальный диалог по безопасности. Такой диалог должен привести к более конструктивным международным отношениям. Это, в свою очередь, позволит нам сообща эффективно заниматься всеми трансатлантическими угрозами. Второе. Пандемия показала необходимость наличия эффективного глобального координационного органа. Таким, безусловно, является Всемирная организация здравоохранения. Убеждены в необходимости дальнейшего укрепления организации и ее механизмов реагирования на вызовы в области здравоохранения. Третье. Национальный контекст является важным фактором при выработке ответа на пандемию. Убеждены в том, что Беларусь выбрала правильную линию. Мы в оптимальной мере сохранили жизнедеятельность государства и его экономики, но при этом обеспечили максимальную защиту населения. И мы справляемся с оказанием медицинской помощи в таких жестких условиях. Благодаря сохранению действенной структуры санитарно-эпидемиологической службы, которая в условиях пандемии явилась ключевым инструментом предотвращения неуправляемого развития инфекции, проводя масштабные и тщательные эпидемиологические расследования. Кроме того, нами были заблаговременно разработаны планы реагирования на различные сценарии развития ситуации. Каждый сценарий был обеспечен кадрами, финансовым, медицинским оборудованием, лекарственными средствами и коечным фондом. В нашей стране была сохранена высокая обеспеченность населения койками, в том числе инфекционными и реанимационными, что позволило сохранить доступность медицинской помощи всем нуждающимся, даже в условиях пандемии. В республике не вводился тотальный карантин. Вместе с тем, все научно обоснованные противоэпидемические мероприятия и меры, рекомендуемые Всемирной организацией здравоохранения, выполняются. Нам удалось добиться минимальных значений показателей смертности, ниже 1%. Как сейчас мы наблюдаем, многие страны, выходящие из карантина, по сути, начинают проводить такую же линию, которую Республика Беларусь выбрала с самого начала. Господин председатель, позвольте выразить надежду, что нынешняя нетрадиционная сессия ВОЗ ознаменует собой переломный момент в борьбе с пандемией. Спасибо за внимание.
Спасибо большое. I would like to invite Angola. Your Excellency, you have the floor.
Excellency, Madam President of the World Health Assembly, Excellency the Director General, distinguished delegates. This year, we are in a different way, in a very complex sanitary and economic context that requires our countries individually and collectively to find innovative and pragmatic strategies to respond to the challenge never experienced in the recent history of humanity. Excellency, Angola, like the other countries, is in a demographic, epidemiological, and economic transition, with the health having several challenges in parallel high level of with the Republic of China. The country started in February this year implementation of technical prevention and preparedness against COVID-19. As soon as it became aware the occurrence of major events in that country, the executive, under the high direction of our President, João Lourenço, adopted the National Multi-Sectorial Plan with specific financial resources allocated by the Ministry of Finance of Angola. Initially, the measure consisted of closing borders, banning commercial and private passenger flights from Angola abroad and vice versa, institution of mandatory quarantine with surveillance of passengers and flights, transport of support for healthcare and placing immunological surveillance to suspected cases and their contacts. Also, the consequent measures consist of: number one, declaration of emergency and the publication of decrets. Number two, establishment of interministerial commission coordinated by the presidential office as well as the decrees. We approve with specific measures aimed to delaying the introduction and transmission of virus, the spread of pandemic throughout the country, protecting the most vulnerable population and the function of the economy. Mrs. President, the early implementation of these measures, in addition to home confinement, social distancing, hands hygiene, wearing masks, and extensive information campaigns on the epidemic of others has allowed the situation to be controlled. Today, we are with 50 cases. So far, confirmed 3 deaths, 30 active and 14 recovered patients. The National Institute of Health Research has already proceeded 5,978 tests, but we are very about the community transmission phase because massive testing a challenge. The big challenge is in Angola, the wide screen of population group of at risk for the characterization of community circulation of the virus. We therefore take the opportunity to ask for support of WHO in this area, as well as the strengthening of mechanisms to improve cross-border health surveillance within the framework of international health regulation. I cite the opportunity to express Angola's to the draft resolution of COVID-19 response submitted to the WHA-73, as well as to associate ours with statement delivered by the African group and the non-aligned movement, and concur as well with the liberation proposed by the WHO.
Excuse me, Madam Delegate, I must interrupt. I was trying to be very understanding and lenient with you, but you have unfortunately far exceeded the time limit. I must implore speakers to adhere to the time limit. 2 minutes for national statements and 4 minutes for group statements. I do apologize.
Thank you. Thank you very much for that.
Thank you, Madam Minister, and thank you, Madam President. We would like to invite Albania. Your Excellency, you have the floor. We would like to invite Slovenia. Your Excellency, you have the floor.
Distinguished President, Director General, dear delegates, Slovenia would like to align itself with the statement of the EU and its member states. Response to the COVID-19 pandemic has demonstrated that Slovenia has a strong public health system with well-coordinated primary health care and public health program for emergency preparedness and response. Efficiently organized civil protection with strong and dedicated health workforce, including laboratories, helped mitigate the health impacts of the pandemic. WHO external evaluation of the international health regulations core capacities performed in Slovenia in 2017 contributed to improve national emergency preparedness and multi-sectoral approach. Consequently, we perceive such evaluations as an important contribution to the implementation of the international health regulations. We have all experienced many uncertainties in responding to COVID-19. Slovenia appreciates the efforts of WHO in coordinating global response and is stressing the need for an appropriate evaluation that will contribute to better preparedness in the future. It has become evident that ensuring adequate and equitable access of essential medicines, medical equipment, personal protection equipment, and supplies is crucial. Transparent and inclusive international policies toward the development, manufacturing, and distribution of vaccines and medicines are needed for efficiently responding to the pandemic such as COVID-19. Providing access to new affordable vaccines, medicinal products, diagnostics and treatments in the spirit of global solidarity for all is necessary for our common success. To conclude, COVID-19 pandemic is a huge test for our health systems and societies. We strongly believe that cooperation and concrete action is accelerating implementation of already agreed international commitments is vital for ensuring preparedness and appropriate response in safeguarding health of our populations now and in the future. Thank you.
Honorable delegates, we have been at it for quite a while now. I think it would be good for us to take a short break. I suggest 10 minutes. I will ask the Secretariat to give an indication of who will be the speakers upon our return.
Thank you, Madam President. We will start with Turkmenistan, Slovakia, Austria, Mali, Timor-Leste, Egypt, Sierra Leone, and then we will continue. Thank you.
10 minutes, please.
swift, decisive, and evidence-informed action against the COVID-19 pandemic. The region continues to be guided by the Delhi Declaration, which health ministers of the region adopted in 2019, stressing a risk-based approach to emergency preparedness and response, which since 2014 has been one of the region's 8 flagship priorities. It was on the 13th of January that the first reported case was detected outside of China in Thailand. Since then, member state action, led at the highest levels with a whole of government and whole of society approach, has restricted the regional's case count to a comparatively low level. Thailand has now flattened the curve and is preparing to further lift restrictions. India launched very early containment measures, including a complete nationwide lockdown with a massive scale-up of lab capacities. Bangladesh, Indonesia, and Nepal are using WHO's Go Data tool to carry out robust contact tracing. Bhutan, Maldives, and Timor-Leste are demonstrating how small countries with geographical vulnerabilities can generate and apply maximum capacity. India, Indonesia, Thailand, and Sri Lanka have taken the initiative to participate in WHO's path-breaking solidarity trial, and Myanmar and DPR Korea were among the first countries to develop and finalize their preparedness and response plans. WHO has provided member states in the region its full technical, operational, and material support, from sharing key guidance and training health personnel to providing PPE and laboratory equipment and helping to plan, identify, and meet resource requirements. The region's pursuit of universal health coverage, with a focus on human resources for health and essential medicines, has strengthened health systems region-wide, which is helping member states to protect the continuity of essential health services as they directly respond to the pandemic. We have a rich tradition of solidarity and mutual support, which is reflected in the Southeast Asia Regional Health Emergencies Fund, which has been fully harnessed from the start of the outbreak. The region's world-class medicine and vaccine manufacturing capacity will be critical to global efforts to develop and produce safe and effective therapeutics and vaccines, and to ensure they are equitably distributed to all of humanity. WHO is committed to moving forward to control and suppress spread and empower individuals and communities to stay safe, healthy, and well.
Madam President, Your Excellency Kiva Bain, Honorable Ministers and Secretaries of Health, Director General of WHO, Dr. Tedros, distinguished delegates, WHO staff and colleagues, esteemed ladies and gentlemen, a very good day to you all. We are living in unprecedented times. We have been engaged over this past 5 months in an unrelenting battle against the COVID-19 pandemic, as well as the monumental economic and social emergencies that have been generated by the rampage of this virus. Countless lives have been lost, including those of many healthcare workers, and millions are facing impoverishment as they are without work, social protection, and basic income. In the Americas region, PAHO has continued to coordinate the pandemic response across countries, and we call on all national and local health authorities to work even more closely together, not only to contain the spread of the virus, but also to support the further strengthening of the health system capacity while building resilience for the future. COVID-19 has exposed the critical weaknesses in our health systems, the inadequacies of our social protection systems, and the inefficacy of approaches to public health. The sustained and persistently low levels of investment in health systems over time has impacted our capacity to respond to COVID-19, while at the same time ensuring continuity in the provision of essential health services. A piecemeal approach to social protection, including in health, has meant that the poor and most vulnerable have been most negatively impacted by COVID-19. Further, our public health emergency preparedness and readiness capacity has been found wanting, as we have not built the necessary capacities in the essential public health functions at the national level. As we address the immediate public health emergency, we recognize that our health systems of the future must be responsive, adaptive, and inclusive. A renewed political commitment, together with a corresponding investment, is required to build resilient health systems, ensuring universal access to health and universal health coverage. Additionally, a new and more profound degree of policy integration will be required in health and social development so as to ensure universal social protection and universal health. Our countries must effectively respond to the COVID-19 pandemic in order to ensure that the fundamentals for an economic recovery are in place. This is because the health of the people is
part of the health system and every health worker. COVID-19 is an encounter with the future. We know others will come. This would include the health impact of climate change, surging rate of non-communicable diseases, and rapidly aging populations. Our regional vision for the future is more relevant than ever. So many people around the world have suffered from COVID-19. I think it is not just our responsibility to respond to this outbreak, but it is our obligation to make our societies and health system stronger and better prepared to face the challenges of tomorrow.
Honorable delegates, I'm true to my word, at least I've tried to be. I would like to welcome you all back from your break. We will now continue to hear the statements by delegations which are provided under item 3. Before I turn the floor over to the Secretariat to manage this session, I thought I should explain why I'm insisting that we try and limit our statements to the time limits previously agreed. So far, we have heard quite a number of delegations submit their interventions on a subject that is of paramount concern to the international community. But just for the information of delegations, I would like to advise you that we still have 75 speakers on the list. Having said that, I would implore delegations to adhere to the time limit of 2 minutes for national statements. I do appreciate and understand that this is an historic session, and you want to be able to let the international community know your national concerns. But we have an aggressive agenda, and if we are to finish in the time limit, I really need the understanding and cooperation of the remaining speakers. I will now turn the session over to the Secretariat.
Thank you, Madam President. I will now read out the names of the 5 member states to speak next. Turkmenistan, followed by Slovakia, Austria, Mali, and Timor-Leste. We would like to invite Turkmenistan, followed by Slovakia. Excellency, you have the floor.
Уважаемый господин, благодарю за представленное слово. Хотел бы отметить в связи с возникновением ситуации мира COVID-19 Афганистана. Во главе уважаемый реагировала на ситуацию COVID-19. Мы начали предпринимать профилактические меры на защиту территории нашей страны от дорожной распространения данной инфекции. Государственную границу усилили контроль, карантинный надзор. На уровне Кабинета министров Туркменистана было создан и проведено заседание чрезвычайной комиссии и состав, на который входят все и ведомства стран. Задействованы к мерам реагирования и возникновения чрезвычайной ситуации в стране. Разработан межведомственный план по предотвращения завоза и распространения коронавируса COVID-19, усиление противоэпидемических мероприятий, а также усилена работа среди всех слоев населения по пропаганде выполнения гигиены и ведения здорового образа жизни. Созданы также противовирусные средства и тест-системы для диагностики COVID-19, диктантов, средств индивидуальной защиты и другие. Совместно с ВОЗом разработан проект плана системы готовности реагирования к Туркменстану на случай коронавирусной инфекции COVID-19. Что касается стратегии безопасного ослабления ограничений и поэтапного изменения ограничительных мер, Туркменстан планирует действовать в ситуации и опыт других стран. И пока все выведены ограничительные меры продолжают. Кроме этого, я хотел бы отметить инициативу с президента Туркменстана, выдвинутую на недавно проходившем онлайн-саммите глав государств и правительства движения и присоединения, по которым уважаемый президент обратил огромное внимание широкую механизму научной дипломатии по борьбе с пандемией и ее последствиями, а именно тесному взаимодействию между профессиональным обменным опытом, знанием и информацией по методам лечения и профилактики заболеваний, медицинским препаратам и оборудованием, средствам индивидуальной защиты. В этом концепте плана является предложение
Excellency, my apologies. Excellency, the audio quality is a bit too bad for us to be able to interpret what is being said, so we'll need to come back to you in a moment when we have better audio connection. So we'll have to move to the next country and we'll come back to Turkmenistan in a minute. Thank you, Excellency. We'll move to the next country because the audio was not good enough for us to be able to interpret what was being said. We'll come back to you in a minute. I now would like to invite Slovakia to be followed again by Turkmenistan. So Slovakia, Excellency, you have the floor.
Honorable Chair, distinguished Director General, colleagues. Slovakia aligns itself with the EU statement and EU co-sponsorship of draft resolution on COVID-19 response. Let me start by saying that the global reach of the novel coronavirus has been showing us that although we may have faced numerous challenges in the past, this one is indeed different. It is also important to stress that meanwhile our focus is set on the general population, the vulnerable and marginalized groups should not be placed under the radar and deserves our undivided attention. Furthermore, the appropriate attention should be also drawn to the fact that once the vaccine against COVID-19 is released for the treatment use, the international community should make sure it will not be commercialized in the first place, but rather it should represent an instrument for the general good. At international level, Slovakia considers the best practice and information sharing as a key tool for managing the pandemic efficiently. We have observed that deaths reporting due to COVID-19 varies significantly, creating hidden asymmetrical picture about the country's data statistics. Therefore, we would invite the WHO to provide a guidance on data collection and their reporting in order to ensure reliable international comparison. Slovakia widely supports the global efforts to tackle the novel coronavirus, and I wish to reiterate the firm commitment of my country to work with the WHO, the states all over the world, and other relevant partners in the spirit of global solidarity. Thank you very much.
Thank you, Minister. We would like to invite again Turkmenistan. That will be followed by Albania. Excellency, you have the floor again.
Господин председатель, благодарю за предоставленное слово. Хотел ответить в связи с возникновением ситуации по мире COVID-19 правительства Туркменистана. Уважаемый президент Гурбангулбек Мухаммедов реагировал на ситуацию по COVID-19. Мы начали предпринимать профилактические меры по защите территории нашей страны от распространения данной инфекции. На государственных границах усилен санитарный карантин надзор. На уровне Кабинета министров Туркменистана были созданы и проведено заседание чрезвычайной противоэпидемической комиссии, в состав которой входит все министерства и ведомства страны. Задействованы меры реагирования и возникновения чрезвычайной ситуации в стране. Разработан межведомственный план по предотвращению завода и распространению нового коронавируса COVID-19, усиление противоэпидемических мероприятий, а также усиление работы среди всех слоев населения по пропаганде выполнения правил личной гигиены и ведения здорового образа жизни. Создан запас противовирусных лекарственных средств и системы для диагностики COVID-19, консультантов, средств индивидуальной защиты и другие. Совместно с ВОЗом разработан проект плана обеспечения готовности реагирования Туркменистана на случай коронавируса инфекции COVID-19. Что касается стратегии безопасного отступления ограничений и поэтапного изменения ограничительных мер, Туркменистан планирует действовать, учитывая эпидемиологическую ситуацию и опыт других стран. И пока все введенные ограничительные меры продолжают действовать. Кроме этого, я хотел бы отметить инициативу президента Туркменистана, выдвинутых на недавно проходившем онлайн-саммите глав государства и правительства движения непросветления, по которому уважаемый президент Туркменистана обратил огромное внимание широкому применению механизма научной дипломатии в борьбе с пандемией и ее последствия, а именно тесное взаимодействие между профессиональными, обмен опытом, знаниями и информацией по методам лечения профилактики заболеваний, медицинских препаратами и оборудованием, средствами индивидуальной защиты. В этом контексте весьма актуальным является предложение туркменского лидера о создании международного совета ученых медиков. Это, прежде всего, налаживание необходимых в данный момент связи между передовыми учреждениями здравоохранения и медицинскими центрами, исключение искусственной изоляции физиологии, которые могут быть использованы для элиминации пандемии. Мы выражаем глубокое сотрудничество по вопросу внедрения требований международных и укрепления потенциала в области готовности и реагирования системы общественного здравоохранения по всему спектру, возникающий сейчас вопрос требует усиления координации ООН. Еще раз хотел бы подчеркнуть полную нашей страны, деятельность ВОЗ и поблагодарить руководство ВОЗ и сотрудников этой организации и их профессиональной работы. Благодарю за внимание.
Thank you, Minister. I now invite Austria to be followed by Mali. Excellency, you have the floor.
Ministers, Excellencies, Austria fully aligns with the statement of the European Union and its member states. Our crisis management fights primarily a virus, SARS-CoV-2. Many of us are quite successful in implementing our containment programs. But we have to focus also simultaneously on the support of our economies, labor markets, reopening schools and universities, international travel and tourism. Austria is now in the phase of adaptive recovery, going forward in 2-week steps. We started in mid-April by opening all stores and services, and by the end of May, we will back to be normal life. In Austria alone, the economic impact of this pandemic crisis is enormous. We might end up with a minus of 7.5% in GDP in 2020. From WHO, as a supreme technical health authority, we expect objective technical guidance in many of these areas. This pandemic is not alone about health. We, who are very early in this, have to develop all right measures for this adaptive recovery instantaneous without being able to look at many good practices. Another global concern we want to share. We all should consider future COVID-19 medical treatments and vaccinations as a global public good, accessible to all member states at a reasonable price. WHO in this regard has also to play an important role to facilitate solutions regarding intellectual property rights. Austria has shown international solidarity by pledging 31 million euros at the Coronavirus Global Response International Pledging Event recently hosted by the European Commission. On behalf of Austria, I would like to thank WHO and the Director General for their leadership and their excellent work. Dr. Tedros, we trust in you and WHO.
Thank you, Minister. I now give the floor to Mali, followed by Egypt. Excellency, you have the floor. Mali, please turn on your sound so that we can hear you. Okay, we'll come back to you a bit later, Mali. I will now give the floor to Timor-Leste. Timor-Leste, you have the floor. We'll also come back to Timor-Leste. I will now give the floor to Egypt. Egypt, you have the floor. Okay, we'll come back to Mali, Timor-Leste, and Egypt a bit later. I will now give the floor to Sierra Leone. Sierra Leone, you have the floor. So as we're trying to resolve some communication problems, or some connection problems rather, we will now go to Spain. Spain, you have the floor.
España agradece al director general su intervención e informe sobre diferentes trabajos de la organización, en especial la actualización de la situación de la pandemia global por SARS-CoV-2, así como por los esfuerzos de la OMS para dar apoyo a los países. Sobre este particular, España enfatiza en la colaboración cercana que está teniendo la OMS en apoyo de los trabajos de nuestro país en la lucha contra la pandemia. Me gustaría, por tanto, poner de manifiesto la importancia de la organización y la confianza en su labor como elementos vitales para su puesta en valor, lo que hace necesario que se refuerce el sistema de salud global evitando duplicidades. Confiamos en que la OMS siga desempeñando un liderazgo bien reconocido a nivel mundial y lo haga a través de la escucha activa de las peticiones de los Estados miembros, siguiendo la máxima de responder de manera efectiva y eficiente. España apoya a la OMS en su papel vertebrador de diferentes esferas en el abordaje multisectorial de la salud. Es el momento de demostrar que el futuro, sin duda, precisa ser diseñado como un reto compartido entre todos, siempre teniendo en cuenta la dimensión de género y cómo sensibilizar a la ciudadanía. Pongamos en marcha mecanismos robustos de cooperación e información. Establezcamos lazos permanentes entre la ciencia y los que toman decisiones políticas, sin olvidar a otros agentes y a la sociedad. Para España, la cobertura sanitaria universal, hoy más que nunca, es la piedra angular para disponer de sistemas sanitarios eficientes, resilientes y de calidad, que den respuestas a emergencias, pero también en la protección permanente de la salud. Reforcemos los sistemas públicos basados en la continuidad asistencial, centrados en la atención primaria y en los pacientes. Busquemos con ahínco las metas establecidas en la ODS 3 de la Agenda 2030. Reforcemos la cooperación internacional en el mejor acceso a las vacunas, los medicamentos, los test diagnósticos y la ciencia para el COVID-19. Animamos la iniciativa ACT Accelerator que coordina la OMS. España confía e insta a otros Estados miembros a que sirvan al fortalecimiento del consenso y el multilateralismo representado por Naciones Unidas, con la OMS jugando un papel central. Confiamos por ello en culminar esta 73 Asamblea Mundial de la Salud adoptando por consenso la resolución sobre la respuesta a SARS-CoV-2. Necesitamos un nuevo acuerdo global en salud para reforzar las capacidades nacionales frente a las nuevas pandemias. Impulsemos el acceso al agua y al saneamiento, la salud en el trabajo, la lucha contra el cambio climático, abogando por las energías renovables. Muchas gracias.
Thank you, Minister. I now give the floor to Cook Islands, to be followed by Marshall Islands. Cook Islands, you have the floor.
Excellencies, ladies and gentlemen, kia orana. Today we come together as one, as health leaders representing health systems around the world. Let us use this opportunity, even for just a brief moment in time, to coordinate our efforts against COVID-19 in unity. On behalf of the Cook Islands government, I extend our prayers and sincerest condolences to those who have lost lives and livelihoods from this devastating pandemic, COVID-19. The Cook Islands is one of a few countries that remains COVID-19 free. This was a result of our early national health emergency response and the mobilization of our communities to implement critical public health measures. Our health system has been reoriented to optimize universal health coverage and to focus on primary care and preventative community-based health services. This is designed to enable rapid detection of COVID-19 and activation of contact tracing, as well as address the burden of NCDs. The social and economic impact has been severe for many countries, the Cook Islands included. We are progressing economic recovery measures that promote climate change mitigating initiatives and the protection of our social and physical environment. Strategies to safely ease border restrictions are requiring transnational conversations to ensure we protect both our population and those beyond our borders. We are adapting to our new norm and the new opportunities that have risen to provide quality, equitable health services. Finally, I wish to thank WHO, SPC, the New Zealand and Australian governments, and other development partners for assisting the Cook Islands in our national response. We are in this together, so no one gets left behind. Kia orana e kia manuia.
Thank you, Minister. I now give the floor to the Marshall Islands, to be followed by Uruguay. Marshall Islands, you have the floor.
Excellencies, Mr. President, Dr. Director General, Yahweh and greetings from the Republic of the Marshall Islands. The Marshall Islands fully supports the Pacific Islands statement delivered by the government of Nauru. Mr. President, my country remains one of the very few nations that remain COVID-free due to our collective efforts and early interventions. We are still undertaking measures to strengthen our health infrastructure. We sincerely thank our partners for their support, but much more is needed. We encourage the WHO and the international system to continue to strengthen its specific approaches on public health responses. Mr. President, the Marshall Islands joins other nations calling for an objective and independent investigation into actions around the early COVID-19 international response. It is very important that timely and transparent information be shared. Mr. President, the Marshall Islands also joins other nations calling for Taiwan's participation at the WHO and the WHO activities, ending unfair treatment which has endangered global health. Without active WHO participation, the Republic of China, Taiwan, risks becoming a cap in our global health system, despite strong efforts and generous contributions for other countries, including mine, to preventing and containing COVID-19. Mr. President, Republic of China, Taiwan has proven again to be a valued partner to countries in need, including my own. With experiences from coronavirus, all countries, including Republic of China, Taiwan, should collaborate and cooperate for a healthier future. Thank you, and Kamboltata.
Thank you, Minister. I now give the floor to Uruguay, to be followed by Ecuador. Uruguay, you have the floor.
Desde Montevideo, Uruguay, en este Ministerio de Salud Pública, tenemos el agrado de ofrecerles lo que ha sido nuestra acción frente a la epidemia de COVID-19. En primer lugar, hemos realizado una campaña de bien público de coronavirus a los efectos de dar a difundir todos aquellos aspectos de consulta precoz. Hemos diseñado una aplicación móvil que va guiando al usuario a diferentes niveles de complejidad y lo pone en contacto con su usuario. Hemos privilegiado la atención primaria en domicilio sin necesidad de concurrencia a los centros hospitalarios. Se han reprogramado las intervenciones quirúrgicas de coordinación, así como las consultas médicas que fueran innecesarias a los efectos de liberar camas de CTI. Se realizó desde el primer día de diagnóstico una declaración de emergencia sanitaria nacional, se aseguró el acceso a la población, se redactaron las normas de protección al personal de la salud, se procedió al aislamiento social y físico, se declaró el cierre de fronteras a tiempo, se anticipó y se duplicó la cantidad de vacunas antigripales, se promovió el uso de tapabocas, se hizo una campaña además para prevenir efectos psicosociales adversos, se trazó un mapa sanitario nacional en red y se contrató un equipo de expertos médicos desarrollando además técnicas diagnósticas nacionales específicas de PCR en real time nacionales a efectos de evitar los efectos de cuello de botella. Se han capacitado a todos los recursos médicos, humanos, médicos y de enfermería, y se ha actuado de oficio en instituciones vulnerables como personas en situación de calle, en residenciales y asentamientos. Hemos asimismo trabajado en la tercera línea de tener todo el equipamiento de CTI necesario y se han iniciado líneas de investigación en lo que es bancos de plasma y tratamiento preventivo con BCG e hidroxicloroquina en personal de la salud. Asimismo se han estimulado los convenios de complementación público-público y público-privado a los efectos de dar respuesta a la contingencia. Hemos desarrollado un centro de contingencia y convalescencia y centros específicos de atención COVID. Hemos trabajado protocolos para distintos sectores de reinserción laboral y hemos desarrollado un abordaje multidisciplinario, social, económico y epidemiológico con acceso a la salud en su nivel primario, secundario y terciario. Además, hemos organizado la repatriación de connacionales y establecido corredores sanitarios para aquellos turistas o tripulantes de naves que tuvieron surtos en el puerto de Montevideo. Humanismo y calidad de atención siguen siendo el norte en Uruguay.
Thank you, Minister. I now give the floor to Ecuador, to be followed by Vietnam. Ecuador, you have the floor.
Señora Presidenta, Director General, colegas ministros y líderes distinguidos, es un honor para mí regresar a la Asamblea Mundial de la Salud en representación del gobierno del Ecuador. Con millones de casos y miles de muertos, la pandemia por COVID-19 ha ejercido una presión sin precedentes en los servicios de salud a escala global y en especial en aquellos estados en vías de desarrollo. Al respecto, los múltiples desafíos de esta crisis nos han llevado a replantear aspectos centrales de nuestros sistemas de salud, tales como la atención y acceso al servicio de grupos prioritarios, cadenas logísticas de suministros, el acceso equitativo a medicamentos y dispositivos médicos, la investigación científica y el valor de la articulación entre los gobiernos centrales y locales. Esto basado en atención primaria de salud. En este sentido, la pandemia retrocederá, pero nosotros no podremos regresar a las condiciones precedentes. Este episodio nos ha mostrado y demuestra, como nunca, que el desarrollo de respuestas conjuntas y articuladas desde la escala local, nacional, subregional, regional y global deben ser consideradas como pilares de la estructuración de un proceso sostenible de desarrollo. Esto a fin de emprender acciones concretas que permitan enfrentar de mejor manera los desafíos propios de la salud pública. En este marco, abogamos por la promoción de la salud, la prevención de la enfermedad y la recuperación y rehabilitación en todos los niveles. Propiciamos la generación de mejores espacios de participación social e inclusión de todos los actores. Y buscamos que todos los miembros de la sociedad compartan su responsabilidad en la custodia de la buena salud como un deber que ha sido consagrado al Estado y su autoridad sanitaria. Consecuentemente, celebramos iniciativas como la resolución referente a COVID-19 presentada por parte de la Unión Europea, sobre la cual expresamos nuestra decisión de coauspiciarla para generar espacios que promuevan la adopción e implementación de respuestas a la pandemia, así como la movilización de los recursos necesarios para la misma. De igual forma, nos sumamos a la propuesta realizada por Costa Rica para la creación de un repositorio para tecnologías de la salud, datos y conocimientos que sirvan para acelerar los descubrimientos científicos, desarrollo de tecnologías y compartir los beneficios de los avances científicos y sus aplicaciones. Alentamos a que los estados, el sector académico, el sector privado, las instituciones de investigación y las agencias de cooperación, entre otros, se sumen al llamado a la acción para enfrentar de manera conjunta y solidaria a la pandemia bajo la perspectiva de que la salud constituye un bien público global. Finalmente, reconocemos el liderazgo del Sistema de Naciones Unidas en la respuesta a la pandemia y agradecemos a la Organización Mundial de la Salud por su acompañamiento constante en este desafío global, del cual la humanidad prevalecerá. Asimismo, instamos a todos a continuar trabajando de manera conjunta en pro de la salud. Para concluir, apelo al espíritu de unidad y solidaridad de los estados para que pasemos del discurso a la acción mediante la intensificación de la cooperación y la colaboración en todos los niveles para contener y mitigar la pandemia de COVID-19, al igual que promover la salud y el servicio prioritario para los más vulnerables. Gracias.
Thank you, Minister. Referring back to the words of Madam President, her guidance was 2 minutes per intervention, and we would appreciate if you could hold to that guidance, please. I now give the floor to Vietnam, to be followed by the United Arab Emirates. Vietnam, you have the floor.
Excellency President, dear Dr. Tedros, Director General of World Health Organization, Honorable Minister of Health Member State, distinguished delegates, ladies and gentlemen. Vietnam was one of the first countries affected by COVID-19 and recorded the first case on January 23rd, 2020. Up to now, 320 cases have been confirmed with no deaths, and 66 were imported cases. Among them, more than 80% cases had recovered. Ladies and gentlemen, in Vietnam, with strong political leadership, we undertook series of public health measures to fight epidemics. It's like fighting against the enemy. Immediate action has been done now in a resolute and coordinated manner and adjusted promptly if required. The National Steering Committee to combat COVID-19 has been set up at the early stage of the outbreak, with strong commitment from the whole system and multi-sectoral coordination for strategy including input, strictly prevention from outside, early detection inside, isolation treatment has been implemented effectively with engagement of the local authority to direct and mobilize all resources on site, including commands, force, means, and logistics. Today, Vietnam has managed to keep the situation under good control in the past 32 days. Vietnam has not recorded a new case in community. Vietnam, with our capacity, have actively sent information and experience of prevention control COVID-19 and provided transparency information to WHO and other countries through the IHR channel. Ladies and gentlemen, realizing that COVID-19 will stay with us for a long time, Vietnam calls for further dialogue and cooperation mechanism to respond to COVID-19, to review the core capacity of member states and required by the IHR, including policy, surveillance, risk assessment, laboratory, infection prevention and control, clinical management, risk communication and resources, so as to recommend those that should be continually strengthened in the coming time. Ladies and gentlemen, I would like to take this opportunity to convey thanks to the WHO and the international community for providing support and assistance to Vietnam as well as many other member states in their effort to fight against the pandemic. I wish you all good health. Thank you very much for your kind attention.
Thank you, Minister. I now give the floor to the United Arab Emirates, to be followed by Nepal. United Arab Emirates, you have the floor. We have trouble connecting to the United Arab Emirates. We'll come back to them later. I now give the floor to Nepal, to be followed by Guyana. Nepal, you have the floor.
Namaskar.
Mr. President of the Assembly, Mr. Director General of the WHO, distinguished dignitaries. In the context of COVID, we all are passing through a challenging time with many risks and uncertainties. On behalf of the government of Nepal, I would like to express high appreciation and sincere gratitude to the frontline health workers for their untiring effort in COVID response. Diseases such as COVID have no boundaries. Neither they discriminate people based on color, class, and group. Hence, it is our collective responsibility to fully secure health rights of people across the globe. From the outset, Nepal has been responding to the COVID outbreak with high-level political commitment and mobilizing multi-sectoral mechanisms. While Nepal is institutionalizing federalism, the ongoing efforts to respond to this epidemic from the three tiers of government have been instrumental. In Nepal, number of infected people is in increasing trend. It is therefore the upcoming days can be further challenging for us. In addition, it has further emphasized the need for resilient and responsive health systems and sustained level of in-country production of medical goods and services. The effort on the COVID response from WHO and other national and international stakeholders have been commendable. It has further proved the historic role played by these organizations in protecting human health. I would like to emphasize the need for unified efforts by the member states for universal health security. Finally, I wish for the successful deliberation of this assembly, which is being conducted with the use of available advanced technologies, despite several limitations. Thank you and namaskar.
Thank you, Minister. I now give the floor to Guyana, to be followed by Afghanistan. Not Cameroon, by Afghanistan. So Guyana, you have the floor, followed by Afghanistan.
Warm greetings from the government of the Cooperative Republic of Guyana and the Ministry of Public Health to all member states of the World Health Assembly. Guyana wishes to congratulate the WHO and the Secretariat for its stewardship over the past few months of the COVID-19 pandemic. For all countries, and especially for low and middle income countries, this stewardship has been priceless. Guyana calls for continuing the global solidarity and coordinated responses that will contribute to finding solutions soonest and thereby reduce the social and economic impacts and insecurity resulting from the pandemic. The importance of strengthening and expanding primary health care and routine immunizations should remain on the agenda as we work to prioritize prevention and preparedness at national and global levels to mitigate the effects of COVID-19 and future health challenges. Guyana wishes to underscore the need to speed up the development and production of treatments and vaccines, and to ensure equitable access and distribution in a timely manner as these become available. Finally, Guyana recognizes the importance of human resources and calls for greater investments in this area, especially in strengthening the capacity of our first responders. Guyana continues to strengthen its emergency response capacities across the country to mitigate the spread and effects of COVID-19 and reiterates its appreciation of WHO's coordination and global leadership to the pandemic. Thank you.
Thank you, Minister. I now give the floor to Afghanistan, to be followed by Iraq. Afghanistan, you have the floor.
Fighting against requires a coordination by regional and global. It is the time to further the HR plan from partners for effective management of public health emergencies. One of the major challenges is to maintain progress in the face of increasing instability, violence, and rising poverty. Maternal mortality remain unacceptably high. The coverage of population is suboptimal mainly in areas. Both public and private health remain low. The country continues to suffer an increasing burden because of armed conflict, which contributes to the mass population displaced. Likewise, police have been facing numerous challenges, such as growing restrictions implementing house-to-house campaigns. The situation is being further worse due to the postponement of the vaccine campaign. Attack on healthcare providers and health facilities in Afghanistan continue to remain a major concern. I am sure you are aware of the recent attack on a maternity hospital in Kabul, which took the lives of many mothers. In this incident, we lost one brave midwife officer who delivered critical health services. My thoughts and sympathy are with the families of the finally COVID-19 have been disproportionately and conflict zone, making them extremely vulnerable with now more than ever demands peace in the region. In order to overcome the challenges as a fragile and low-income country with count on its continued support during this difficult time. My last word for us, COVID-19 is not only a challenge, but an opportunity as well. It helps us detect our undetected capacity, resilience, and hope for and success. I thank you.
Thank you, Minister. I now give the floor to Iraq, to be followed by San Marino. Iraq, you have the floor. Iraq, it seems you are connected, but we can't hear you. Can you please turn on your microphone if it's muted? Iraq, you have the floor. Okay, we'll move on and we'll come back to Iraq later. I now give the floor to San Marino, to be followed by Namibia. San Marino, you have the floor.
Okay. Madam President, Mr. Director General, dear colleagues, my country has been dramatically affected by the coronavirus. When we registered the first case at the end of February, our only hospital had no isolation wards and only had 6 intensive care units. Now we have 80 beds in the isolation wards and 20 in the intensive care. On April 7, we began serological screening of the entire population, starting with the health workers and the police forces involved in the operation. Then moving on to the family of infected people, and finally we started screening workers. To date, our country has carried out almost 4,000 molecular swabs and more than 7,000 serological tests on its population, counting only 34,000 inhabitants, and on cross-border workers from neighboring Italy. The contagion in the family circles of those who have been sick is 15–20%, while in the rest of the population we register much lower percentage, close to 1%. We are confident that the epidemiological investigation and the tests, which we intend to do on the entire population, will be of great help in understanding the phenomenon we are facing. This health crisis immediately turned into an economical crisis. The inability to have access to European funding exposes us to an unprecedented crisis. We therefore hope that channels of solidarity can be opened as soon as possible, including by the WHO, within which our country has largely contributed over the years in the coordination as co-leader of small countries. I would like to address my heartfelt thanks for his support, most of all to Mr. Kluge, WHO Regional Director. Thank you.
Thank you, Minister. I now give the floor to Namibia, to be followed by Sierra Leone. Namibia, you have the floor. Namibia, you have the floor.
Yeah.
We can hear you, Minister. Please go ahead, Excellency.
Thank you very much. The 7th session of the World Health Assembly is taking place at a time when the world is completely devastated. We express our most sincere and heartfelt condolences to the loved ones who have succumbed to COVID around the world. Further, I wish to commend the and the Secretariat for convening the meeting during this time. Your sterling work, the WHO excellent protocol globally to respond to COVID-19 pandemic are truly commendable. Namibia calls for increased support to the enable it to provide assistance, coordinate the distribution of commodities, as well as effectively response. We further aid that it will be empowered by its member states to ensure that all technologies the pandemics are treated as not goods. Madam President, Namibia recorded positive cases on the 1st of March 2020. We have since recorded 16 cases, with the last case recorded on the 5th of April 2020. The majority of were imported, with 3 cases recorded as transmission. Out of the 16 cases, 13 have fully, but the past days with no new cases. We are fully aware we cannot relax. We must continue to prevent the spread. in our country. The risk of importation of virus now may be vehicular is one of the main. It is thus critical stronger coordination and synchronization of intervention, especially for. I thank you.
Thank you, Minister. I now give the floor to Sierra Leone, to be followed by Nauru. Sierra Leone, you have the floor.
Yes, can you? Let me sincere greetings from His Excellency the President to the leadership of WHO. Let me also say that Sierra Leone was exposed to the Ebola scourge from 5 years back. That experience made us not a bit more prepared, but one that was ready to the challenge. This was led by His Excellency the President. All the basic tenets of hand washing, of social distancing, of using the mask as well, all of that started very early in the year. And the National Policy Agency decided to create an autonomous entity described as the National Response Team to COVID-19. That team activated the 7 disease pillars, that of surveillance, laboratory, case management, food and nutrition, psychosocial, and quarantine. We set out to ensure that we screen those entering into the country. We also set out to quarantine those that have exposed to the disease or from countries that have registered more than 50 cases. We were, I would say, the last country to register the disease in West Africa. We had something like the first case coming up the 31st of March. Now it is with us. We expanded testing. We did that with PCR fluorescence methodology. Currently, we have tested well over 4,000 people, but the positivity number is 519 as at today, the 18th of March. Of that number, 148 now left the hospital. We believe they are free of the disease. That indeed is a good mark, but we have lost 33. Of those, 17 happen to have occurred outside of the treatment center, reflecting some weakness in the health system. We've gone through the issues of closing down the country for 3 days. We have shut down schools, we've shut down churches, and nowadays, we now experience that we are getting other things coming up. Gender violence, rape, mental health issues. Well, it is clear to us that we will not have been able to attain as much as we have without the support of various agencies, Africa CDC, WAHO, DACMA Foundation, the World Bank, Global Fund, Islamic Development Bank as well. But it is clear to us that the intervention have to be health system strengthening. I thank you very much.
Thank you, Minister. I now give the floor to Nauru, to be followed by Mauritius. Nauru, you have the floor.
Nauru continues a strong push in preparedness and response against the introduction of coronavirus as multi-sectoral governments, private, donor support and regional technical advising work in collaboration. This is in close alignment with the Pacific Humanitarian Team COVID-19 Humanitarian Response Plan. Seeing how easily COVID-19 has overwhelmed the health systems of some of the countries with strong health sectors, Nauru has taken a strategic zero-tolerance approach of catch and contain, as we cannot afford local transmission that could overwhelm our resources. We have two levels of framework of phased strategic response plans under a current declared state of disaster. The first is a coordinated national all sectors response plan. The second is a health sector specific surge capacity. To undertake the following steps to mention a few. 1. Border health travel advisories and restrictions of direct entry. 2. Compulsory screening at our ports of entry. 3. Dedicated transition facilities to quarantine travelers for 14 days. 4. Ongoing setup a new state-of-the-art CCU with 18 beds for confirmed coronavirus cases requiring hospitalization. 5. Rolling out of PCR testing. To close, COVID-19 pandemic remains one of the most challenging tasks we are dealing with, and Nauru acknowledges the continued support of our partners, especially Australia and the Republic of China, Taiwan. The success of the Republic of China, Taiwan in dealing with this crisis cannot be ignored. We need to harness inclusivity and global cooperation at this level more than ever to defeat this pandemic. Wishes to render its full support the draft resolution COVID-19 response. Thank you.
Thank you, Minister. I now give the floor to Mauritius, to be followed by Egypt. Mauritius, you have the floor.
Yay! 3 seconds, maybe. 3.
Mauritius, you have the floor after the clapping by Nauru.
Director General, distinguished delegates, Madam President, allow me to congratulate you on your election as chairperson of the 73rd World Health Assembly. It gives me great pleasure to address you all. Mauritius aligns itself with the statement of the African group. Our first cases of COVID-19 in Mauritius date back to the 18th of March. Immediately, entry restrictions in the country were consolidated. Normal passenger flights were suspended. Our Prime Minister chairs the high-level committee on COVID-19, initiated a nationwide sanitary curfew as from the 20th March. These bold measures have proved to be capital in the ability to curb down the risk of a major outbreak. In all, we have registered 332 positive cases. We have sadly registered 10 deaths, and 322 have recovered. Sanitary curfew should remain in force till the 1st of June. However, essential activities have resumed. For the last 21 days, Mauritius has not registered any new COVID-19 positive case, but we continue to remain vigilant. Madam President, I thank the World Health Organization for its unflinching support. It should also be highlighted that developed and friendly countries help us by assisting our nation with donations and capacity building. The government of Mauritius has also worked relentlessly to get necessary medical equipment and medicine in a context where connectivity between nations remains challenging. I also pay tribute to the people of Mauritius and all our stakeholders who collaborated to stop the spread of the disease. Thank you very much.
Thank you, Minister. I now give the floor to Egypt, to be followed by Cabo Verde. Egypt, you have the floor.
يا رب وفقنا عن تقديم الجهود العلمية التي تقوم بها سكرتارية المنظمة العالمية بالتعاون مع الأعضاء في هذه الدورة اقتصاديا، وذلك لأول مرة في تاريخ جمعية الصحة العامة العالمية. كما نعرف عن دورنا العميق والبارز من منظمة الصحة العالمية ومديرها العام تدرس أدهنم في قيادة الاستجابة العالمية لجائحة كوفيد-19 وحشد الدعم لجميع الدول للتعامل مع الأزمة الحادة التي تؤثر على الصحة العامة والأوضاع الاقتصادية والاجتماعية. كما نؤكد عزمنا مواصلة التعاون مع المنظمة لتم كلها من القيام بدورها في هذا المجال على الوجه الأكمل. السيدة الرئيسة، لقد أكدت الأزمة الحالية الحاجة الماسة لتعديل الأولويات فيما يتعلق بالصحة العامة حول العالم، وأهمية الاستثمار في جوانب الوقاية والتأهب لمواجهة الأوبئة، فضلاً عن تعزيز الرعاية الصحية الأولية وتحقيق التغطية الصحية الشاملة، مع أهمية توجيه الجهود نحو دعم النظم الصحية في الدول منخفضة ومتوسطة الدخل، والتي تفتقد أغلبها للإمكانيات الأساسية اللازمة لاستجابة الأوبئة. ولا يفوتنا أن نشيد مجددا الجهود الضخمة التي تقوم بها المنظمة لتوفير الإمدادات والأدوات ووسائل الوقاية وأجهزة الكشف والتشخيص من خلال قيادات المبادرات الدولية في هذا الشأن، لا سيما محدودية هذه الأدوات لدى العديد من الدول النامية والأقل نمواً، والعجز العالمي الحالي في سلاسل الإمداد والتمويل، علاوة على التأثير السلبي للإغلاق العام وبطء النقل الدولية. السيدة الرئيسة، لقد قامت مصر منذ ظهور أول حالة إصابة في البلاد بواسطة أحد المسافرين باتباع عملية مجتمعة للرصد المبكر والتقصي والتتبع والعزل والحفظ الصحي في كافة محافظات الجمهورية ونقاط الدخول المختلفة للسيطرة على انتشار الفيروس، وذلك في إطار خطة تأهب متعددة القطاعات ضمن جميع الوزارات المعنية تحت إشراف مباشر من السيد الرئيس عبد الفتاح السيسي، جنبا إلى جنب مع وضع حزمة من التدابير والإجراءات الخاصة بتخفيف آثار انتشار الفيروس على الأوضاع الاقتصادية والاجتماعية، من دعم الفئات التي تضررت من جراء ذلك ماليا، خاصة التي تعتمد على كسب أرزاقها بشكل يومي. لم تقتصر جهود الحكومة المصرية على مكافحة الفيروس على المستوى الوطني، ولكن كذلك كانت على مستوى القارة الأفريقية في إطار ثوابت السياسة الخارجية المصرية تجاه القارة وشعوبها. في النهاية، تتطلع مصر لاستمرار التضامن والتعاون الدولي للقضاء على الفيروس في إطار النظام الدولي متعدد الأطراف تحت قيادة منظمة الصحة العالمية، ونشدد على ضرورة المنظمة والمجتمع الدولي جهود إنتاج وتوفير تكنولوجيا الصحة العامة والأدوية واللقاحات وتوزيعها بشكل عاجل وعادل ومنصف على جميع الشعوب، وإزالة أي عوائق التحويل دون تحقيق ذلك. شكرا لسيادتك.
Thank you, Minister. I now give the floor to Cabo Verde, to be followed by Belize. Cabo Verde, you have the floor. Cabo Verde, you are connected and you can now make your statements. Please unmute all microphones and go ahead. Thank you.
Madame la Présidente, Monsieur le Directeur général, au nom du gouvernement de Cap-Vert, nous adressons à la présidence de la 63e Assemblée mondiale de la santé votre succès dans la conduite des travaux et d'excellents résultats. Au directeur général de l'OMS, notre reconnaissance pour son orientation sage et décisive à une époque de grands défis mondiaux. Cette Assemblée mondiale a marqué, même dans son point, par les profonds.
Excellency, apologies. We have some interpretation issues. Can I ask you to start again slowly so that the sound quality can come through a little bit better for us? Apologies. Please start again. Thank you.
OK. Monsieur le Président, Monsieur le Directeur général, au nom du gouvernement du Cap-Vert, nous adressons à la présidence de la troisième Assemblée mondiale de santé veut de succès dans la conduite des travaux et d'excellents résultats. Au directeur général de l'OMS, Dr Tedros, notre reconnaissance pour son orientation sage et décisive à une époque de grands défis mondiaux. Cette Assemblée mondiale sera marquée, même dans son format, par les profonds impacts de la pandémie SARS-CoV-2. Monsieur le Président, sans vaccin contre COVID-19 et sans traitement spécifique, il n'est pas possible de prédire le fin de cette pandémie ou de calculer sa véritable dimension. Malgré le nombre effrayant d'infections et de décès déjà causés, nous ne pouvons malheureusement reconnaître le début d'une réalité potentiellement catastrophique, surtout si nous ajoutons les effets négatifs que la pandémie aura sur le contrôle d'autres maladies prioritaires, telles que les maladies chroniques non transmissibles, les maladies oncologiques, la transmission de vecteurs, tels que les produits, la dengue et la fièvre jaune, ou même ceux évitables pour la vaccination. Madame la Présidente, les Cap-Verts est un groupe de petits États insulaires avec une population d'un peu plus d'un demi-million d'habitants. Il fait face à 3 années consécutives de sécheresse, ce qui pose des défis supplémentaires sur la sécurité alimentaire et l'approvisionnement en eau des populations. Sans ressources naturelles, le Cap-Vert a dans les secteurs touristiques les principaux moteurs de développement économique. Jusqu'à la pandémie, le pays recevait 1 million de touristes par an. Depuis l'annonce de notre gouvernement, le gouvernement a commencé à prendre des mesures d'anticipation visant à empêcher l'entrée de virus, mais aussi à la contenir et à l'atténuer. Le premier cas d'infection a été diagnostiqué à 19 mars 2020. Depuis lors, seulement 3 sur les 10 îles de l'archipel ont enregistré des cas, soit un total de 300 cas confirmés et 95 récupérés et 3 décès. L'infection reste active dans une phase de propagation uniquement à Santiago et notamment à Aya, la capitale du pays. Monsieur le Président, la paralysie du secteur touristique, le manque de diversification économique impacte directement les ressources indispensables à la gestion du pays. Comme conséquence de COVID-19, le déficit budgétaire passera de 3% à plus de 10% du PIB en 2020. Mon pays, comme le reste du PIB, est préoccupé par l'accès de plus en plus limité aux marchés internationaux et la diminution du système financier mondial, ainsi que par le niveau élevé de la dette, dans un contexte de croissance et de pression sur les finances publiques. C'est dans ce contexte que le gouvernement met en œuvre un plan pour répondre aux besoins de santé, atténuer l'impact socio-économique à court terme.
Minister, Your Excellency, you have run short on time, unfortunately, and we have to move forward. So on behalf of Madam President, I will be moving forward with the next intervention by Belize, to be followed by Cameroon. Belize, you have the floor.
Belize conveys congratulations to the Bahamas in assuming the presidency of this assembly, as well as to the Director General, whose resolute leadership is steering us through unprecedented times. No country has been spared as the COVID-19 pandemic damages health systems, economies, and livelihoods around the world. Belize mounted an early all-of government and all-of society response, based much on public health advice from the WHO, but of regional organizations and of regional friends such as the Republic of Cuba. Belize has only had 18 cases, 2 unfortunate deaths, and 16 cases now have fully recovered. Today, Belize is one of the few countries in the world that is currently free of COVID-19. More than ever, we need an enhanced all-world response to maintain global supply chains for effective surveillance and for equitable, affordable access to medical supplies, including for a vaccine. In Belize, as everywhere, the pandemic also compels us to redouble our efforts to combat the global epidemic of NDCs and to maintain climate change goals high on our collective agenda. My delegation holds the position that Taiwan's exclusion from the World Health Organization represents a break in the global health system that can undermine the Taiwan has lessons to share from its COVID-19 success. Belize again calls for Taiwan's meaningful participation in the World Health Organization and for its observer status in World Health Assemblies. Finally, Belize joins in saluting our health workers around the world, and we reaffirm our strong support for the UN system and for the WHO in the continued coordination of a comprehensive multilateral response to the pandemic. Thank you.
Thank you, Minister. I now give the floor to Cameroon for a group statement on behalf of the African Group of Ambassadors, to be followed by Iraq. Cameroon, you have the floor.
Madame Présidente,
Cameroon, we seem to have lost you. Are you there? Please start again. Okay, we'll come back to Cameroon in a little while. I'll now move to Iraq, followed by St. Lucia. Iraq, you have the floor. Okay, so we'll come back to Iraq. There you go. Iraq, if you can hear me, please, you can start your statement. Thank you. No? Okay, so Iraq a bit later. I now give the floor to St. Lucia. St. Lucia, you have the floor.
Mary Isaac,
I now
Minister
give the floor
for Health
to
and
St.
Wellness,
Lucia.
St. Lucia.
St. Lucia,
The government
you have
and
the floor.
people of St. Lucia would like to thank all agencies who have assisted us in combating the novel coronavirus. When WHO advised all countries to ensure preparation for containment as a result of the dreaded coronavirus, the Department of Health and Wellness in St. Lucia prepared for the worst-case scenario and immediately sensitized key stakeholders and the public to ensure early detection and efficient management of COVID-19. To facilitate quarantine and isolation of persons identified through contact tracing and those returning from high-risk COVID-19 areas, 5 public health facilities were established in hotels. Mary Hospital
I now give the floor to St. Lucia. St. Lucia.
To date, 900 persons have undergone quarantine. All agencies. We have had 18 positive cases of COVID-19 in St. Lucia, 2 of whom were repatriated. When WHO advised all countries to have full preparation for containment As a result of the second time during this pandemic that the Department of Health and Wellness in St. Lucia prepared for the worst case COVID-19 and immediately sensitized the government and people of Taiwan were instrumental in donating thousands of medical masks to St. Lucia. In April 2020. To facilitate quarantine and isolation, we applaud the ability of Taiwan to contribute thousands more to the United States, from high-risk United Nations territories and member states. 5 public health facilities were established in hotels, Latin American countries,
St. Lucia.
It is important to note that as of April 29, we have had 18 positive cases of COVID-19 in St. Lucia, novel coronavirus, whom were repatriated. When WHO advised all countries.
St. Lucia, apologies. There seem to be some technical issues there. We will replay in a minute. We will now move to Iraq. Iraq, I hope you can hear us. You have the floor. Okay, we'll move on and go to, now we'll go to Guatemala to be followed by St. Vincent and Grenadines. Guatemala, you have the floor.
Señor director, ministro, señora presidenta, yo vengo a certificado del presidente de la República, el doctor Alejandro. Hace 2 meses, y con su conocimiento, articuló todas las capacidades, seguridad, dando con esto y mitigación para la población y resguardar. En esta lucha nos enfrentamos mundial de acción personal, el valioso la organización y a la organización continuar mediante. Así también incluir a todas las en la lucha contra el mal, así como destacando la valiosa política de China a desarrollar mundial, tanto en la como en situación. Pero veo mi país como la Asamblea, así como en la y actividades. Guatemala ha recibido ante esta generada. Consideramos aliados en materia de solidaridad. Quiero hacer a todos y a los organismos que nos han. Gracias, señor. Muchas gracias.
Thank you, Minister. I now give the floor to St. Vincent and Grenadines to be followed by Rwanda. St. Vincent and Grenadines, you have the floor. St. Vincent and Grenadines, you have the floor. You're connected. You can start your statement now. Thank you. Please proceed, Minister. You have the floor. Apologies, you're still muted. We cannot hear you. Okay, we'll have to come back to you. Let's move to Rwanda. Rwanda, you have the floor.
Madam Chair, Director of WHO, distinguished delegates, good evening. First of all, I would want to express my condolence to families who lost their loved one with COVID-19. The government of Rwanda is pleased to participate in this 73rd WHO Assembly. Indeed, it is an opportunity to deliberate on the issue distressing our health systems, especially at this critical time of COVID-19. This situation is a wake-up call to the world to realize that it is inevitable to invest in our health sector than never before. Rwanda considers the primary health care approach as one of the most vehicles for achieving universal coverage. Through this approach, Rwanda reinforced a people-centered, integrated, and sustainable health care in order to ensure quality, essential health care service as close as possible to the community. In order to meet this obligation, we must hold ourselves answerable to providing equitable, affordable care services for our people. We must promote and support values of efficiency, accountability in order to achieve sustainable and resilient health systems. In time like this, where the whole world is battling to overcome COVID-19, it is imperative to have a global solidarity and collaboration to strengthen partnership in sharing information and expertise that will aid government to make informed decisions to contain COVID-19. Rwanda will continue to build a resilient health system that is adaptive to changes, new demands, and new stressors such as COVID-19, Ebola, and other epidemic emergencies. It is therefore important to maximize community engagement, respond to health issues, adopt healthy behavior and lifestyle, and conduct regular wide consultation with all stakeholders. Allow me, Madam Chair, to conclude by commending the work, effort, and courage expressed by WHO leadership at all levels during this COVID-19 multi-sectoral crisis. We are more than grateful for all your help and sacrifice in fighting this unseen enemy, and we honor your dedication to save lives. Thank you so much.
Thank you, Minister. I now invite Burkina Faso to the floor, to be followed by Iraq. Burkina Faso, you have the floor.
Monsieur le Président, Mesdames et Messieurs, c'est un honneur pour moi de prendre la parole au nom du Burkina Faso devant cette auguste assemblée qui se réunit dans des circonstances particulières imposées par les contingences de la COVID-19. Je voudrais, au nom du gouvernement du Burkina Faso et à mon nom propre, féliciter le président de la 73e Assemblée mondiale de la santé pour sa brillante élection et remercier M. Tedros, directeur général de l'OMS, pour ses efforts inlassables d'amélioration de la santé des populations. Monsieur le Président, Mesdames et Messieurs, le Burkina Faso, à l'instar d'autres pays du monde, est confronté à la crise sanitaire provoquée par la COVID-19 dont le corollaire d'impact compromet gravement son développement. Cette crise, qui survient sur un tableau national déjà fragilisé par un contexte sécuritaire éprouvant, nous interpelle et pose la problématique de la résilience des systèmes de santé des pays comme le nôtre. En effet, tout comme dans de nombreux pays, la question de la préparation et de la riposte à la pandémie de la COVID-19, thème principal de cette session, se pose avec acuité au Burkina Faso. C'est pourquoi mon pays s'engage d'ores et déjà à tirer profit des propositions de résolution qui sortiront de cette Assemblée pour une meilleure riposte à la COVID-19 et au-delà pour un renforcement de la performance de son système de santé. Je voudrais terminer mon propos en appelant à la coopération et à la solidarité internationale pour mettre fin à cette pandémie dans de meilleurs délais. Je vous remercie.
Merci, Madame la Ministre. I now give the floor to Iraq, to be followed by Cameroon. Iraq, you have the floor. Okay, so Iraq will need to come back to you. I will now move forward and invite Cameroon to the floor for the regional statement. Cameroon, you have the floor. Minister, Cameroon, we cannot hear you. Please try again. I'm sorry, apologies, we still have no sound. We'll have to come back to you yet again. I will move forward and invite Nicaragua to the floor to be followed by Libya. Nicaragua, you have the floor. Nicaragua, you have the floor. Please proceed. Nicaragua, unfortunately we can't hear you. Could you kindly check sound on your end and then please proceed? Apologies, Nicaragua, we're having some issues, so we'll come back to Iraq, Cameroon, and Nicaragua later. We will now give the floor to the Czech Republic. Czech Republic, you have the floor.
President, Director General, distinguished delegates, ladies and gentlemen, the Czech Republic fully aligns itself with the statement of Croatia delivered on behalf of the European Union. More than ever, it is an honor to have this opportunity to address the World Health Assembly. This very difficult year is designed the International Year of the Nurse and the Midwife. This is the reason why I would like to start by expressing my personal and sincere gratitude for their tireless efforts and work during days and nights in taking care for COVID-19 patients around the world. After years of paying attention to NCDs, now we have been reminded that infectious disease outbreaks and epidemics represent a significant health threat. COVID-19 took the international community by surprise. To avoid the most of these surprises as possible for future, I stress the importance of independent and comprehensive evaluation of the WHO and international community reaction on COVID-19 pandemic outbreak. Since building resilience at all levels is a key factor in preventing disease, protecting and promoting health in everyday life of each community, the Czech Republic continues to support health systems and fight against diseases around the world as part of its bilateral development assistance and its multilateral cooperation. I would like to make an appeal to political representatives and the WHO not to turn away from the principles of solidarity. The international community should reiterate its commitment included in the SDGs to leave no one behind. Each and every country in the world has to be provided by the adequate support. We must continue to share our experience with everybody who is interested and to learn from all those who have expertise. I believe the WHO should serve as a platform for this exchange. Thank you very much for your attention.
Thank you, Minister. I now give the floor to Hungary, to be followed by Greece. Hungary, you have the floor.
Dear Director General, dear ministers, ladies and gentlemen, it is my great honor to share this meeting with you, and I fully appreciate that the WHO brought this together under the scope of COVID pandemic. We also appreciate the WHO effort to help us all to control the spread of this disease. And we also appreciate the WHO Solidarity Trial. Here in Hungary, we started our preparation at the end of January when the first case appeared in Europe. We took the threat of the disease very seriously and we acted upon it. We wanted to save lives, we wanted to prevent healthcare from overpressure, and also we wanted to flatten the curve to enable the country to return to normal everyday life as soon as possible. Now, at the beginning of May, we're happy to say that yes, it is indeed what happened. We saved lives. The healthcare is in operation. It had enough capacity, and the country is getting the doors open to new life. We do hope that during the summer we can prepare ourselves for the coming fall, and we rely on the solidarity, on the participation of the other countries as well. I hope that we can do it together, and here and now, thank you to all of you for making it a success of the human being. Thank you very much for your attention.
Thank you, Minister. I now give the floor to Greece, to be followed by Panama. Greece, you have the floor.
Dear President, dear Director General, Ministers, Excellencies, Greece fully supports the statement made by Croatia in the EU presidency on behalf of the EU and its member states. In the battle against the unprecedented pandemic of the coronavirus, we have joined forces with science, solidarity, philanthropy and patriotism being our weapons. In order to protect our fellow citizens, but above all the vulnerable groups, our success is primarily attributed to the excellent healthcare professionals of our national health system. To those everyday heroes, doctors, nurses, administrative and paramedical staff, and the personnel of the National Center of Emergency Assistance, the scientists and the staff of Hellenic National Public Health Organization, who successfully undertook the tracking of the first case. From the very beginning, we have been in continuous contact with the World Health Organization and the European Crisis Disease Center. We have designated 13 reference hospitals across the country. We have conducted more than 30 preparedness exercises under the coordination of the National Center of Emergency Assistance. We entrusted the experts and appointed a scientific committee of experts. The first case of coronavirus appeared in Greece on February 26th. On the same day, following an order from the Prime Minister, I announced the postponement of the carnival events, and on March 10th, the suspension of the operation of all educational facilities. On March 22, the Greece's Prime Minister Kyriakos Mitsotakis proceeded to a general lockdown. Our plan started from the intensive care units. We increased the intensive care beds from 565 before the crisis to 1,017. Hirings. We have strengthened the NHS with more than 4,000 healthcare professionals. PPEs. We have organized an unprecedented supply bridge amid global dispute regarding the medical material. Donations. We have received donations of 865 organizations amounting to 89 million euros. As the pandemic is not over, I strongly believe that we have to act all together with solidarity. Solidarity is not just a word. It is a value, it is a principle that must govern the world, especially in times of unprecedented crisis. Under this light, Greece fully supports the resolution proposed by the EU on the COVID-19 response, hoping in a prompt, positive perspective concerning medicines and vaccines. I urge to support the health in all policy strategy in order to ensure that no one is left behind. Thank you very much for your attention.
Thank you, Your Excellency. Ahora invitamos a Panamá. Distinguido ministro, tiene la palabra.
Ministerio de Salud de Panamá y de la señora ministra Rosario Turner, queremos darle un saludo a todos los que están participando en esta conferencia. Queremos iniciar nuestras palabras no solamente lamentando las pérdidas de vidas durante esta pandemia, sino también enviando un saludo y una felicitación a todos los miembros de los equipos de salud que a nivel mundial están dando su cuota extra en este momento. Panamá, desde el día 9 de marzo, reportó su primer caso de COVID-19. Desde entonces, venimos haciendo ingentes esfuerzos en el control y mitigación de esta pandemia. Pero empezamos mucho antes a través de las salas de situación y activando los equipos de epidemiología. En ese sentido, hemos establecido una serie de tareas que estamos cumpliendo con el mayor ahínco y con el mayor responsabilidad e integridad que el sistema de salud y la población panameña se merece. Le damos las gracias por esta oportunidad, saludamos a todos los países que en este momento están como nosotros trabajando arduamente por el control de esta pandemia. Somos conscientes de que la solidaridad y el apoyo mutuo son los pilares fundamentales para salir de esta epidemia. Nuevamente damos las gracias por la oportunidad en nombre del Gobierno Nacional, el Ministerio de Salud y un saludo muy especial de la señora ministra Rosario Turner. Muchas gracias.
Gracias por su intervención. Nos invitamos a Bolivia. Bolivia tiene la palabra.
A nombre de nuestra presidenta, señora Yanine Áñez Chávez, deseo hacer llegar un afectuoso saludo a todas las autoridades del Secretariado de la Organización Mundial de la Salud y a los 191 ministros que componen los cuerpos directivos. Desde el 7 de abril de 1948, la Organización Mundial de la Salud se constituye en el máximo organismo de salud pública internacional, trabajando para promover mejores estados de salud y niveles de vida en los pueblos del mundo. Al reunirnos en esta oportunidad, en esta 73ª Asamblea, nos damos cuenta del valor de la OMS para liderar los esfuerzos regionales y mundiales. Todos estamos enfrentando una de las pandemias más duras que vivió la humanidad, con millones de personas enfermas, miles de fallecidos y un sinnúmero de efectos en lo social y económico. Viviendo con el COVID-19 estamos mostrando el verdadero valor de la salud para desarrollar el bienestar de nuestros pueblos y nos está enseñando que los gobiernos y los organismos internacionales de salud debemos preocuparnos más y mejor por desarrollar sistemas y servicios accesibles a toda la población. Agradecemos a la Organización Mundial de la Salud por el trabajo mancomunado en sus oficinas regionales, buscando la solidaridad en torno a la salud de los pueblos y generando oportunidades de colaboración. Debemos rescatar la importancia de la atención primaria de salud como fuerza vital para las personas con la participación activa de las comunidades en responsabilidad compartida con sus autoridades. Valoramos la dedicación de los médicos y personal en salud que trabajan intensa y esforzadamente en la atención a todos los afectados por el coronavirus. Hacemos un homenaje póstumo a quienes sacrificaron su vida para salvarla de sus prójimos, así como de las personas que sufrieron la enfermedad y perdieron la vida. Anhelamos un mundo mejor y proponemos una acción de todos por la salud y la vida. Gracias.
Thank you, Minister. And we now invite Nicaragua to be followed by Libya. Your Excellency, you have the floor.
Thank you. Representatives, receive a warm greeting from the people and government of Nicaragua as we continue the society, peace, and reconciliation. Prioritize is always Nicaragua facing its sovereign right to make its own policy.
Your Excellency, I apologize. We have technical problems. We cannot hear you well. We propose to go further with Libya, and we will try to... Your Excellency? Your Excellency, I apologize. We have technical issues and we cannot hear you well. Let us continue with Libya and we will come back to you while our colleagues work on the issue. Libya, you have the floor.
Okay. Thank you, Chair, Excellencies, colleagues. Libya aligns itself with the statement given by Tunisia on behalf of the Emir States. Libya supports the WHO efforts and guidance. We stand in solidarity, starting by giving our gratitude and support to all healthcare workers across the globe. As an identified high-risk country, we appreciate the assistance and cooperation of the WHO and member states to help Libya face its challenges. Libya faces a serious public health threat in a most challenging way. For our health system is not resilient, and although we are working closely with WHO on all measures to implement the pillars of COVID-19 strategic preparedness and response plan to mitigate the potential consequences of this pandemic, with good coordination to expand testing and tracing, to identify cases and strong measures for repatriated citizens. However, we have concerns for our healthcare system is burdened and stretched by the ongoing armed conflict, which has diminished the resources, especially in the most vulnerable areas, and left hundreds of thousands of civilians displaced and in dire situation where they have to choose between leaving their homes to run away from war or staying at home to run away from COVID-19. Libya stands ready to strengthen its collaboration with WHO, its partners, and member states to speed the global recovery. In order for that to happen, for us to get back on track to the universal health coverage targets, we need to invest in strengthening health security and human rights in each and every country, as health is a core human right. Libya's health security will in turn impact directly the economic stability and prosperity of our neighboring countries in Africa and the region. The response to COVID-19 is an all or none that requires commitment, strong international cooperation, fairness, in order for us to save human lives and dignity. Thank you.
Thank you, Your Excellency. We will try Nicaragua again. Distinguished Minister, do you hear us? Let us also try Cameroon. Your Excellency, can you hear us? We will try connecting Sudan. Minister, you have the floor. We would like to invite the Dominican Republic. Your Excellency, you have the floor.
La pandemia del COVID-19 ha sido un gran reto para toda la humanidad, un reto importante para todo el sistema de salud, para las comunidades, las familias y los gobiernos. Los líderes mundiales han hecho y continúan haciendo todo lo mejor que le es posible a cada país para salir adelante en esta crisis mundial. La República Dominicana no ha sido una excepción y su economía y su vida social también se han visto afectados en esta dirección. Igualmente el sistema de salud. A la fecha, con cerca de 12.000 casos y 424 fallecimientos en edades básicamente de 65 años en promedio, hemos sido capaces de mantener una ocupación hospitalaria rondando el 40% como un buen balance entre el efecto de la demanda sanitaria y la capacidad del sistema para operar. Igualmente debemos decir que la República Dominicana necesita aumentar sus capacidades en materia de gestión, control y mitigación de desastres, así como el uso e incremento de la tecnología para trabajar estos grandes desafíos que se van presentando. La unidad es un factor clave para enfrentar esto. Todos juntos, comunidad, familia, gobiernos, políticos y religiosos, tienen la capacidad para dar respuesta a este fenómeno. La Organización Mundial de la Salud y la OPS han prestado servicios importantes a nuestros países que debemos agradecer.
Thank you, Your Excellency. We would like to invite Japan to be followed by Eswatini. Apologies. We will introduce Senegal first. Your Excellency, you have the floor. We would like to invite Eswatini to take the floor, to be followed by Mongolia. Your Excellency, you have the floor.
I have the honor to speak on behalf of the Kingdom of Eswatini on agenda item number 3. Recent years have seen a string of international outbreaks of emerging infectious diseases such as Ebola, Zika virus, and remember clearly the human toll of the 2003 severe acute respiratory syndrome SARS epidemic. Globalization has created a clear risk of the cross-border transmission of communicable diseases. With the rapid spread of coronavirus 2019 COVID-19 across the world, it is more imperative than ever to include all relevant parties and stakeholders in combating this pandemic. WHO's continued discriminatory treatment of Taiwan has seriously compromised the organization's overall disease prevention efforts and undermined the interests of its members and endangered global health. Without timely access to critical information about COVID-19, Taiwan risks becoming a gap in the global health system, which would undermine the very purpose of WHO's existence. It is worth noting that despite its proximity to the source of COVID-19, Taiwan has prevented a major outbreak. As of May 14, 2020, Taiwan had only 440 cases, with minimal community spread in a population of 23 million people. Taiwan has effectively contained the spread of COVID-19 through the timely establishment of a transparent, centralized command structure, emergency measures such as border control, case identification and containment, and the regulation of medical masks and other medical resources to ensure their fair and appropriate distribution. Acting on the conviction that Taiwan can help, Taiwan has donated millions of medical masks to the United States, EU member states, and other European nations, diplomatic allies, countries in Latin America and the Caribbean, parties under the Taiwan's new southbound policy, and other friendly nations to help provide local medical personnel with more resources to fight COVID-19 pandemic. This clearly demonstrates that Taiwan, as a professional, pragmatic, and constructive partner, could indeed contribute to WHO and global health. Allow me to emphasize that the epidemic prevention and containment transcends national borders. Countries cannot fight COVID-19 alone. As the international community endeavors to strengthen mechanisms to combat COVID-19, Taiwan stands willing and able to collaborate with other countries and is playing an indispensable role in overcoming the pandemic. Taiwan, being granted full involvement in WHO and observer status in WHA, would allow Taiwan to share its successful experience with the world more effectively, helping put an end to the pandemic as quickly as possible. Mr. President, The best thing we can do to prevent future outbreaks is to strengthen health systems everywhere. Leaving any one region or country out of the global health network creates a gap that undermines global public health safety. We should not allow politics to create a gap in the global prevention control network. Mr. President, in the light of these considerations, the Kingdom of Eswatini would like to reiterate our strong support for Taiwan's participation in WHO, including the observership in the World Health Assembly, based on the principles of professionalism, pragmatism, and leaving no one behind. I thank you.
Thank you, Minister. We will now invite Mongolia to be followed by Côte d'Ivoire. Mongolia, you have the floor, please.
Mr. President, Mr. Director General, distinguished delegates, I wish to start my short statement by thanking the WHO for guiding the member states in the fight against COVID-19 pandemic since early January. In particular, Mongolia thanks the WHO Regional Office for the Western Pacific, as well as the Country Office for the technical guidance and support in our efforts to effectively respond to the pandemic. Colleagues, Mongolia reported its first confirmed case of COVID-19 on March 10. Since then, we have had total 98 confirmed cases, all been imported. Thankfully, we have not experienced localized community transmission as of today. The government has been implementing international travel-related restrictions to control initial cases to prevent from the outbreak of localized clusters of infections through active surveillance, testing, contact tracing, and quarantine measures, supplemented by social distancing rules. The preventive and containment measures are still in effect, and this bought us more time to prepare for the outbreak of the disease. We have been working to prepare our hospitals for the surge of patients that would require intensive care beds in case of large-scale community transmission. Yet we still face shortages of supplies of biomedical and personal protective equipment, especially N95 respirators that are essential for frontline healthcare workers. Recently, the government of Mongolia has conducted a 3-day simulation exercise at the initiative of the Prime Minister of Mongolia to test our national capacity for health emergency preparedness and response. The simulation exercise helped us identify areas that need improvements and draw recommendations from the lessons learned. Mr. President, from the global developments, it's very clear that substantial domestic as well as international public resources should be mobilized for long-term investments in health system preparedness and strengthening as guided by for the future vision of the Western Pacific region. Distinguished delegates, the COVID-19 pandemic has stained all health systems in the world without distinctions. From the global developments, it's very clear that we would still be sitting on a hot stone until the world has a vaccine to prevent infections and drugs to effectively treat them. As a developing country, Mongolia would like to request the WHO and other health partners to reform their commitment to the research and development related with finding vaccines against COVID-19 and make them accessible for the low and middle-income countries to ensure that no one is left behind. Thank you for your attention.
Thank you, Minister, for your intervention. We'd like to invite now Côte d'Ivoire to be followed by Venezuela. Côte d'Ivoire, you have the floor.
Madame la Présidente, l'Assemblée mondiale de la santé se tient cette année sous un format particulier, en raison de la pandémie liée à la COVID-19 qui ébranle le monde entier et bouscule nos habitudes sociales. En Côte d'Ivoire, depuis la survenue du premier cas confirmé de la COVID-19, le 11 mars 2020, le gouvernement s'est fortement mobilisé par l'élaboration et la mise en place d'un plan de riposte sanitaire et d'un plan de soutien économique, social et humanitaire. Sous la haute égide du président de la République, son Excellence Alassane Ouattara, des mesures fortes et urgentes ont été prises en dégageant des moyens financiers importants pour impulser la riposte, avec un dispositif sanitaire approprié pour apporter l'assistance humanitaire aux populations les plus vulnérables et pour soutenir l'activité économique. À ce jour, mon pays compte 2109 cas confirmés, dont 1004 guéris et 27 décès, soit un taux de guérison supérieur à 47% et un taux de létalité de 1,2%. Depuis le 21 avril 2020, il n'est enregistré aucun cas positif en dehors du Grand Abidjan, épicentre de la maladie, qui concentre 98% des cas confirmés recensés dans le pays et fait d'ailleurs l'objet de mesures d'isolement pour empêcher la propagation de la maladie. Madame la Présidente, la solidarité et l'unité seront les clés pour une riposte mondiale efficace contre cette pandémie. C'est pourquoi la Côte d'Ivoire appelle les États membres de l'OMS à veiller à la disponibilité et à l'accessibilité pour tous les pays des médicaments, des réactifs et des équipements médicaux nécessaires pour combattre cette maladie. De même, en raison du caractère multisectoriel des conséquences néfastes de cette pandémie, des lignes directrices doivent être prises au plan international pour permettre aux pays en développement, dont ceux de la région africaine, de dégager des marges budgétaires pour la riposte. Madame la Présidente, pour conclure, tout en m'inclinant devant la mémoire de toutes les personnes décédées en raison de cette maladie et en souhaitant un prompt rétablissement aux malades, je voudrais adresser mes encouragements à tous les personnels soignants à travers le monde et exprimer au nom de mon pays ma foi qu'unis et solidaires, nous vaincrons cette pandémie. Je remercie tous les partenaires, notamment ceux du système des Nations Unies, et je vous remercie, Madame la Présidente.
Merci, Monsieur le Ministre. We invite now Venezuela to be followed by Guatemala. Venezuela, you have the floor. We will come back, and now we want to move on to Japan. Your Excellency, you have the floor. Thank you, Japan. Your Excellency, you have the floor.
Yes, this is May I speak?
Yes, please, Your Excellency, we hear you.
Dear Mr. Chairperson, today I would like to make 3 points. frustrated. Japan has been promoted from early on epidemiological investigation and social distancing policies to reduce the spread of the virus. Meanwhile, observing the increase in the number of cases, Japan has declared a state of emergency on every province to implement some measures, including asking people to refrain from going out, except where absolutely necessary. The number of the newly infected patients per day has decreased. Thanks to people's cooperation with such measures that the social distancing policy has started to be gradually relaxed from May 14th. From now on, it's critically important to step implement the executive strategy to enhance the testing scheme and the healthcare delivery system, as well as supply therapeutic drugs and vaccines. Second, I'd like to comment on Japanese contribution to the global strategy against the COVID-19. $76 million to WHO's SPRP, $96 million to CEPI, and $100 million to Gavi. I sincerely hope that one will be used effectively to bring an end to the pandemic and improve the people's lives in affected countries as soon as possible. Sadly, I would like to express my request for WHO the impact that this pandemic has had is immense. I would like to address the need for impartial, independent, and comprehensive evaluation to review WHO's response, as well as to identify the source of the virus and the root of the transmission to prevent the next pandemic. Moreover, it's critical to correctly mobilize all the information and knowledge available in the world to tackle the COVID-19 and to save as many lives as possible. It also has been pointed out that escalation should be given to regions which successfully embraced COVID-19 in terms of public health response, such as Taiwan. As being in a position responsible for public health measures, I would like to state we should not leave on geographical vacuums in addressing the global health issues, such as infectious disease control, which will serve the purpose to prevent the spread of infection in each country and worldwide. I want to end my remarks by reiterating that the government of Japan will continue to make every effort to put an end to this situation in collaboration with each member state and related region and organization. Thank you, Chair.
Thank you, Your Excellency. We would now like to invite Venezuela to be followed by Guatemala. Venezuela, you have the floor.
Gracias, señora presidenta. Saludos a todas las delegaciones que nos escuchan. Hasta ayer, Venezuela tenía 541 casos confirmados de COVID-19, 290 casos activos. Hemos logrado hasta ahora mantener una curva epidémica aplanada, una morbilidad de 17 y una mortalidad de 0,3 casos por millón de habitantes, con una tasa de recuperación de más del 45%. El 98% de los casos han sido asintomáticos o con cuadros clínicos leves. En la última semana hemos observado un aumento de casos procedentes de Colombia, Perú, Ecuador, Chile y miles de venezolanos que están retornando al país al no encontrar protección social ni de salud. Cerca del 80% de los nuevos casos vienen de sus países hermanos. En Venezuela se creó una comisión presidencial para la prevención y atención de la COVID-19, dirigida por el propio presidente de la República, Nicolás Maduro. El plan se desarrolló en dos fases. La primera, antes de la aparición de casos, en la que se lanzó la campaña masiva de prevención, se elaboró el programa de decisiones, se fortaleció la vigilancia epidemiológica, se identificaron y prepararon establecimientos de salud, se elaboró protocolo de tratamiento y se capacitó al personal. Todos sabían lo que tenían que hacer. Y una segunda fase, cuando aparecieron los dos primeros casos, en la que se declaró la emergencia sanitaria y se tomaron medidas drásticas y rápidas. cuarentena social, uso de mascarilla, distanciamiento social, prohibición de concentraciones, suspensión de actividades, despistaje masivo y personalizado a través de encuesta masiva de morbilidad, búsqueda a casos casa por casa y el acceso gratuito a pruebas diagnósticas y tratamiento. Igualmente, se aumentó la capacidad de hospitalización y terapia intensiva en acuerdo con el sector privado. Todas estas acciones las hemos realizado dentro de grandes dificultades económicas. Es necesario reiterar nuestra denuncia sobre el crimen que se comete contra el pueblo venezolano a través de las medidas coercitivas unilaterales, con las que se ha secuestrado a nuestro pueblo más de 30.000 millones de dólares. A Venezuela ha congelado todas las cuentas bancarias en Estados Unidos y Europa, generando dificultades en el acceso a alimentos y medicamentos. Agradecemos la cooperación humanitaria y solidaria de la OMS y el Sistema de Naciones Unidas, China, Rusia, Cuba, Irán y otras organizaciones internacionales. Para finalizar, queremos felicitar al doctor Tedros Adhanom por la extraordinaria conducción de la organización durante la pandemia, así como al presidente Xi Jinping por el manejo efectivo de la epidemia en su país. Venezuela apoya el principio de una sola China. Muchas gracias, señora presidenta.
Thank you, Your Excellency. We would like to now invite Guatemala to be followed by Mali. Guatemala, you have the floor.
Señor general, presidenta, ministros, delegados, la respuesta a la COVID-19 en Guatemala ha sido un esfuerzo unificado por el señor presidente constitucional de la República de Guatemala, el doctor Alejandro Ghebreyesus, quien a 2 meses de haber tomado posesión y con su conocimiento de médico, articuló todos los recursos y capacidades para brindar la respuesta adecuada en salud, seguridad, alimentación, recursos financieros y mecanismos de coordinación, dando con esto un respaldo total a las acciones de contención, prevención y mitigación para proteger a la población y resguardar el desarrollo del país. En esta lucha estamos conscientes de la profunda necesidad de proteger nuestro recurso humano en salud. Nos enfrentamos a la escasez mundial de equipo y suministro de protección personal, por lo cual solicito el valioso e incondicional apoyo a la Organización Mundial de la Salud y a la Organización Panamericana de la Salud para continuar mediando en esta situación. Consideramos también muy importante incluir a todas las partes interesadas en la lucha contra la pandemia, así como en la prevención de enfermedades, destacando para ello la valiosa y eficaz labor que la República de China, Taiwán, ha desarrollado a nivel mundial, tanto en la coyuntura actual como en situaciones anteriores. Por ello, mi país ha solicitado su participación como observador de la Asamblea Mundial de la Salud, así como en las reuniones, mecanismos y actividades de esta organización. Guatemala también agradece la cooperación que ha recibido por parte del gobierno de Taiwán ante la crisis humanitaria generada por el COVID-19. Consideramos a Taiwán como un aliado estratégico en materia de salud y nos solidarizamos con ellos. Asimismo, quiero hacer extensivo el agradecimiento del gobierno y el pueblo de Guatemala a todos nuestros países amigos y a los organismos internacionales que nos han apoyado en la lucha frente al COVID-19. Gracias, señora presidenta. Gracias, señor director. Muchas gracias a todos.
Thank you very much, Your Excellency. We would now like to invite Mali to be followed by Dominica. Mali, you have the floor.
Permettez-moi, avant tout propos, au nom de son Excellence M. Ibrahim Boubacar Keïta, président de la République du Mali, d'adresser mes sincères remerciements à l'Organisation mondiale de la santé pour son leadership à travers son directeur général, Dr Tedros. En dépit d'un contexte sécuritaire particulier, dès l'avènement de la pandémie du COVID-19, le Mali a mis l'accent sur la prévention par l'adoption de mesures barrières sous le leadership du président de la République qui a déjà présidé 2 conseils supérieurs de la défense avec le Covid comme thème central. Le Mali a ainsi élevé la pandémie à un niveau de risque de sécurité majeur pour notre pays. À ce jour, le Mali a enregistré un total de 874 cas confirmés, 52 décès et 512 guéris. Pour les besoins de quarantaine, les hôtels de la place ont été réquisitionnés. Près d'1 millier de nos compatriotes a été rapatriés, testés et placés en quatorzaine dans ces hôtels à travers un corridor humanitaire organisé par le gouvernement du Mali. Le gouvernement du Mali a initié un programme de riposte nationale avec l'appui de l'OMS et de la communauté internationale qui a évalué à environ 52 millions d'euros les besoins de la lutte contre cette pandémie. Nous travaillons en étroite collaboration aussi avec le CDC Afrique pour renforcer la recherche et le suivi des personnes contacts. Madame la Présidente, le programme présidentiel « Un Malien, un masque » a entrepris la distribution gratuite de masques à toutes les populations du Mali. Nous saluons la solidarité et la résilience quotidienne de nos populations dans la lutte contre le coronavirus et nous nous engageons plus que jamais à les appuyer. C'est dans ce cadre que le président de la République a annoncé une ligne de crédit de 750 millions d'euros pour faire face aux conséquences socio-économiques de la pandémie. Madame la Présidente, le Mali, comme l'ensemble des pays africains, a besoin de tests, d'équipements de protection individuelle, de respirateurs. La lutte contre COVID-19 nécessitera les efforts collectifs du monde entier. Cependant, la COVID ne doit pas nous faire oublier notre combat contre le sida, la tuberculose, le paludisme, le diabète et le maintien de nos programmes de vaccination. Enfin, nous appelons l'ensemble des pays membres de l'OMS à se mobiliser pour que Gavi puisse reconstituer complètement ses ressources le 4 juin prochain. Merci pour votre aimable attention.
Merci, Monsieur le Ministre. We are now inviting Dominica to be followed by Nicaragua. Dominica, you have the floor.
Can you hear me?
Yes, please go ahead.
Okay. Madam President, the Commonwealth of Dominica joined other delegations in congratulating you on your election to the chair of the proceeding of the 73rd World Health Assembly. We are confident that you will preside over this assembly with the efficiency and dedication required to make us through this period of global health uncertainty. We thank the Director General for his leadership and his commitment to promoting cooperation among all nations in the face of this global pandemic. Excellencies, ladies and gentlemen, the world, as we know, it is facing an unprecedented crisis. COVID-19 has underscored the importance of a united approach by all peoples in the interest of all humanity. Prior to our first case of COVID-19, the government of Dominica, through its Ministry of Health and Wellness, implemented preparedness measures to educate our population of the novel coronavirus. Dominica recorded its first case on March 22nd, 2020. At its peak, Dominica recorded 16 cases of COVID-19, all of whom have since recovered. Our main focus was the prevention and containment of transmission, which was done by aggressive case identification exercises, testing and isolation, together with public health and social measures, all done to avoid an extensive mitigation stage. We continue to recognize the major role played by our healthcare providers and support staff. For this, we pay special tribute to them all. The Commonwealth of Dominica takes this opportunity to express its sincere gratitude to the government and people of the People's Republic of China for its significant contribution of medical supplies and equipment. China remains a true friend to small island developing states in our fight against this pandemic. The Commonwealth of Dominica joins the World Health Organization in recognizing that there is but one China, and the Commonwealth of Dominica is therefore supporting the peaceful reunification of all of China. I would also like to thank Bolivarian Republic of Venezuela and the Republic of Cuba for their much needed assistance and technical support at a time when all countries are battling the same epidemic and face similar challenges. As we continue to share the experience of COVID-19, the world should emerge better prepared for future infectious diseases. This will strengthen not only our national health system, but the World Health Organization as well. It is of paramount importance that we focus on the equitable aspects of healthcare internationally and the achievement of universal health coverage. The importance of striking a balance between maintenance of livelihoods and economic activity while preserving our health status and gains made so far is a delicate one. More so as local economies and borders are reopened in a phased manner. All of this being done based on the scientific evidence available. Let me take this opportunity on behalf of the people of the Commonwealth of Dominica to say special thanks and again commend the World Health Organization for the continued strategic technical support in containing this pandemic. The government of Dominica applauds the positive efforts of the Director General of the World Health Organization and his staff in providing the leadership, guidance, and coordination in the fight against COVID-19. The Commonwealth of Dominica takes this opportunity to record its deepest condolence to all citizens, families, and friends worldwide who have lost loved ones due to the COVID-19 pandemic, and urge all nations to remain united towards the fight against COVID-19. I thank you.
Thank you, Minister. We would now like to invite Nicaragua to be followed by Tonga. Nicaragua, you have the floor.
Hello.
Yes, we can hear you. Please continue.
Very much. Madam President, receive a warm greeting from the people and government of Nicaragua as we continue to build a society and youth reconciliation and always help. Exercising a sound in accordance with this reality, formulating a strategy to confront COVID-19, strongly preventive, like all of the rapid family and community health models. The first case of COVID-19 arrived in Nicaragua on 18 March. 2 months before, on 21 January, the Ministry of Health held a press conference informing the population of the impending threat in its preventive measures. With the full declaration of public health emergency on 30 January, the government formed an interinstitutional commission to ensure a comprehensive approach. The 9th of February, means supported by the S issued a full protocol to ensure surveillance, detection of suspected and confirmed cases, guaranteed prognosis, medical care, reduction of complications and mortality. The protocol also designated units in 19 hospitals to be specialized, ordered increased respiratory symptom preparation serious contact tracing was not taking place. Arrival was planned for the first case in the 18th of March, with extensive preparation over a period of 2 months. Over 40,000 international travelers were pushed to 21-day period. Over 350,000 in-UK travel, house-to-house visits were completed by 98,000 health volunteers.
Honorable Minister, I do apologize. We cannot hear you well at all any longer. I would like to invite.
We also have continued expanded programs to achieve sustainable development goals, especially for the recreation of poverty.
Thank you very much, Minister. We would now like to invite Tonga to be followed by Kenya. Tonga, you have the floor.
Honorable President and distinguished delegation, first, the Kingdom of Tonga wishes to thank WHO for all support and strong leadership by Director General Dr. Tedros and WHO Wipro Regional Director Dr. Takashi Kasai. We appreciate the on-site financial and technical support by WHO Country Office, partner coordination and Pacific tailored support provided through Joint Incident Management Team for the Pacific countries in Fiji Sub-Office, Regional Office. Weekly information sessions with ALDI Wipro, guidelines developed and information shared by WHO headquarters, which was adapted to the Tongan context, and also procurement of items, especially for testing kits and PPE. So far, Tonga remains COVID-free, and we are working on a policy document for opening of the border with strict facility-based quarantine, strengthening contact tracing and case management, and engaging the community. Tonga is taking this adversity as a moment to strengthen health system and already established and strengthen one community health center to be a COVID treatment center and strengthen lab capacity to be able to conduct PCR testing. Community support has been tremendous, and community are engaged and are more aware of infection prevention control, including the importance of hand washing. I would like to remind everyone that this is the year of the nurse and the midwife, and my thoughts are with them and frontliners staff supporting those who are in need and saving lives. I am sure together in solidarity we can all get out of this stronger. Finally, I wish to thank WHO and partners for continual support for COVID-19 response and beyond, tailored to the Pacific and small island countries like the Kingdom of Tonga. Thank you, Malo Aupito.
Thank you, Honorable Minister. We are now inviting Kenya to be followed by Sudan. Kenya, you have the floor. We will move directly to Sudan. Sudan, you have the floor to be followed by the Central African Republic. It seems that we will go directly to the Central African Republic to be followed by Mauritania. You have the floor. We will move to Mauritania, to be followed by Jamaica. Mauritania, if you hear us, please go ahead, you have the floor.
Bonjour.
Bonjour, Votre Excellence. Nous vous écoutons.
وصلى الله على رسوله الكريم. سيدتي الرئيسة، السادة والسيدات الوزراء الصحة، أيها الحضور الكرام، السيد المدير العام لمنظمة الصحة العالمية، أيها الحضور الكرام، السلام عليكم ورحمة الله وبركاته. سيدتي الرئيسة، أود أن أهنئكم على اتخاذكم لإدارة أعمالكم الحالية تلك الدورة التي تعرض هذه السنة في ظروف استثنائية يواجه فيها العالم بأسره تحديات غير مسبوقة على كل المستويات الصحية والاقتصادية والاجتماعية، انعكست سلبا على جميع ميادين الحياة خاصة البرامج الدولية للصحة. إنه وضع مهم يتطلب الإقامة الجادة والتضامن بين الجميع من أجل كسب معركة مواجهة جائحة فيروس كورونا المستجد. ولا يفوتني هنا إلا أن أترحم على أرواح آلاف الضحايا الذين مضوا إثر هذه الفاجعة، كما أتقدم عبارات العزاء والمواساة لآلاف الأسر المرجوعة. كما أغتنم فرصة اجتماعنا هذا من هذا المنبر العريق المشيد بالدور الطلائعي المتميز الذي قدمته القوائم الصحية في كل بقاع العالم سبيلا إلى تقليل معاناة المصابين والتقليل من الوفيات المحجوزين والتخفيف من آلام المكتوبين قبل وبعد ظهور هذا الوباء. وقد لا يعرف في هذه الكارثة الوبائية الجديدة من المزايا لأنها بينت لنا أن قطاع الصحة وقطاع الاستراتيجي تعرف منظومات اختلالات كبيرة يجب التغلب عليها من أجل تطويره أمام المعضلات الكبرى في مجال الصحة العمومية. لقد قيمت خلال السنوات الماضية بمجهودات جبارة من أجل الوصول إلى التغطية الصحية الشاملة والدفع بمؤشرات الصحة إلى التحسن في بلوغ أهداف الاستدامة من 2030، غير أن كل ما تم إنجازه تراجعا بسبب تأثيرات جائحة كوفيد 19. وهنا أود أن أشكر المدير العام لمنظمة الصحة العالمية على الدور الهام الذي تقوم به منظمة الصحة العالمية في مواكبة منهج جاحدة. رئيس العالم، لقد تبنت ولاية الإسلامية الموريتانية الوهلة الأولى للبلاد الاستراتيجية والطريقة الاستشراقية ومتكاملة بالدقة والكفاءة مما جعلنا نعد الانتشار المذهل والحد من المخاطر الناجمة بين صفوف المواطنين. عدد الإصابات في الساعة 81 مع 4 وفيات. هكذا تمكنت بلادنا الجهات الإسلامية من فخامة رئيس الجمهورية سيد محمد بن الشيخ الغزواني أن تكون في طليعة الدول التي أخذ جولة من التدابير الاحترازية والصارمة على أصول الحصر إنشاء صندوق الحرب التضامن الاجتماعي فيروس كورونا المستجد. خصصت له الدولة عامة وشاركت في ولايات الشعب السخائي قرية واسعة وتصرف هذه باقتناء حاكمات البلد من الأدوية والمعدات والتجهيزات الطبية بمواجهة وباء كما يستفيد منها عشرات من الأسر المحتاجة لتوفير مواد.
Honorable Minister, could you please conclude?
إلى تحمل الدولة كما وضع الوطني للرد السريع تضمنت محاوره الجوانب المتعلقة بمكافحة الفيروس.
Honorable Minister, we apologize, but you have exceeded your time limit. We would like to ask you to conclude.
يقبل إلا بتكاتف.
Thank you very much. We appreciate your understanding. We would like to invite Central African Republic to be followed by Cameroon. Central African Republic, you have the floor. We will try once again Cameroon. Please, if you can hear us, you have the floor.
Madam President, the Republic of Cameroon has the honor to speak on behalf of the African Group in Geneva at this historic virtual session of the 73rd World Health Assembly. The African Group acknowledges the efforts of the European Union and its members in proposing this resolution and hereby confirms our wish to join as co-sponsors. The African Group believes that the resolution is timely and addresses pertinent issues which member states are currently dealing with as they respond to the pandemic. Over and above that, the resolution symbolizes the outcome of multilateralism and unity of purpose to defeat this common enemy. Madam President, while the COVID-19 pandemic is primarily a health crisis, it has also had far-reaching implications on all sectors and spheres. The African Group acknowledges that if drastic preventive and control measures are not taken urgently, the economic, social, and even security consequences of the epidemic could be felt on a very large scale. Africa is particularly at risk, given its relatively fragile health system, concomitant epidemics, limited resources, and high population mobility, among other vulnerabilities. Given these challenges, many of our countries follow the global trends and impose lockdowns to varying degrees. Approximately 70% of our population rely on subsistence livelihoods, and this therefore calls for adaptation of the lockdowns to local realities, challenges, resources, and strengths. To caution the most vulnerable from the effects of these lockdowns, our respective governments have provided targeted assistance, including through direct cash transfers and delivery of care packages and food parcels, for example. In order to coordinate our continental response, the African Union adopted the Africa Joint Continental Strategy for COVID-19 with the overall aim of limiting transmission of the virus and minimizing harm through the use of an all-of-government approach. These efforts are being led by the Africa CDC, working in close collaboration with African Union member states, the WHO regional offices, and other stakeholders. Madam President, the COVID-19 pandemic has shown that the world is safer and more secure from global health threats caused by infectious diseases when all countries are able to prevent or mitigate the impact of outbreaks, rapidly detect outbreaks when they occur, and respond effectively to limit their spread. At the moment, there is no vaccine or proven treatment available for COVID-19. As such, public health interventions will continue to be an important tool to reduce transmission and prevent further spread of COVID-19. Similarly, transparency and access to information are regularly done by the WHO with member states, including through regular briefings, remains key to the effectiveness of the global strategy against the pandemic. With regards to research and development, the African Group welcomes the various initiatives aimed at ensuring equitable access to new COVID-19 diagnostics, treatments, and vaccines. We join calls in support of developing mechanisms to ensure that when a safe and effective vaccine is developed, it is produced rapidly at scale and made available for all people in all countries at the cost that everyone can afford. History has taught us, as witnessed with disease such as HIV and Ebola, for example, that we cannot afford to leave anyone behind as a result of unequal access to treatment. In this regard, we urge member states and the private sector to work together to facilitate the transfer of technology and know-how for medicines, vaccines, diagnostics, and other commodities that will allow us to meet global demand. No one country can do this alone. Where possible, member states should fully utilize the flexibility contained in the TRIPS agreement and the Doha Declaration to safeguard public health. Madam President, several African countries stepped into the COVID-19 pandemic under the added burden, which offers them limited room for fiscal maneuver to overcome the economic impact of the pandemic. We therefore call for a global coordinated response to the debt burden by providing debt relief, including debt cancellation coupled with emergency
Ambassador,
grants.
please conclude.
In conclusion, Madam Chair, the African Group in Geneva wishes to reaffirm our confidence in the WHO under the leadership of its Director General, Dr. Tedros Adhanom Ghebreyesus, in the execution of its mandate as the United Nations lead technical agency for global health governance and public health emergency response. We also reaffirm our commitment.
Thank you, Ambassador, for your statement. We would now like to invite...
Thank you, Madam President.
Thank you, Ambassador. We would now like to invite St. Vincent. St. Vincent, you have the floor.
Can you hear me?
Yes, please. Please proceed.
Delegates of the World Health Assembly, greetings from St. Vincent and the Grenadines. The world is dealing with the most serious public health challenge in living memory. The COVID-19 pandemic has basically affected every corner of the globe with impacts on health and the economy. It is affecting lives and livelihoods. I never thought that I would see pictures of an empty JFK airport, the UK in lockdown, and health systems the world over under siege. But that became our reality in the 21st century. Right now, we are all basically marooned in our own countries. This pandemic has taught us that we don't have a developing world and a developed world or anything like that. We have one world, and we are all in it together. St. Vincent and the Grenadines has not had any cases of COVID-19 for over 14 days since May 3rd. We have had 17 confirmed cases overall, of which 14 are recovered and 3 are active. There have been no deaths and no health worker has been infected. In response to COVID-19, St. Vincent and the Grenadines implemented a raft of social and public health measures to minimize the spread of the disease. It is impossible to recite all these measures in a 2-minute statement. However, our strategy can be summed up in a few short lines. 1, finding cases and isolating them. 2, taking special precautions with high-risk groups, such as travelers and exposed persons, because they might be cases. 3, providing appropriate clinical care. 4, applying general and specific infection control and prevention measures as guided by the science. Fighting COVID-19 is like fighting a fire. We must go after it aggressively and snuff it out. We never had to resort to full-scale lockdown. We didn't impose curfews or close our borders and airports. Naturally, travel activity was curtailed by the suspension of commercial flights. We built our response on the foundation of public trust through advisories and appropriate actions. We have been managing risk with the aim of maximizing the health, freedom, rights, economic, social, and other benefits to the population. Our response was affected by the disruption of supply chains and trade restrictions. It took us 2.5 months to get a PCR machine, and even the International Atomic Energy Agency, for all its good intentions and explosive might, seemed powerless to help us on this matter. This raises many certain questions. Fortunately, we were able to do tests at the Caribbean Public Health Lab located in a nearby country using regional security aircraft for transportation of samples. We had to deal with complex matters such as the repatriation of Vincentian cruise ship employees who were abroad.
Honorable Minister, we would kindly ask you to conclude.
We thank God for everyone who came to our assistance, our development partners, the Caribbean Development Bank, the International Monetary Fund, the World Bank, and the United Arab Emirates stood by us. Cuba sent doctors and nurses for our isolation center. Venezuela provided supplies and rapid test kits, even though that country is still being subjected to sanctions and political adventurism at the time of COVID-19. Imagine that. Taiwan has emerged as a shining example to the world in terms of response to COVID-19 and has provided assistance to many countries, including St. Vincent and the Grenadines. But it is still locked out of the World Health Assembly. Imagine that. This matter must be addressed and resolved in a satisfactory
Honorable
manner.
Minister, we would kindly ask you to conclude.
Taiwan can help. The Director General of the World Health Organization is fond of saying that the antidote to COVID-19 is national unity, global solidarity, and the human spirit. I agree with him. We are in tempestuous seas, but we could summon to our assistance the following refrain from a popular song of faith in our country. With Christ in our vessel, we could smile at the storm. We will beat the coronavirus pandemic together. We are looking forward to the development of vaccines.
Thank you very much, Honorable Minister. We would now like to invite Jamaica to be followed by Tuvalu. Jamaica, you have the floor.
Good morning. On behalf under the guidance of the WHO, Jamaica's early response to the COVID-19 epidemic and our proactive approach to preventing, detecting, containing, and responding have resulted in significant slowing down of the disease in the country. We have, in fact, up to this point, flattened our curve. The strengthening of Jamaica's capacities under the International Health Regulations 2005 has been the background against which the country has responded. Our success so far has centered around an early education program, enhanced surveillance, early institutional restrictions, early response to perceived threats, and a rapid containment exercise. The resulting increased public awareness and early detection of cases and our primary healthcare establishment enabled us our ability to mobilize our response teams into communities for case investigation and contact tracing. Our experience in contact tracing, fast responses to public health emergencies such as measles and malaria have resulted in the continued elimination of diseases from our country. We can say that it is our early implementation of these measures from the detection of our first imported case that have had positive results. As a country, we have had to take drastic decisions to shut down sections of the island in order to conduct investigations and to contain this disease. The slowing down has also allowed time for the building of additional capacity in the health sector. COVID wards have been established and healthcare workers have been sensitized to the necessary infection prevention and control measures. We have increased the capacity for high dependency and mechanical ventilator support and care, as well as improved our inventory management of personal protective equipment. There has been significant strengthening of the lab and increase in the capacity to collect samples through the parishes. We want to thank the Pan American Health Organization and the WHO for the assistance that it has provided and continues to provide to Jamaica in this area. The acquisition of immunity, whether through vaccine or through exposure of the population, is a main consideration when contemplating the lifting of restrictions that will result in increased numbers of persons becoming infected with the virus. There are several uncertainties around the development of it. In conclusion, as we move forward, I would like to recognize and thank the hard-working healthcare workers of Jamaica, while recognizing that this year, 2020, is the year of the nurse and midwife. Indeed, frontline workers worldwide are contributing tremendously in managing this pandemic. We salute these persons, Madam President, who are our true heroes. Thank you very much.
Thank you very much, Honorable Minister. We would now like to invite Tuvalu to be followed by the Central African Republic. Tuvalu, you have the floor.
President Director General, Dr. Tedros Adhanom, Excellency, ladies and gentlemen, I'm pleased to give this statement on behalf of Tuvalu. As of today, Tuvalu remains COVID-19 free. Our thoughts today are with our nations that have and still continue to fight the spread of COVID-19, and our prayers with the families of those who have lost loved ones to this novel virus. On this International Day of Nurses and Midwives, we thank you to those at the front line of international effort to minimize its spread, especially health workers around the globe. Since the end of January, with our Prime Minister at the helm, Tuvalu has been preparing for the possibility of COVID-19 reaching our beautiful shores. We have been working hard to strengthen our system so that we are ready. This has included mobilizing multi-sectoral coordination through a national planning and response task force and 7 subcommittees, improve surveillance and risk assessment, prepare our laboratory to test for the virus, maintain essential clinical management and healthcare services for our people, strengthen our infection prevention and control mechanisms, institute non-pharmaceutical public health measures, and disseminate risk communication via email, radio, TV, social media, and national press conference to keep our community informed, work with partners to investigate safe modes of transportations for medical supplies and operational logistics. COVID-19 is a wake-up call to developed countries and developing countries of the need to investigate, including training human resources for public health, to support global research in findings and producing safe vaccine that will assist our recovery to becoming a COVID-free, 19-free world again. Thank you to the World Health Organization for your leadership and support. We know this has been an immense challenge. We especially thank to Dr. Kasai, Western Pacific Regional Director, for rallying your team behind us.
Thank you, Minister. I now give the floor to Central African Republic, to be followed by Iraq. Central African Republic, you have the floor. Okay, so we'll need to come back to Central African Republic. I now give the floor to Iraq, to be followed by Palestine. Iraq, you have the floor. Okay, so we will need to come back to Iraq. I now give the floor to Palestine. Palestine, you have the floor.
الأوضاع الصحية للسكان في دولة فلسطين. لا يزال النظام الصحي الفلسطيني يواجه تحديات جسيمة في ظل الاحتلال الإسرائيلي وممارساته وانعكاسات ذلك على صحة السكان الفلسطينيين. هناك أزمة مالية خانقة، حصار اقتصادي وسياسي، إغلاقات للمدن والقرى والمخيمات، هناك تقسيم للوطن الفلسطيني إلى مناطق مجزوءة، حواجز احتلالية، جدار فصل عنصري، استيطان متزايد في قلب الأراضي الفلسطينية، واعتداءات المستوطنين المتكرر على السكان الفلسطينيين الآمنين وممتلكاتهم. عدد سكان الفلسطينيين في كافة أنحاء العالم يقدر بحوالي 12,700,000 نسمة، منهم 4,800,000 نسمة يقطنون على أراضي دولة فلسطين، أي ما نسبته 38.4%. ويتكون النظام الصحي الفلسطيني من 5 قطاعات أساسية: وزارة الصحة الفلسطينية، وكالة الغوث وتشغيل اللاجئين، الخدمات العسكرية، القطاع الخاص والمنظمات الأهلية. أما بالنسبة إلى وباء كوفيد-19 في فلسطين فإن كافة الخدمات المتعلقة في الصحة العامة ومن ضمنها وباء كوفيد-19 يتم تقديمه بشكل مجاني لكافة المواطنين وعلى نفقة الدولة دون تحميلهم أي أعباء مادية استنادا إلى قانون الصحة العامة رقم 20 لعام 2004. وقد تم تسجيل 548 حالة مثبتة مخبريا في دولة فلسطين، أي في الضفة الغربية، قطاع غزة ومحافظة القدس. ومن هؤلاء 75% من الحالات كان مصدر عدوتها إما عمال الذين يعملون داخل الخط الأخضر أو مخالطين. وقد كان 77% من الحالات قد شفيت وأخرجت إلى الحجر المنزلي لتاريخه. وقد تم استحداث البروتوكول العلاجي الفلسطيني بالإضافة إلى العديد من التعاليم الفنية والخاصة بالتعامل مع هذا الوباء. أما بالنسبة إلى الخدمات الصحية فقد قمنا بالاستمرار بتقديم الخدمات الصحية الأساسية والطارئة خلال فترة وباء كوفيد، مثل المطاعيم، أقسام الولادة، الطوارئ والأمراض المزمنة. تجمعنا مع مكتب منظمة الصحة العالمية والشركاء الدوليين علاقات مميزة، وهناك تعاون وتنسيق كامل معهم إما جماعة أو ثنائيا. إن دولة فلسطين لا تزال ترزح تحت الاحتلال وممارساته، ومن هنا ندعو منظمة الصحة العالمية والدول الأعضاء إلى الاستمرار في دعم دولة فلسطين لتتمكن من الاستمرار في تقديم خدماتها إلى المواطنين الفلسطينيين والعمل على تطوير خدماتها.
Your Excellency, we would kindly ask you to conclude, please. Thank you very much. We would now like to invite Gavi, the Vaccine Alliance, to take the floor. Gavi, you have the floor, please.
Thank you, Chair. The COVID-19 pandemic threatens years of progress in primary health care. In Gavi countries, over 70% of the target vaccine introductions and campaigns for 2020 have been delayed, suspended, or are at risk. We are faced with an emergence of other vaccine-preventable disease outbreaks, such as measles, yellow fever, and polio. The pandemic will disproportionately impact women, vulnerable, marginalized communities, as well as zero-dose children, those who do not receive any routine vaccine. As an alliance built on the principle of equity, Gavi is taking urgent action to support countries to maintain and restore their immunization programs. We are also part of the WHO ACT Accelerator, co-leading the work to achieve global access to COVID-19 vaccines. Gavi has two specific asks for you. First, to support and call for a fully funded Gavi replenishment on June 4th. This will be critical to our work with countries to immunize children, implement the Immunization Agenda 2030, save lives, reduce poverty, and protect the world against the threats of epidemics. Second, to support global access to COVID-19 vaccines. COVID is a global problem, and we need a global solution. A vaccine is the best hope for the world to get back to some semblance of normalcy. We need to get the best science in the world for vaccines and make sure those vaccines are available to everyone, for no one is protected until everyone is. Finally, Gavi would like to express profound appreciation for the works of health workers, nurses, and midwives for their extraordinary dedication and service to humanity. Thank you.
Thank you for your intervention. I would like to give floor now to the International Federation of the Societies of the Red Cross and Red Crescent, to be followed by the International Atomic Energy Agency. IFRC, you have the floor.
I'm a nurse and a public health delegate with the Australian Red Cross, and I'm speaking today as a member of a global network of 14 million volunteers and 500,000 staff from across 192 national Red Cross, Red Crescent societies. COVID-19 poses the greatest threat to our collective health and well-being. The work that Red Cross, Red Crescent does every day to support programs in maternal and child health, vaccinations, HIV, malaria, the disabled, and accessing clean water and sanitation are threatened by this global pandemic. We know people living in poverty don't have a stockpile of food or money to help them through any form of lockdown. We know that it will highlight and exacerbate inequalities in all contexts. Those that were vulnerable, marginalised, excluded and stigmatised before this pandemic will disproportionately feel the force of its effects now and well into the future. Collectively, we must do all we can to protect those most vulnerable, and we must ensure that we deliver on our promise of health for all. We must also look to the indirect consequences of this outbreak on our already overwhelmed health systems. For many, it's their only point of contact with life-saving health and routine care services. People will still require their antiretroviral medications, food supplies must continue to flow, expectant mothers must have a safe place to give birth, malnourished children still need access to feeding centres and support, and communities will still need to access safe water and sanitation. We therefore call on states to do the following: continue to invest in essential humanitarian work and fragile health systems, a collective global commitment to designate and ensure access to everyone, irrespective of where they are in the world, in any future vaccines, testing and treatments for COVID-19, and ensure a duty of care for all those public health professionals, first responders, community health workers and volunteers responding to this outbreak. Thank you.
Thank you very much. I would now like to invite the International Atomic Energy Agency to be followed by ITU. IAEA, you have the floor.
Distinguished President, Director General, the IAEA is an important partner for countries battling the COVID-19 pandemic. We have focused on providing practical guidance and equipment for detecting the virus. We are supplying nuclear-derived diagnostic kits and accessories to 242 laboratories in some 120 countries. We produced webinars and videos for healthcare and laboratory professionals, including on sample collection and processing. We have received generous contributions from member states. The relevant cooperation project is now the biggest in the history of the IAEA. Our long-standing partnerships with WHO and FAO have proved immensely valuable. We are actively participating in the COVID-19 crisis management team. At the next IAEA Board of Governors meeting in June, I will set out my ideas on how the agency can best support member states in responding comprehensively to future pandemics. More generally, let me note that the IAEA is very active in the human health field, helping member states to address challenges such as cancer, cardiovascular diseases, and malnutrition. Our particular focus is on radiotherapy and nuclear medicine. We greatly value our cooperation with the WHO in all these areas. Thank you.
Thank you, Your Excellency. We would now like to invite ITU to be followed by UNOPS. ITU, you have the floor.
Congratulate WHO Health Assembly. As the UN specialized agency for ICT technologies and services, and a longtime partner of WHO, ITU is committed to continuing to leverage ICT technologies to help defeat COVID-19 and make the world safer, stronger, and more connected. Never before has digital health and ICT technologies such as artificial intelligence, cloud computing, Internet of Things, 5G, and others being so fundamental to economies and societies everywhere. Now, more than ever, universal health coverage will be possible only when everybody is connected. I'm confident we can use the momentum around COVID-19 to bring digital health solutions to billions and transform today's digital revolution into a development revolution for all.
Thank you, ITU. We would now like to invite UNOPS to be followed by UNCTAD. UNOPS, you have the floor.
Pandemic and measures to contain it are hitting the poorest and most vulnerable the hardest, risking the progress made on nutrition and achieving the Sustainable Development Goals. The pandemic is already increasing hunger and malnutrition because for many of the 61 member countries, a day without work means no income and no access to nutritious food. Many are pushed deeper into poverty and essential health and nutrition services are disrupted. Nutrition is key to build immunity, protect against illness and infection, support recovery and build resilience. Malnutrition is an underlying cause of almost half of child deaths and negatively impacts children's cognitive and physical development. I call on all stakeholders to ensure that malnutrition is adequately addressed in the COVID response and recovery through a multi-stakeholder approach.
Thank you very much, Your Excellency. We would now like to call UNCTAD to be followed by UNAIDS. UNCTAD, you have the floor.
No country has been spared by COVID-19. Beyond the tragic death toll, the pandemic has cut millions of jobs and livelihoods, especially in developing countries with fewer safety nets and resources. Global production and trade have plummeted in the wake of unprecedented confinement measures. We expect global trade to fall by a staggering 27% in the second quarter. This crisis has shown that we need better trade, not only as an engine of economic growth, but also to tackle shortages of medical supplies and food. Solidarity and cooperation are crucial to find solutions to this crisis and overcome the shockwaves on debt, food and migration, particularly in the developing world. Let us use this opportunity to craft development strategies for a better recovery, which is more fair, more resilient, and protects our environment.
Thank you, Your Excellency. We would now like to invite UNAIDS to be followed by UNFPA. UNAIDS, you have the floor.
President and ministers at the Assembly, Director General, my brother Tedros, distinguished delegates, I speak on behalf of the joint United Nations program on HIV/AIDS. As we have seen with HIV, and as we now see with COVID-19, epidemics affect everyone, but they do not affect everyone equally. To fight COVID, we have to fight inequalities because pandemics feed on and widen inequalities. That is why I'm backing calls by over 100 current and former world leaders and global experts to unite behind a people's vaccine. Together, we want all leaders to guarantee that when a safe and effective vaccine is developed, It is produced rapidly at scale and made available for all people in all countries free of charge. We unite behind a people's vaccine to protect all of humanity.
Thank you very much, Your Excellency. We will now go back to our member states, and we invite Central African Republic to take the floor, to be followed by Nicaragua. Central African Republic, you have the floor, please.
Ils attendent. Madame la Présidente, Messieurs les vice-présidents, Messieurs, Mesdames, ministres de la Santé et délégués, Monsieur le Directeur général, la République centrafricaine s'aligne sur la déclaration faite par le Congo au nom des États africains membres de l'OMS et souhaite par la présente renforcer celle-ci. Au nom du gouvernement et du peuple centrafricain, je félicite Monsieur le Directeur général de l'OMS pour un leadership proactif. Comme vous le savez, la RCA est un pays à faible revenu, enclavé et marqué par plusieurs décennies de conflits politico-militaires et d'instabilité, ayant entraîné l'effondrement du système de santé avec comme conséquence le deuxième taux de mortalité maternelle le plus élevé du monde, ainsi que des flambées épidémiques auxquelles les enfants payent un lourd tribut. À cela s'ajoutent des frontières poreuses, de transmission transfrontalière. Dans ce contexte, l'explosion-19 est une menace de trop pour la santé de la mère et de l'enfant centrafricain. Depuis la détection du premier cas de COVID-19 en Centrafrique le 14 mars dernier, la mise en train de la riposte sous la haute direction du président de la République a fait que notre pays a pu résister à un choc initial majeur. Toutefois, la République centrafricaine se trouve à un tournant de l'épidémie de Covid qui se caractérise par une augmentation rapide du nombre de cas importés et autochtones. En date du 18 mai 2020, nous avons enregistré 366 cas confirmés, 13 guéris et 0 décès, alors que nous étions à 12 cas il y a environ un mois. Avec une capacité très limitée de prise en charge, il nous faut rapidement cette progression fulgurante de l'épidémie et éviter le pire. Mais notre élan de riposte risque de s'arrêter à la fin de ce mois de mai. Notre réserve en test de dépistage s'épuise dans ce monde. C'est ici l'occasion de lancer un cri de détresse à l'OMS et toutes les bonnes volontés. Dans cette optique, la RCA félicite l'OMS pour mettre en place un grand nombre de partenaires, la plateforme pour l'approvisionnement des intrants essentiels pour la lutte contre la COVID-19. Néanmoins, cela a pris trop de temps et jusqu'à présent, nous n'avons encore reçu aucun de ces intrants. Et sans les donations d'une fondation privée chinoise, nous n'aurions pas pu mener la réponse comme nous l'avons fait. Je prie donc les OMS et les partenaires de se montrer plus attentifs et plus vigilants aux conditions des pays fragiles dans cette lutte. En outre, que des efforts soient consentis pour adapter les procédures de financement aux situations d'urgence. Trop souvent, les annonces d'aide et la réalisation de ces frontières sont trop décalées dans le temps. La façon de donner vaut mieux que ce que l'on donne. Tout en appliquant la solidarité mondiale sans précédent contre la COVID-19. Je voudrais remercier particulièrement
Your Excellency, we would kindly ask you to conclude.
La célérité et la flexibilité de leur contribution, notamment l'OMS, l'UNICEF. La mission intégrée, l'Institut Pasteur, la Croix-Rouge, l'Union européenne, l'Agence de coopération italienne, la Banque mondiale et la République populaire de Chine. L'appui de la Chine a été crucial par la livraison des tests et des équipements qui ont permis de lancer une grande campagne sur l'état du territoire. Enfin, Monsieur le Président, la SDA unitaire tient au principe d'une seule Chine. Merci de votre attention.
Thank you, Your Excellency. I apologize for announcing Nicaragua. We already heard their statements. Now we go to Benin. Benin, you have the floor.
Madame la Présidente, Mesdames et Messieurs, le Bénin, à l'instar des autres pays, est touché par la pandémie de la COVID-19 depuis le 16 mars 2020. Pour faire face à cette pandémie, le Bénin a adopté les mesures barrières, y compris le port obligatoire de masques et les mesures de limitation de mouvement. Un cordon sanitaire isolant la capitale des principales agglomérations qui l'entourent a été mis en place sur 40 jours. Une reprise progressive des activités est amorcée depuis le 11 mai 2020. Le peuple béninois reste engagé côté de son gouvernement pour la poursuite de la riposte et exprime son soutien aux actions de l'OMS et de son directeur général. Le Bénin souligne l'importance de poursuivre et d'étendre au plus grand nombre de personnes l'accès au diagnostic, notamment par une réflexion plus approfondie sur l'utilisation des tests de diagnostic rapide dans les régions où la disponibilité des laboratoires est problématique. Nous attirons également l'attention de la communauté internationale sur la nécessité d'œuvrer en vue de faciliter l'accès aux médicaments et autres produits et équipements médicaux pour la riposte à la COVID-19. Le Bénin remercie l'OMS et les autres partenaires techniques et financiers pour l'assistance très appréciée accordée au Bénin dans la riposte à la COVID-19 et les exhorte à appuyer les pays en développement dans leurs efforts et initiatives visant à renforcer leur système de santé. Aussi, le Bénin sollicite-t-il le maintien de l'appui extérieur aux actions de riposte contre la pandémie, y compris la mitigation des impacts socio-économiques. Je vous remercie.
Merci, Monsieur le Ministre. We are now continuing with international organizations. I would like to invite UNFPA to be followed by International Organization for Migration. UNFPA, you have the floor.
Colleagues, friends, in welcoming this World Health Assembly's focus on COVID-19, UNFPA wishes to express alarm about the pandemic's impact upon women and girls. Access to life-saving sexual and reproductive health services is under threat as resources are diverted and global supply chains are disrupted. Reports of sexual and gender-based violence are sharply increasing, just as prevention and response services are strained. Nevertheless, we are rising to this extraordinary challenge, including in humanitarian situations. Our support to countries with weak health systems helps maintain sexual and reproductive health information and services for women and young people. It helps prevent and respond to sexual and gender-based violence, including a halt to child marriages and female genital mutilation. And we are assisting with protection of health workers, including midwives, so no woman dies while giving life. With such sustained investments in the face of the pandemic, we can indeed build back better and attain health for all and all the Sustainable Development Goals. UNFPA stands proudly with the World Health Organization and all our partners, with governments, and with the people we serve on the ground in over 150 locations, confident that after COVID-19, we emerge stronger and together deliver a healthier future for women and girls and everyone, everywhere.
Thank you for your patience. This morning when we began our session, I proposed a very ambitious course of action. There were many delegates who took the floor and made statements. However, given the hour, I propose that we suspend this item and take any further speakers tomorrow. Tomorrow we will also consider the draft resolution. However, before closing the session for today, I would like to now give the floor to those delegations that requested to exercise their right of reply earlier in the day or would like to make such requests now. I would like to kindly recall my earlier request that in delivering a right of reply, delegations be as brief as possible, taking into account that at this meeting, interventions themselves are limited to 2 minutes. If delegations could kindly interrupt the word brief relative to the time allotted for interventions, I would greatly appreciate that. And finally, if there are subsequent requests by delegations for additional rights of reply concerning the same matter as previous replies, may I kindly request delegations to limit such statements to 30 seconds or less. Again, I hope delegations will understand that these requests are made in our common interests in the good order of our proceedings. I shall now give the floor to China. China, you have the floor now, please.
Hello, Chair. This is China. I think our colleague. That's right. Okay.
主席女士，中国代表团大会议事规则第57条，行使裁决权，经协商，各方决定本次举行大会不讨论这个提案，以免干扰大会进行。但是遗憾的是，涉台作战考试严重违反联合国和这个相关的破坏全球团结抗疫的努力。中方对此严正抗议反对。中方重申，对于中国台湾参与国际组织活动问题，必须在一个中国的原则下，通过两岸协商做出合情合理的安排。台湾当局拒不接受一中原则，其参加世卫大会的政治基础已经不复存在。疫情发生以来，通过两岸渠道与中方与世卫组织做出的安排，台湾地区一直能够获得相关信息，参与必要的技术活动。所谓台湾地区与国际防疫体系缺口，完全是政治炒作。政治目的就是在国际上制造两个中国或一中一台，但是这样的图谋绝不可能得逞。中国方奉劝有关国家把精力更多在疫情保控和拯救生命上，对本国人民和国际社会承担起应尽的责任。抗疫对抗分歧不得人心，团结合作才是战胜疫情的唯一途径。谢谢。
I now give the floor to the United States.
Thank you, Madam President. Given the lateness of the matter, I will briefly consider several U.S. concerns and will submit the entirety of our statement for the record. Regarding the United States again asks that the forum remain with technical exchanges of information related to public health and not one used for political agenda. However, given the earlier statement by Iran, the United States will exercise its right of reply. The United States has and continues to offer humanitarian assistance to the Iranian people to help address the coronavirus outbreak. The United States maintains broad authorizations, exemptions, and exceptions that allow for the sale of food, agricultural commodities, medicine, and medical devices by U.S. personnel working in the United States to Iran, and similar exceptions apply for foreign persons providing aid. Our sanctions are not an obstacle to providing humanitarian aid to Iran. Regarding Cuba's statement, the United States wishes to call out Cuba's appalling and egregious choice of words. Their reference to genocide is deeply offensive and dismissive to the victims of actual genocides that have occurred. For decades, the U.S. embargo on Cuba included broad exemptions and authorizations that permitted the sale and donation of agricultural products, medicine, medical devices, and other humanitarian supplies with billions of dollars of goods authorized for export to Cuba since 1992. Under this administration, all applications for licenses to send medical goods to Cuba have been approved. In 2019 alone, the United States exported at least $3.7 million of medicines and medical products. Regarding Syria's statement, the U.S. Syria sanctions program does not target the provision of humanitarian goods, including medicine, medical supplies, and food to Syria. The United States already provides exemptions and licenses for humanitarian aid and medical supplies to reach the Syrian people and has done so for many years, including U.S.-funded humanitarian aid to regime-held areas. The United States so far has provided more than $31 million in humanitarian assistance to Syria to counter COVID-19. This comes in addition to more than $10.6 billion the United States has provided in humanitarian support to Syrians since the conflict began. Finally, in conclusion, Madam Chair, the COVID-19 pandemic makes clear the urgency of engaging all public health authorities and the value of exchanging lessons learned in real time. As the WHO is charged with protecting our advancing global health, it is essential to include these authorities, especially those with first-hand experience in combating COVID-19. We ask the WHO to exercise leadership, independence, and inclusivity, and fully involve Taiwan in the global COVID-19 response, including Taiwan's participation as an observer in the resumed 73rd World Health Assembly session. Thank you.
Thank you. Having come to the end of the session for today, I would like to thank you for joining us and remind you that the next plenary will reconvene tomorrow at 12 Central European Time. Thank you.